Gentlemen, welcome to this morning's budget presentation of the Department of Health. For 2.5 years, the country experienced a health crisis like no other. It was unprecedented in scale, scope, and impact. Walang katulad. Wala rin katulad ang mga aral na dulot nito. As our economy reopens, and as we continue our journey towards recovery, the Department of Health will continue to play an indispensable role. It's not just about addressing the pandemic, but in taking care of the general health and welfare of our people. Apart from COVID-19 and its attendant problems, the country continues to suffer from debilitating diseases. Hence, we must ensure that there are enough funds to construct more hospitals, health facilities, and we also need to prioritize non-COVID medical needs like reproductive health, non-communicable diseases like diabetes, kidney and heart disease, research and development, and even international cooperation, among others. Thus, in today's deliberation for the 2023 DOH budget, we will endeavor to learn the hard lessons the pandemic taught us. We will use those learnings to serve our countrymen better. After all, the health of our economy depends on the health of our people, and our country's recovery depends on the physical, financial, and mental recovery of all Filipinos. That is why DOH deserves all the support. Thank you and good morning to all.
Mr. Chair,
Yes, please proceed.
gusto ko lang pong ipakilala ang sponsors ng DOH budget. Ako po ang inyong lead sponsor. So, kasama ko rin po ang, marami pang co-sponsors na kasama. We have Representative Angelica Natasha Co of the BHW party list. We have former DOH Secretary Representative Janet Garin of the 1st District of Iloilo. We have Representative Roy Loyola of the 5th District of Cavite. And Representative Dr. Maria Lucille Nava of the Lone District of Guimaras. We have Representative Maria Rachel J. Arenas of the 3rd District of Pangasinan. And finally, Representative Joseph Biolago of the 2nd District of Nueva Ecija. So marami po kayong mga magiging sundalo sa mga plenary debates. Sana po tulungan niyo po kami. Before we proceed, Mr. Chair, allow me to give a few sponsorship remarks. Muli, isang magandang umaga po sa ating lahat. Isa pong karangalan na maging lead sponsor ng DOH budget. This year, the DOH and its attached agencies' proposed budget amounts to about 196 billion. PhilHealth's budgetary support is at 102 billion. And the total proposed budget for DOH specialty hospitals like the Philippine Heart Center is at 4.98 billion. So pinag-uusapan natin ngayong umaga is about 301 billion. Hindi pa po tapos ang pandemya. Kailangan pa rin ng budget para sa vaccines, medical supplies, at para sa frontliner allowances. Pero tila mas kontrolado na ang COVID situation dahil sa bakuna. Higit 2,000 na lang ang new cases per day last week. Di hamak na mas mababa sa 36,000 new cases per day noong Enero. Gayunpaman, kailangan pang paigtingin ang COVID immunization lalo na po sa kabataan. We need to plan for the country's health needs beyond the pandemic response. This is central to the 8-point socioeconomic agenda of the new administration's medium-term fiscal framework. We should improve access to quality healthcare and work on the two important goals of the Universal Healthcare Law. First is PhilHealth universal coverage, and number two, having a primary care provider for every Filipino. Nang ibig sabihin, meron dapat identified na healthcare provider na aalaga sa bawat Filipino. Up to today, 4 out of 10 Filipinos die without seeing a doctor. Marami pang health concerns tulad ng mental health ang di nabibigyan ng sapat na atensyon. Pinakamababa din ang bilang ng hospital beds ng Pilipinas sa buong ASEAN. 5 hospital beds per 10,000 population lamang dito sa Pilipinas, sa Vietnam, 26, sa Thailand, 21. Mahaba pa or malayo pa nga habulin natin. Ang sabi nga ng Presidente, kailangan magtayo ng dagdag na specialty clinics at RHUs sa labas ng NCR. At totoo ang kasabihan na health is wealth. Pag nagkakaroon ng malubhang sakit ang isang miyembro ng pamilya, napakadaling maubos ang ipon at madaling mabaon sa utang kahit na ang mga middle class families. Investing in health is good for the economy because a healthy workforce means a more productive workforce. The DOH is central to this endeavor as the agency is mandated to promote, protect, preserve, and restore the health of the people through the delivery of quality health services. Thus, the department's effective performance of its duties is key to economic recovery. On a personal note, I am happy that Yusek Berhere has been designated as officer in charge. Patagal ko na po siyang kasama sa pagsusulong ng health sector reform agenda na naumpisan pa noong panahon ni Secretary Quasi Romualdez. Her institutional memory, her dedication, and her cool demeanor are certainly pluses for the job of Health Secretary. So yun lang po, I look forward to a productive meeting today. Maraming salamat po. At this point, do any of the co-sponsors wish to make any opening remarks? Rep. Garin?
Thank you very much, Madam Co-Chair. Good morning to everyone, and good morning to the DOH family and its attached agencies. We are actually here this morning, face to face, because these people work through the darkest hours of the pandemic, risking their lives and even the lives of their loved ones to fulfill their mandate to serve the Filipino people. Kaya nga marami sa mga nakaharap natin ngayon ay mga hindi pa nakakapag-asawa. Don't worry, I will not be enumerating your names, but to those who are available, Yusek Plato is asking for your numbers. Maybe the Honorable Secretary is also available, Yusek. Lahat ata eh. Sorry. Coming into our third year in the midst of this global pandemic, the role of government in designing an effective and adaptive approach to COVID-19 remains high as ever. And at the forefront of all of these problems, not only now because climate change will be bringing a lot of infectious diseases, not only to the Philippines, but to the whole global community, your role is very important. And let us not forget, we are still in the midst of a lot of infectious problems. With all these priorities, we must realize that the strength of our healthcare system relies heavily on our healthcare workers, doctors, and nurses, among others. This means that their welfare and well-being must be of highest consideration in our agenda. The President echoed this as well in his SONA, highlighting the importance of a competent and efficient workforce. In the past SONA, President Marcos highlighted the priority areas when it comes to our COVID-19 response: hospital admissions, healthcare utilization, vaccine booster rollout, and many others. However, this is not the only issue that DOH is taking care of. You have to live with the new normal, guide us, but should never forget that existing global and public health problems is still a priority. Marami po kaming mga itatanong mamaya, but please don't take this against us. We are here because we want to collaborate. We want to be more effective. We want to be efficient. Dahil sa panahon ngayon, bawat buhay mahalaga. Ito dapat ang magsilbing gabay natin sa pagbuo ng budget ng kagawaran ng kalusugan. We are here to give our all-out support and guide you in your priorities and make sure that every centavo that goes to the Department of Health is spent on programs that will help us ensure the health and well-being of every Filipino. Maraming salamat po.
Okay, salamat, Rep. Garin. At this point in time, we now proceed to the budget presentation. And
Madam Chair, point of order, Madam Chair. Madam Chair, Congressman Khalid Dimopor over here.
Yes.
I reviewed the presentation of DOH. It's roughly 30 slides long.
Yes.
At 1 minute per slide, that's already 30 minutes. 2 minutes, that's 1 hour. 3 minutes, that's 1 hour and a half. I'd like to request to the chair, if it's possible, that we restrain it to about 30 minutes.
Yes, I was about to actually propose to, if you can limit your presentation to 10 minutes, considering that we all have copies of your presentation. Napag-aralan na po namin ito dahil excited po kaming lahat dito. Baka kung pwede po, dumiretso na lang tayo sa ating budget proposal, highlighting the increases and decreases per program, and then perhaps end with your requests or budget appeals to Congress. 10 to 15 minutes, ma'am, if that's okay. Thank you.
So, thank you very much. Good morning po to Chairperson Kong, Honorable Congressman Ko, Senior Vice Chairperson Congresswoman Kimbo, and all of the Vice Chairpersons present, and all of the members of the Committee on Appropriations. So, we will just be giving a very brief presentation just to highlight our 2023 budget and appeals that we are making for this 2023 budget. So can we have the slides, please? So for this slide, we just like to show the trend of the budget of DOH. Next slide, please. From 2018. So we will see that we are 10% higher than the 2022 GAA level. However, for the DOH Office of the Secretary, the 2023 National Expenditure Program is only 4% higher than its previous level. So next slide, please. So in the 2023 National Expenditure Program, the DOH, OSEC, and its attached agencies were given a total of 301 billion pesos to implement our programs and strategies. Out of this 301 billion, majority or 65% is allocated to the DOH Office of the Secretary, amounting to 196 billion. The rest of the budget is allocated to our DOH attached agencies and corporations, which comprises 35% of the DOH budget. Of this amount, 100 billion pesos or 33% is allocated for PhilHealth premium subsidies for indirect contributors and the benefit package improvement. So you will notice that the budget level of most of our attached agencies and corporations have decreased in the 2023 National Expenditure Program. Next slide, please. So now for the DOH OSEC budget, which is about 65%, approximately 48% of this is for our MOOE, 40% is for personal services, and 12% is for capital outlay. Next slide. The bulk of our budget will be dedicated to our operations at roughly 90%. Specifically, 45% of the said allocation will be to improve access to promotive and preventive healthcare services, 33% for curative and rehabilitative healthcare services, 0.5% to ensure access to safe and quality health commodities, devices, and facilities, and lastly, 11% to assure people access to social health protection. Next slide. This slide will show the top 10 major cost drivers in our 2023 DOH net budget. Each item will be discussed in brief in the next slides. Next slide. First is our operations of our DOH hospitals. In the 2023 NEP, there is a total of 61 billion pesos allocated for salaries of personnel and operations of our 79 DOH hospitals. For MOE, the DOH used a formula to consider the emergency room, outpatient, and inpatient costs, average hospital income for the past 2 years, quantified free services, hospital scorecard, functionality of public health units, and specialty centers as apex hospitals. And for the capital outlays, these are for those hospitals with approved multi-year obligational authority. So for our health facilities enhancement program, which is number 2, a total of 23 billion pesos is allocated for the procurement of infrastructure and medical equipments. And for the said amount, we have 2 billion pesos for 1,188 barangay health stations, 5.6 billion pesos for 688 rural health units, 2.7 billion pesos is for 154 LGU hospitals, 11.2 billion pesos is for 82 DOH hospitals, of which 10 are specialty centers, and 1.3 billion pesos is for 55 other health facilities. So next slide, please. Next is our medical assistance to indigent and financially incapacitated patients. In our 2023 NEP, a total of 22 billion pesos is allocated for the medical and financial assistance through our DOH malasakit centers for approximately 2.2 million patients at an average cost of 10,000 pesos each. The next PAP shows the breakdown of our health emergency allowance and compensation. So here we have 1 billion each for the compensation from programmed and unprogrammed funds. On the other hand, the 37 billion total budget for health emergency allowance is comprised of 19 billion programmed and 18 billion unprogrammed funds to cover only around 6 months of services rendered by over 805,000 healthcare workers and non-healthcare workers. However, this funding is inadequate as we will be needing a total of 76 billion requirement for the entire year of 2023. Likewise, we have an additional 65 billion pesos unfunded in our 2023 NEP for us to pay our arrears to our healthcare workers from 2021 to 2022. Next slide, please. The next major cost driver is our National Healthcare Workforce Support System. This is formerly known as our Health Human Resources for Health Deployment Program, amounting to 16.9 billion pesos. This will be used to deploy 21,547 health human resources for health nationwide and providing 2,539 pre-service scholarship grants to aspiring medical and allied healthcare professionals. The next cost driver is our family health, immunization, nutrition, and responsible parenting with 8.26 billion pesos allocation in our NEP for 2023. This is for us to procure commodities for immunization, nutrition, oral health, family planning, and responsible parenting services. The major activities under this line item also include the provision of routine vaccines to more than 2 million children aged less than 1 year old and the provision of family planning commodities to at least 3 million women. Next slide, please. The next major cost driver is the prevention and control of communicable diseases with a total of 5.84 billion pesos allocated for the procurement of commodities for the diagnosis, prevention, treatment, and control of infectious diseases. The decrease in the budget from 2022 General Appropriations to our 2023 NEP is due to the removal of our PPEs and gene expert cartridges for COVID-19, given the available supply, changes in our COVID-19 testing protocols, and of course, a decrease in the number of cases as compared to the previous year. The major activities include the provision of our first-line TB drugs to more than 150,000 adult and pediatric TB patients, and the provision of antiretroviral therapy to more than 60,000 adults and more than 100 children. Meanwhile, a total of 4.8 billion pesos is allocated for our public health management for the implementation of our public health programs through our development of policies, capacity building, research, and advocacy. Also, the development and updating of our clinical practice guidelines on UHC priority conditions and COVID-19. The next major cost driver is our health promotions. A total of 2.14 billion pesos is allocated, which is 1% of the total budget of DOH as mandated in the UHC law. The major activities include the development of healthy public policies, the implementation of health impact assessment and participatory action research, healthy settings, and social and behavioral change communication campaigns. And the last cost driver is the prevention and control of non-communicable diseases, amounting to 2.1 billion pesos. This will cover the provision of mental health commodities to at least 213 access sites and the provision of cancer commodities to at least 28 access sites. Next slide. So we'd also like to highlight a total of 100.23 billion pesos is allocated for PhilHealth in the 2023 NEP for premium subsidy of indirect contributors amounting to 79 billion derived from our sin taxes, 61 million for Pamana beneficiaries, and 21 billion for benefit package improvement under the Universal Healthcare Law. So that is all, Madam Chair, Madam Senior Vice Chairperson, and Honorable Chairperson. Over to you, ma'am. Thank you.
Salamat. That was certainly the most efficient budget briefing we've ever had. She started at 11 minutes past 10. It's only 10:20. So 9 minutes, Rep. Dimaporo. All right, so excited po lahat. Marami pong nakalista. So we now formally open the floor to questions, but some reminders first. Each member will have only 5 minutes for his or her questions. Hindi po kasama sa 5 minutes ang sagot ng ating resource persons. So if you wish to end early tonight, I highly encourage you to answer directly, completely, yet concisely. And we have a long-standing tradition in the House of Representatives where we accord preferential treatment to the minority members. So they will begin interpellation, they will be followed by the majority members, and that will be done in an alternating manner. So, at this point, the chair recognizes from the minority for his interpellation, Minority Leader Marcelino Libanan. Mukhang wala si Minority Leader, so we'll proceed. The next one listed for the minority, the chair recognizes Representative Raul Manuel.
Good morning, Madam Chair. Good morning sa mga opisyal ng DOH na nandito ngayon sa Kongreso. Una ko pong tanong ay tungkol sa ating DOH hospitals. Kasi inaral din po natin yung budget na pinopropose this year tsaka yung natatanggap ngayong taon. Gusto ko pong malaman kung magkano ang proposal ng DOH na sinumite sa DBM para sa budget ng ating DOH hospitals.
Madam Secretary.
Yes, Madam Chairperson and Vice Chairperson and Congressman, we have proposed po 32.8 billion for our MOE for our regional hospitals for DOH. And there is this separate for the operations of DOH hospitals in Metro Manila, where we have proposed additional 10 billion pesos. But we were only approved 13.2 billion for our DOH regional hospitals, and we were only approved 4.9 billion for our DOH Metro Manila hospitals, Mr. Chair.
Yes, Madam Chair, kaya ako siya natanong dahil pwedeng maging iba yung ating impression dun sa example, we see quantitative increases dun sa total DOH budget, pero kung ikukumpara dun sa proposal at sa aktual na pangangailangan, hindi pa rin nakakasapat kung ano yung nasa NEP natin. Halimbawa sa Amang Rodriguez Memorial Medical Center, ang request nila ay nasa 1 billion na mas mataas dun sa kung magkano yung nasa NEP natin. Also, dun naman sa ating GOCC hospitals, I'd like to ask kung bakit merong kaltas dun sa assistance to indigent patients? At sino po yung nag-propose nung kaltas dun sa funding na ito? Kasi mula sa 4.93 billion sa GAA 2022, ito ay nasa 4.66 na lang billion pesos for NEP.
Madam Secretary.
Yes, Madam Vice Chairperson, according to our unit, it was returned back or reverted back by the Department of Budget and Management to the NEP level of 2022.
Ibig sabihin DBM ba yung nagkaltas?
Yes, yes po. It was proposed and then it was reverted back by the Department of Budget and Management to the 2022 level.
Okay. Madam Chair, does DOH have an estimate kung ilang may hirap na mga pasyente yung pwedeng maapektuhan ng ganitong difference sa JA 2022 tsaka yung NEP 2023?
Madam Vice Chairperson and Kong, we peg our medical assistance to our indigents at 10,000 pesos per individual. So if we are looking at this cut, so we multiply it with 10,000, then that's kinukuha po namin ngayon yung numbers that might be affected.
Okay. So kung yung difference kasi natin ay nasa 271 million pesos, tapos yung assistance na nabanggit ay 10,000, tama po ba? So kung i-compute natin yon, nasa 27,000 patients yung maaapektuhan, no? Which means ganito kadami yung pwedeng ma-deprive ng medical services kung matuloy yung ganitong proposal. Tapos napansin din natin para sa ating GOCC hospitals na walang budget for locally funded projects. Can DOH confirm this?
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman, may I refer the question to Director Nene Gorgolon for the locally funded projects, Madam Chairperson.
Director Gordolon, you are recognized.
Good morning, Madam Chair, and good morning, Honorables. We have locally funded project for GOCC, but we will just submit the appropriation, sir. We have locally funded for NKTI, PCMC, Philippine Heart Center, and Lung Center po. It's basically infrastructure and equipment po. Thank you very much. But we will submit po the allocation.
Okay. Yung mga nabanggit ba yan ay merong pondo this year or wala?
For infrastructure and equipment, yes, sir. Meron po.
Pero for next year, wala.
They also have, but for this year, it's just a matter of directly sub-allotting for them because of some documentary requirements. But they have funding for 2022 and 2023 po, Your Honor. Thank you very much.
Okay. I would like to request na lang din, Madam Chair, no, yung data tungkol dun sa corporate operating budget ng ating GOCC hospitals. Tapos yung comparison din no, dun sa budget this year tsaka yung next year, Madam Chair.
Madam Secretary, kindly take note of the data request.
We will be submitting, Sir and Madam Vice Chairperson, within the day by the end of the office hours today, sir.
Okay. Meron bang mga proposal yung ating GOCC hospitals for locally funded projects na nanganganib na pwedeng hindi magkaroon ng pondo next year?
Madam Vice Chairperson, I'll refer you to the Director Nene Gorgolon.
Director Gorgolon.
Yeah, sir. Actually, the proposal for all the hospitals, not only for GOCC amounting to 40 billion for 2023, but for DOH Hospital, we only received 11 billion. So it's 1/4 of the total proposed project. So talagang po, it's not only GOCC na talagang nakulangan ng ang budget, but for the rest of the 84 hospitals po. Salamat po.
Okay. Sunod naman, Madam Chair, tungkol ito sa capital outlay ng ating hospitals tsaka yung HFEP. Yung tanong ko po tungkol dyan, ano yung difference dun sa nilalaan sa capital outlay tsaka sa HFEP? Tsaka bakit meron pang HFEP kung posibleng direkta na siyang i-allot dun sa capital outlay ng ating mga hospital, Madam Chair?
Madam Chair, Vice Chairperson, may I refer you to Yusek Lilibeth David?
Yusek David.
Thank you, Madam Chair. Honorable Congressman. Yes, we can allot it directly into the line items of the hospitals. But collectively po kasi they are called Health Facility Enhancement Program.
Kasi kung ganun, Madam Chair, I think as of this point ay hindi pa ganun kalinaw kung ano ba yung criteria. Ano yung nilalagay sa capital outlay? Ano naman yung nilalagay pa sa HFEP? So, ano yung classification na ginagawa ng DOH to sort out yung mailalagay dun sa dalawa?
Madam Secretary, what are the guidelines for allocating each bill?
Yes, if I may again refer to you, Secretary Beth.
Please, Sec. David.
Thank you, Madam Chair and Honorable Congressman. So our health facilities enhancement program is really a general term to be composed of infrastructure, equipment, and motor vehicle proposals from the different units. At certain years po, nilalagay yan sa central office and then we have to sub-allot po to the units. But at certain years po, with consultations with DBM, pwede na rin pong ilagay directly under the line item of the hospitals. But then we usually add that all up po just to understand how much health facility enhancement program funds that the Department of Health has.
Okay. Madam Chair, dun sa pondo for capital outlay, may bahagi ba doon para sa pagpapatayo ng mga barangay health stations for 2023?
Madam Vice Chairperson, yes, we just like to confirm that there are budget, no? So we have 2 billion that will be spent for barangay health stations at 1,266 facilities po.
Madam Chair, magkano yung average na cost para sa bawat barangay health station?
Madam Vice Chairperson, again, I refer to the Director Nene Gorgolo.
Director Gorgolon.
Yeah, Madam Chair and Your Honors. Actually, for the barangay health station, we cost it at 1.5 million to 2 million, depending on the locations, especially for those BHS in GIDA area. So it's really from 1.5 to 2 million po. New construction. But in the proposal, we also have this upgrading and completion for those barangay health station previously constructed 1 year ago. Thank you very much.
Okay. Sunod, Madam Chair, meron ba tayong breakdown kung ilan ngayon sa ating mga barangay health stations yung for completion, for upgrading, tsaka for repair?
Secretary.
Yes, Madam Chair, may I refer again to Director Nene Gorgolo?
Yes, sir. Your Honors, we have the list and we can submit po. So particularly for 2023, for the total 1,268 barangay health station, the new construction will be 315. And the completion will be 951 po. And we have the list. Thank you very much.
Okay. Dun sa mga nabanggit, covered na ba yung lahat ng mga target nating i-cover sa buong bansa o meron tayong nami-miss out?
Sir, actually yung proposal for 2023, particularly for barangay health stations and to include even our rural health units and LGU hospitals, this is also affected with our national allocation framework, wherein we categorize the municipalities, provinces, and cities into high category. We have 4 categories, sir, for this classification. High category, low gap. We have. May I enumerate po, or we will just submit? So all of these BHS that are in the proposed net are only for those provinces, municipalities under high gaps with low gaps and low capacity. So this is based on the national allocation framework. So we have this because this is part of our Devolution transition plan. So for the category 4, the high capacity, low gap, beginning 2022 po, wala na po tayong infrastructure for BHS, RHUs and LGS except for GIDA areas. For category 2, low capacity and low gap beginning 2023 and that is next year. So selected na lang po yung ating yung infrastructure doon. But basically, for high capacity, high gap, for 2024, wala na po talaga tayo except for GIDA. And we follow this one, allocation for 2023 proposal. And also all those that should be in alignment with the Philippine Health Development Plan po. So we will submit all the criteria for allocation for 2023, Your Honor.
Okay. Now, Madam Chair, liban dun sa pagpapatayo ng mga barangay health station, edi after natin maipatayo yan, dapat ay natitiyak nating operational siya. So, kasama dyan yung at least isang nurse, 2 midwife, pondo para sa gamot, at iba pa. So, magkano yung ating estimated cost para sa pagtiyak na operational yung ating mga barangay health station?
Your Honor, we will just submit, we will just coordinate with HFDB for this. Thank you very much.
Pero ngayon ba ay wala tayong hawak, kahit estimate lang, given na if we are to ensure na gumagana talaga yan, at least meron tayong benchmark for costs.
That is your last question, Rep. Manuel. Madam Secretary.
Yes po. Actually, the counterparts from the local governments are expected. So if we provide the infrastructure, the equipments, and then we discuss with them that they would need to hire this healthcare manpower for them to man. So if we look at one doctor, then there's one nurse, then there's midwife, kung 2 o 3, may dentista po. Ito po yung requirement natin from local governments to fulfill so that it becomes a functional barangay health station.
Okay. Sige, Madam Chair, final manifestation na lang, no, na yun nga, given na tayo pa rin naman ay nasa road to recovery sa pandemya, tapos yung aim din natin na i-address yung iba pang mga sakit at ibang aspeto din ng kalusugan, physical man or mental health sa ating bansa, kailangang umakma yung ating mga plano for this budget, kung ano din yung pronouncements ng ating national government, dapat mag-reflect yan sa kung ano yung ating ibibigay na pondo para sa Department of Health. Lamang, Madam Chair, salamat.
Salamat, Rep. Manuel. Next to interpellate is from the independent minority. The chair recognizes Representative Elizaldy.
Thank you, Madam Chair. Madam Secretary, since the Department of Health is the chief implementer of the Reproductive Health Law and the Republic Act 10354, may we know how much specifically is the appropriation for RH services and facilities and RH commodities for 2023?
Madam Secretary.
Yes, thank you po, Congressman Lagman, Madam Vice Chairperson. For this year, for the 2023 NEP, the allocation would be for us to provide family planning commodities and other resources needed for the reproductive health bill for 3 million women. Madam Vice Chairperson and Congressman Lagman, if I may refer the question so that we can explain in detail to Yusek Beverly, if we may be allowed.
Yusek Bev.
Thank you, Chair. We have allotted a total amount of 863 million for RH, family planning commodities. This is an increase from 585 million last year. This is only for commodities. In addition, we also do have allotted amount of around 50 million for health promotion and communication campaigns related to family planning, and also grants for LGUs on setting up of adolescent and sexual reproductive health friendly health services on the ground. I can give you the details, sir, later on.
Okay. Now, there was a mention that 3 million women of reproductive age will be beneficiaries of your RH commodities. How much per capita would this be?
Yusek Bev.
This is approximately 150 pesos, sir.
annually. That is annually.
Yes, sir. 863 million divided by 3 million, sir. Sorry, that's around 250 pesos.
Madam Secretary, do you think that would be a sufficient outlay? Or do you need some more?
Madam Secretary.
Madam Vice Chairperson and Congressman Legman, considering and basing from this computation of the per capita for the 3 million out of the 863 million, we would think that this is not enough. But we also have other sectors which are other agencies which are also providing support, and the development partners. That's why we have just asked for this. But if there would be some room for us to be given additional, and that would mean a lot for our women, Congressman Legman.
And how many Filipino women of reproductive age are recorded? Yes. Filipino women of reproductive, how many million? Currently?
Almost 3.3 million women.
Ilan lahat?
3 million.
3 million only? Ah.
100
Mahirap.
hindi ba pwede? Ang liit to. 33% of population of productive women in the
Madam Vice
Secretary.
Yes, Congressman Legman, if we do our estimates of our women of reproductive age, is usually pegged based on international standards at around 3 to 3.5% of the total population.
So how much would that be?
And that would mean around 3.3 million women of reproductive age.
Only? Huh?
Yes, Congressman Legman.
And what is the contraceptive prevalence rate currently?
Yusek Bev.
The CPR, modern contraceptive prevalence rate, is at 58.7% now.
And how does that compare with other countries like in South America and in Europe?
Definitely, sir, we have a lot to improve on.
Okay. If we have a lot to improve on, I think we should need more appropriation in order to catch up with the other countries. Now, Madam Secretary, because of the importance of reproductive health, there's a law on that. It has been constitutionalized by the Supreme Court. And no sustainable human development can succeed without addressing the issues of population and reproductive health. Don't you think we should reflect in your budget a separate item solely for reproductive health services and commodities, rather than hide it into the family health, immunization, nutrition, and responsible parenting? Gumawa tayo ng hiwalay na bahay. Would you agree?
Yusek Bev.
Yes, sir. We will be very supportive of that.
Okay, kindly give us your proposal on how to have a separate item or label for reproductive health services and commodities, and how much would you need in addition to what has been proposed in the National Expenditure Program? Madam Secretary, what is the official stand of the DOH on the wearing of face masks outdoors?
Madam Secretary.
Madam Vice Chairperson and Congressman Lagman, when the position of the department is for us to continue the wearing of the face mask still outdoors, but during the interagency task force meeting, several evidences were presented by the other sectors. And for us to meet that compromise, because of that collegial agreements between and among the members, we said that it can be, because there was this WHO also pronouncement last May, that masking can be focused on those most vulnerable. So we did that compromise whereby we have agreed that the masking outdoors will be lifted only among low-risk individuals and low-risk settings. So meaning, sir, that masking will just be optional for those who are non-vulnerable. Hindi po pwede sa senior citizens, hindi po pwede dun sa may sakit, hindi po pwede sa mga bata, sa transport sector, and dapat hindi po crowded ang lugar, tsaka maayos po ang daloy ng hangin.
So in other words, like legislation, the wearing of face masks outdoors can be a subject of compromise.
Madam Secretary.
We balance, Congressman Lagman and Madam Vice Chairperson, the perspective of health and the perspective of economy. And the Department of Health, as having that mandate to protect the population from ill health, not really to compromise, but for us to ensure that even if we lift the masking, we can still protect the most vulnerable, who are the most are the ones which we are protecting from getting admitted or getting severe. So it's not really about it's not really compromising, but just balancing the decisions made as one government approach to COVID-19.
Okay. I use compromise because I pick it up from your own statement. Okay. Now, how many Filipinos have died of COVID-19 and its complications since the onslaught of the pandemic?
Yes, Madam Vice Chairperson and Congressman Lagman, we have around 62,249 deaths cumulative from the start of the pandemic, Congressman.
And how many of that number belong to the medical profession and related vocations?
Madam Vice Chairperson, can we recognize Director Thea de Guzman from our Epidemiology Bureau?
Director de Guzman.
Good morning, Madam Chair. Yes, Congressman, we have recorded a total of 125 healthcare worker deaths. This comprises around 0.4% of the total 33,000 healthcare worker cases since the start of the pandemic.
It's a very small number.
Yes, Mr. Chair. Although the majority of these deaths occurred in 2020 po.
Anyway.
But starting 2021, as well as with the introduction of our vaccines, we have seen significantly lower number of
Could you please submit to us the data?
Yes, Madam Chair.
Since the beginning of the pandemic.
Yes.
Okay. Now, how many billions of pesos has the country spent on related programs and activities in combating the COVID-19 pandemic?
Madam
Secretary.
Yes po, Madam Vice Chairperson, can we give in 1 minute just to get the figures for this, Congressman Lagman and Madam Vice Chairperson?
Rep. Lagman, do you wish to proceed to your next question? Well,
Yes. I would like also to know how much is appropriated in the DOH proposed budget for 2023 to combat the continuing COVID-19 pandemic. And kindly disaggregate into categories of expense items.
Madam Secretary, what is the COVID response budget of the department for 2023?
Yes, Madam Vice Chairperson, for the 2023 budget, we have proposed 95 billion for the COVID-19 response. And the approved for the NEP 2023 was just 24.49 billion, Madam Vice Chairperson and Congressman Legman.
Is that sufficient?
Looking at how we are having right now, going through this declining number of cases, we think that this would be sufficient based on the response that we're having right now. But if we are going to prepare to procure the new generation of vaccines, we might be needing additional funds, Mr. Chair. Madam Vice Chairperson and Congressman Legman.
Are we now seeing or witnessing the tail end of the pandemic?
Madam Vice Chairperson and Congressman Legman, we cannot say that we are looking at the end of the pandemic already as of this time because the state of endemicity would require that there is high population immunity, which we do not have right now. So even though the number of cases are declining, virus still would mutate expectedly. And we need our wall of immunity or the population's immunity high so that even though we go through the new normal already, we are prepared and our most vulnerable are protected.
There were newspaper accounts several weeks ago that the wall of immunity is declining, if not crumbling. What is meant by that?
Yes, Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Legman. Yes, there had been evidences already that the immunity has been affected because of the subvariant Omicron. So the immunity that we had for our first 2 doses of our vaccines was affected, and therefore it is based on the evidence that the immunity is already waning. And based on the assumptions of our experts right now, that by this time, towards the end of the year, because progressive po yung mga nababakunahan for pag hindi pa ho nag-receive ng first booster, yun pong ating eligible population, the immunity of the population will wane, and therefore there will be increase in the admissions in our hospitals.
To our former APRO Chair, Rep. Lagman, gentle reminder po to kindly wind up.
Okay. When is the Philippines going to start administering the COVID-19 boosters for the newer variants of the disease?
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Legman. We are now in the process of discussions with the manufacturers of these new generation vaccines. These new generation vaccines, based on their studies, would be targeting or can cover both the original strain of the COVID-19 virus and the Omicron variant. So with these 2 manufacturers, which already have finished their studies and are getting their registration or approval in the US, nakipag-usap na po tayo, Congressman Lagman, and inaayos lang po yung term sheets. And doon naman sa isang manufacturer, we still have these discussions over the non-disclosure agreement. So we are estimating, hopefully, if we can be able to proceed with these transactions, by first quarter of next year, we'll be able to procure these new generation vaccines.
Rep. Lagman, do you wish to make closing remarks?
No, I have other questions, but it's hard to make a closing remarks for a very important agency. But let me thank you, Madam Chair and Madam Secretary, for your candid answers. Maraming salamat.
Salamat, Rep. Lagman. We now move to the majority. First on the list is our co-sponsor, former DOH Secretary, Representative Janet Garin.
Thank you very much, ma'am. Let me go to the increase and decrease in budget. So, Madam Chair, let me start with the prevention and control of communicable diseases kasi napaka-importante po nito. If we look at the comparison of the 2022 budget vis-a-vis the 2023 proposed budget, there is a reduction of 71.21%. Ang ibig po sabihin nito, yung pondo sa communicable diseases, kung saan kasama ang COVID, TB, HIV, leptospirosis, monkeypox, Japanese encephalitis at marami pa po iba ay tinapyasan ng 4,170,853 pesos. Can the Honorable Secretary confirm this, Madam Chair?
Yes, Madam Chair and Congresswoman Garin. Yes, we confirm that, Madam Chair and Congresswoman Garin, this is because we are not going to procure PPEs and gene expert cartridges anymore for this 2023 because we have enough stocks to last.
Yes, that's well taken, Madam Chair. Unfortunately, pag sinabi po kasi natin prevention and control of communicable diseases, hindi lang naman po PPE at gene expert cartridges ang kailangan. I'm also seeing that bulk of these funds was transferred to the Health Promotion Office and to the blood centers and other voluntary blood services. Laudable naman po ang programa. Pero mahirap po kasing i-explain sa taong bayan na ang tinapyas natin, although it is for the procurement of PPEs and gene expert cartridges, if we talk about the program of communicable diseases, at nasabi nyo nga kanina, marami pa tayong challenges. Di ba itong pondo na to pwedeng ibili ng gamot kontra COVID? Pwedeng ibili ng mga PPEs kung may monkeypox tayo. Pwedeng gamitin dun pa sa ibang pangangailangan. My point is, the pandemic is not yet over. Bakit natin tatapyasan yung ating control of communicable diseases ng 4.17 billion, Madam Chair? Be that as it may, let me look forward let me move forward to the other concern. Kasi maganda naman po ang health promotion. But if we are going to look at the breakdown, there is policy development, capacity building, advocacy, maganda po ito. Pero babalik po kasi tayo. Mas importante ba yung health impact assessment at participatory action research kesa sa salbahin natin ang ating mga kababayan because we are in dire need of funds. Pangalawa po, Madam Chair. Earlier, the question on where the sin taxes is coming from was asked. May I inquire from the DOH family if indeed it is true that the Health and Facility Enhancement Program, the drastic increase, was by virtue of the sin taxes in 2012?
Madam Chairperson and Congresswoman Garin, yes po, we confirm that the increases for our health facilities enhancement and the other priority programs was born out of the fact that we have the sin taxes revenues.
Ibig pong sabihin, this is dependent on the sin tax collection.
Yes po. Most
Are we expecting a reduced sin tax collection dahil nung nakaraang 2 taon, medyo sarado ang Pilipinas. So ang expectation ba natin by next year, the formula that will be generated as to the sin tax collection earmarked for HFEP can possibly go down?
Yes, Madam Chairperson and Congresswoman Garina, the potential is there. Potentially that can be reduced. But right now we are lobbying for the sin taxes for the sweetened beverages and the junk food. So hopefully that can also augment whatever we will need for our priority program.
So yung implementation ng mga bagong buwis ang kailangan. Okay. On HFEP, the website of the Department of Health enumerates 3 major purposes of HFEP. First is to activate catchment areas like rural health units, urban health centers, the BMOC and the CMO. Second is to actually empower and capacitate devolved institutions so that they will act as gatekeeper and avoid congestion of tertiary centers. And third, to expand the existing tertiary hospitals so that they will focus on teaching and training capacities. Yan po ang 3 mayor na layunin ng HFEP. Can the Honorable Secretary confirm this, please?
Madam Secretary? Yes, Madam Chair and Congresswoman Garin, we confirm that those are the different objectives for HFEP.
Yun ang talagang layunin ng HFEP, wala nang iba po.
Yes, Madam Chairperson and Congressman Garin. Yes po.
In an internal document of the Department of Health, while I am saying that construction, improvement, and repair of offices is also important, by virtue of its obligation and official definition, repair and construction of offices does not fall under HFEP. Am I right, DOH family?
Yes, Madam Chairperson and Congressman Garin. Yes, you are right, Congresswoman Garin. The HFEP is for direct services.
Yes, so Madam Chair, just for the record, I am not objecting to the construction of regional offices nor the repair, but I'm just pointing out na mas streamline. Last question, Madam Chair. We have a DBM representative in here. If we talk about multi-year obligation allotment, ang ibig po ba sabihin nito ay single bidding and then annual release? Or can you bid every year and release it? So yan po yung aking tanong, and may we inquire if splitting is a violation of rules and can lead to several cases. And my last question to the DBM, if you talk of a proposed mayowa, hindi siya dapat mayowa. What I'm pointing it, just to align, kung yung HFEP ay hindi kasiguraduhan, yung mga ospital na nakalista, they will plan according to what the annual budget is. Para naman po hindi sila magplano ng, let's say, 1 billion worth of project, kasi iisipin nila andyan annually, tapos mapipilitan tayong hanapan. Kumbaga kung meron silang 100 ngayon, hindi naman yan mayowa. They should plan that 100 million will result to a usable infrastructure or an operational equipment.
We have DBM representative joining us via Zoom, Director Sofia Yanto Abad. You are recognized. Director Abad.
Good morning, Your Honors.
Good morning.
May I request
respond to the questions?
The chair to please repeat the question.
Rep. Garin, could you kindly summarize the three questions?
First question is, kung mayowa po ba, does it mean single bidding and annual release? Or pwede bang i-split siya na magbibid bawat taon pagkatapos naka-earmark lang? Second is splitting a criminal act and subject to cases because we need to orient DOH to protect them from further cases. And last, can you say proposed mayowa kung wala pang approval, or does it mean that the design of the specific hospital will have to limit to what is their annual allocation? Thank you, Madam Chair.
Director Abad.
Yes, the mayoma po should cover the project that extends actually to multiple periods. Under our rules also, the splitting of contracts for procurement is also not allowed, and as mentioned by the Honorable Congressman, is punishable. So, pag nag-i-issue po tayo ng mayowa, dapat there should be a single bidding that will cover all the project that is expected to be implemented across multiple periods.
Okay.
Yeah, and the next question, Madam Chair, yung last question. Kapag sinabing proposed mayowa of 500 million, but the release this year is 100 million, is it our understanding that there is no mayowa, kaya yung gagamitan nila ng 100 million should be the basis, not the 500 million, para po yung kanilang gagawin na programa ay magagamit na. We will not end up with a white elephant. Simply saying it's living within the budget for that specific year. Kasi hindi naman sigurado. Hindi mo itatali ang HFEP dahil hindi mo pa alam kung magkano ang papasok.
All right, so
Madam Chair, can the DBM comment if that is the correct practice?
Director Abad. Director Abad, did you hear Rep.
Nakamute
Garin's last
siya.
comment?
Nakamute siya.
Kindly unmute yourself, Director Abad.
Nakamute siya. Nakamute siya. Explain siya na.
Director Abad, kindly unmute yourself.
Yes, Madam Chair, we'd like to clarify also that the MAYOA authorizes the agency to enter into multi-year contract. But actually, the releases for the year shall only cover the annual requirement for the project. So if the MAYOA is 500 million, but the annual requirement is only 100 million, then only 100 million will be issued for the year.
Madam Chair, just to clarify, I think the question was not captured. Meron pong proposed MAYOA. Ibig sabihin, hindi pa approved. Because in the HFEP program, the funds for proposed MAYOA is to a tune of 1.6 billion. Pag sinabi mong proposed, technically, it's not a MAYOA. So bawat ospital doon, kung yung pondo ay 100 million, pero yung proposed MAYOA niya ay 500 million, you cannot consider the 500 million and your design should only be limited to 100 million and it should be a usable project at the end.
Director Abad, you are muted. Kindly unmute yourself, ma'am.
Madam Chair, insofar as the DBM is concerned, we don't have the category of a proposed MAYOA. I think that term is being used by the DOH for their own monitoring, that as far as we are concerned, what we are monitoring are the authorized or the approved MAYOA already. So,
perhaps
if
just
the same is,
comment
sorry,
from the
Madam Chair. So if the same has been included in the annex as a proposed MAYOA, for purposes of the for DBM, it is considered as covered with budget for that particular year only. It's not considered as an approved MAYOA.
Rep. Garin, that seems a clear answer. So at this point, perhaps because your
Thank you, Madam Chair.
Your time is up. Perhaps just a response from Madam Secretary, if you wish.
Yes, Madam Vice Chairperson and Congresswoman Garin, we acknowledge and recognize the inputs and recommendations of Congresswoman Garin. But just so that we are getting confused already, because the Department of Budget and Management also issued the National Budget Circular in 2015. This is number 2015-7, wherein they issued updated guidelines for the issuance of this MAYOA. And through this NBC, that's how we have tried processing the supposed MAYOA that was part of our budget. Now, we will accept naman po the recommendations and we will try to revise if that would be according to what is in the law and the rules. But just so that for everybody's information, we have 8 ongoing projects right now, which are already ongoing and under this specific MAYOA. So yun na lang po siguro, we'll just discuss with the Department of Budget and Management on how we'll be able to go through the process so that we will not be violating also the other rules that is being mentioned, Madam Vice Chairperson.
Kindly submit to the committee your proposed revisions before plenary debates. Thank you. Next to interpellate is from the minority. The chair recognizes Deputy Minority Leader B.H. Herrera.
Thank you, Madam Chair. Magandang umaga po sa DOH family, Secretary Rehere. I'd like to zero in on some COA annual audit reports. Dito po sa isang 2021 COA annual audit report for DOH, it says the inability of the CO and some OUs to properly handle and monitor their receivables led to the non-collection and or non-liquidation of receivables amounting to 3.4 billion for more than 3 to 10 years and 1.6 billion for more than 10 years. Paki-explain nga po ito sa committee.
Madam Secretary.
Yes, Madam Vice Chairperson, may we recognize Director Rowena Laura from our Finance and Management Service.
Director Laura, you are recognized.
Good morning po, Madam
Chairman. Most of these receivables arise from uncollected receivables from PhilHealth. According to our operating units, most of these are
Pakilapit po, hindi po kayo maintindihan.
most of these po are coming from receivables from PhilHealth, which is until now is undergoing po reconciliation, ma'am. Ongoing po yung reconciliation of our operating units with the PhilHealth.
Gaano po, through you, Madam Chair, gaano pa kaya katagal ito? Medyo tagal na nito.
Do you wish to ask Attorney Santos from PhilHealth
Yes, please.
for a confirmation?
Madam Chairperson, Honorable Representative Herrera, I really apologize, Madam Chairperson. I did not get clearly the question. I'm sorry, Madam Chairperson.
Meron pong receivables ayon sa COA, ang DOH, at ang sabi po ni Director Laura ng DOH ay yan po ay dahil po sa PhilHealth na hindi po nagbayad sa mga ospital.
Madam Chairperson, if I may we request to recognize our acting Senior Vice President for Fund Management Sector, SVP Gregory Loda, Madam Chair, to answer the question, please.
SVP Gregory, you're recognized.
Thank you, Madam Chair. And to respond with the query, I'd like to inform the body that I just only assumed last June. But as of to date, ma'am, we have already a reconciliation process which was duly approved already by the board, because one of the major findings of the Commission on Audit when it comes to PhilHealth, there's no subsidiary ledger for each hospital. And right now, Madam, we are happy to inform you that there's already a reconciliation module available, and we are now in the process of reconciling to all the different hospitals. And last week, we had a meeting orientation with the COA director and asking for the DOH hospitals reconciliation or confirmation of their accounts. So within the year, Madam Chair, these amounts will now be reconciled. Thank you.
Madam Chair, through you, within the year, can we count on that? Through you, Madam Chair.
Yes, Madam, because our board of directors is also monitoring our financial management when it comes to the subsidiary ledger of each of the hospitals, Madam Chair.
Madam Chair, maybe we can request details kung saan pa kung may utang ang PhilHealth ng mga ospital, and sana po masubmit sa committee and copy furnish my office, Madam Chair.
PhilHealth, please take note of the data requests to be submitted before the plenary debates.
We will comply, Madam Chair. Thank you.
My next question, this is critical for me because yung medical assistance program natin, alam niyo naman, isa sa advocacies ko is to make sure that the private hospitals pwede rin tayong mag-issue ng guarantee letters. And nagkakaproblema po kami dito sa NCR na mag-MOA with private hospitals kasi maraming utang ang PhilHealth. So ayaw nila mag-MOA for fear na hindi sila mababayaran. How can we address this situation, Madam Secretary, through you, Madam Chair, para we had already issued an administrative order that we can issue guarantee letters to private hospitals. Paano natin mapapadami kaya ang ating partner na private hospitals considering maraming utang? Can you do something about this? Lalo na kung yung GL may naka-standby fund naman, maybe that is something that we can encourage our private hospitals to enter into agreements with us.
Madam Secretary.
Yes, Madam Vice Chairperson, may I call and recognize the Secretary Grande.
Good morning, Madam Chair. Good morning, Ma'am Congressman Herrera. We actually, for the special provision we are proposing special provision for 2023 to somehow ease the burden in coming up with memorandum of agreements with private hospitals. So we have prepared that and we will submit it, Madam Chair. We recognize your concerns and these are very common among all of the stakeholders. So we will have to address it. Meanwhile, we just really have to anchor our guideline based on the existing 2022, but certainly we can change the course when we go to 2023 by way of the help of this body.
Thank you very much, Kong.
Madam Chair, certainly I'm interested in that special provision because I'm also crafting a bill to institutionalize that para hindi na tayo isa-isang nagmumowa pa. But for the meantime, Madam Chair, may I ask the DOH to submit the list of private hospitals that accept guarantee letters para sa malaman na rin po ng mga members of Congress.
Yes, DOH, the list of private hospitals with MOAs. And in addition, pakisubmit na rin po ang proposed nyo na special provision.
Yes. Please copy furnish my office also, Madam Chair, para sa preparation ng bill that I am making.
Yes, Comsec, please note that.
Yeah. Next question. Meron pa pong COA annual report na sinasabi na the existence of unaccounted discrepancies in cash accounts totaling 101 million affected the reliability of year-end cash accounts. Please explain the failure to account for the unaccounted discrepancies in cash accounts.
Madam Secretary.
Yes, Madam Vice Chairperson, and also Congresswoman Herrera, may we recognize Director Weng Laura to answer the question.
Director.
Good morning again, Madam Chair. With regards to the unaccounted discrepancies in cash balances, for our verification with our...
Could you speak closer to the mic?
Hindi ko po marinig, Madam Chair.
For verification with our respective operating units, these are mostly dormant accounts which require supporting documents na matagal na pong mga unreconciled. So they are closely coordinating with the banks po para po makakuha ng mga documents to finally settle this. And if talaga pong hindi na siya maiaayos, request for write-off to COA po.
Madam Chair, napakasakit naman na dormant accounts na tutulog po yung pera natin. 101 million po ito. So I hope the DOH can do something about this at the soonest possible time and report before plenary ang step by step kung anong dapat yung gawin at gagawin for that.
Yes, ma'am.
Director Laura.
Yes, ma'am. Will do po.
Thank you. Next question, Madam Chair. Consider the amounts of unobligated allotments totaling 24.6 billion as of December 31, 2020, aimed at strengthening the department's capacity, ensuring access to basic public health services to all, ang hindi pa po nagagamit. Bakit po meron tayong 24.6 billion?
Secretary. This is 2022, right?
As of December 31, 2020.
Oh, okay. As of December 30, 2020, merong 24.6 billion unutilized.
Unobligated allotments, Madam Chair. I want to understand this.
So this is out of the 2020 GAA. Director Laura.
Madam Chair, can we provide you po the details na lang? Kasi po, most of the 24.6 billion have become CONAP po ng 2021. So, ibigay na lang po namin yung details of that na naging CONAP and then the updated utilization, Madam.
Sige po, Madam Chair, masubmit po para po mas maintindihan. But before plenary pa sana para makapagtanong pa po kami. My next question is HFEP. Dito po sa submission po ninyo, meron po kasing amount for sa central na 945 million na walang detalye. Baka pwede po naming malaman ano po ba yung detalye ng central office na HFEP na 945 million?
Yes, Madam Chairperson. Yes po, and Congresswoman Herrera, may we recognize Director Nene Gorgolon.
Director Gorgolon, you're recognized.
945. Yeah, we have already the listing for that. We are correcting the NEP. But we have already the identified list for the 941 million po. Thank you very much.
So Madam Chair, pasubmit po kasi wala po sa NEP. Pati po yung 489 million na nasa central office for the rural health units, wala rin pong detalye sa NEP?
Yes, sir, because we have some corrections nung naka-reflect sa NEP and we are correcting it already and we have the list po, Your Honor.
Has this been submitted as an annex, Director?
Yes, ma'am. In the annex,
wala po siya sa annex.
941 is parang lump sum, but we have the list, so parang meron lang mga kaya we are now correcting the net po. We will be submitting.
Okay, so kindly submit before plenary.
Madam Chair, wala po siya sa annex, naka-lump sum po siya. That's why I want to get the details of that lump sum appropriation. My next question is, nawala po yung budget item sa cancer assistance po natin na 500 million. Bakit po ito naalis? Paano po ba ito na-avail ng cancer patients po natin? This is a concern kasi we passed this bill, this law in Congress, ba't nawala po ang line item na ito?
Yes,
Secretary.
Yes, Madam Chairperson and Congresswoman Herrera, yes po, yun pong Cancer Assistance Fund na line item natin, based on the cancer law, we've started the implementation po, and through a joint memo circular with Department of Budget and Management. Now, maumpisahan na ho natin siya ngayon. Unfortunately, when we looked at our NEP, wala po dun yung Cancer Assistance Fund. So we did our appeal to the Department of Budget and Management, but still we were not given that approval. So ngayon po, humingi kami ng tulong and appeal to our House of Representatives to bring back the Cancer Assistance Fund worth 500 million to our budget line item.
Madam Chair, naggamit ba ito? May nabawas ba tayo noong 2022?
This was not really fully implemented for 2022. It started, may joint memo circular po kasi na kailangan based on the provisions para maipatupad natin ang Cancer Assistance Fund. But there were these contradicting provisions po kasi from the GAA of 2022 versus the specific IRR and law na meron tayo sa cancer na kailangan iklaro yung gamit ng pondo kasi sa special provisions po sinabi doon diagnostics and other expenses, but for the law specific lang po siya sa ibang serbisyo. So nagkaroon pa ng reconciliation ng DBM at DOH and we were able to finally agree. So yung joint memo circular po lumabas lang ngayong August. So magpapatupad pa lang po tayo nitong Cancer Assistance Fund ngayon.
So, Madam Chair, I hope that this committee was able to hear that. Napakahalaga po nito for our cancer patients. So, I hope maibalik po natin sa DOH yung 500 million assistance na yon for our cancer patients. Napakahirap po. Ang dami pong lumalapit po sa atin. So, I hope we could consider that in this committee, Madam Chair. Kung may time pa po ako, my next question is, marami pa po ba yung sa warehouses, wala na po ba tayong issue ng mga nabubulok at na-expire na gamot?
Madam Secretary.
If we can recognize you, Sir Carol, but generally po, wala na po masyado.
Kasi kung meron pa po mga near expiry, nag-aabang lang po kami lahat ng mga gamot na pwede po namin i-distribute. Tutulungan po namin kayo, Madam Chair, na ma-distribute po ito. My next pa po, kung may time pa, oral health care. Wala po akong nakitang oral health care budget.
Madam Secretary.
Yes, Madam Chairperson, it's part of the family health, immunization, nutrition, and responsible parenthood line item. We already were able to set up our division for oral health. Meron na rin po tayong list of activities. We were able to hire dentists already. And it's part of our integrated programs already, Congresswoman Herrera.
Okay.
20 seconds to wind up.
Yes, my last question. Pasubmit na lang po on how you spent the contingent fund and the unprogrammed funds na nilipat po sa inyo. Just submit the details in the committee and copy furnish my office. I'd like to understand how you spent the contingent fund given by DBM and the unprogrammed funds transferred to your office. Maraming salamat, Madam Chair, and thank you, Secretary. I look forward to the submissions. Thank you.
Salamat, Rep. Herrera. And Madam Secretary, can you take note of the long list of submissions? Time check lang po. We still have about 32 kongs who are listed for interpellation. In the last hour, ang nakapagtanong po ay 4 po na congressman. So I highly encourage you to answer directly and concisely. And one last thing, meron mga Congress people na meron po sila mga concerns sa kanilang regional directors. So if somebody, can you identify someone, Madam Secretary, na pwedeng puntahan, pwedeng lapitan ng mga representative, baka sakaling makabawas po tayo na nakalista dito. So sino po ang magiging assigned po sa mga may katanungan sa mga regional director?
Yes, Madam Chairperson, we will be requesting Yusek Okang Dumama for our Visayas and Mindanao areas.
Nasaan po siya? Ayun.
There po, there. And Yusek Nestor Santiago also talking with the Secretary Garin. They are our operations people.
All right. Okay. Thank you. Next, interpellate from the majority. The chair recognizes Deputy Majority Leader Jam Baronda.
Thank you so much, Madam Chair and honorable members of this committee.
to DOH family. Good morning. First of all, allow me to thank you for your selfless dedication you have exhibited during our fight against COVID-19. And I would like to say thank you also sa mainit na pagtanggap sa akin na pag-asikaso when I visited DOH office, to Yusek Carol, Yusek Grande, of course, Yusek Director Gorgolon. Well, my question is about universal healthcare or Republic Act 11223. We all know that for universal healthcare to achieve its goal, several factors must be in place, including an efficient health system, a system for financing health services, access to essential medicines and technologies, and a sufficient number of trained workers to provide the services. Can you kindly enlighten this representation where we are now in the implementation of the Universal Healthcare Act?
Madam Secretary.
Yes, Madam Vice Chairperson, and magandang umaga po, Congresswoman. Para po sa Universal Healthcare, nakapag-develop na po tayo at nakapaglabas ng mga polisiya na kailangan to serve as basis for us to forward the implementation. Meron din po tayo na mga specific budget that we have allocated para po sa specific reforms na kailangan natin. What would be most, the one that we want to highlight would be the integration sites na atin pong ginagawa kung saan nag-integrate na po tayo financially, technically, in these specific areas. We have about 58 integration sites right now all over the country, whereby dito ginagawa na po natin yung mga nakasaad po dun sa universal healthcare. Aside from that, we are trying to do the reforms in the Philippine Health Insurance Corporation. So ngayon po, we are discussing right now sa board po ng PhilHealth together with the team of Attorney Eli Santos kung paano natin may push forward yung reforms katulad po ng developing benefit packages for a comprehensive outpatient benefit package to support our primary care principles and objectives to support UHC. Pangalawa po, yun pong ating paggamit ng mga DRGs. Instead, we're shifting to the means of paying dito po sa PhilHealth where yun pong diagnostic-related groups ang gagamitin. So we have 13 new additional sites also for the UHC integration sites na ginagawa na rin po natin ngayon. So in a nutshell, Congresswoman, that is what we are doing for UHC. We can submit to you a brief narrative so that we can answer also the other.
Yes, Madam Secretary, can you please submit na lang?
Rep Jam, kindly keep our noise level to a minimum. Hindi na po tayo nagkakarinigan. Meron po tayong budget briefing ongoing at this point po. Salamat po. Rep Baronda. O nga po, yung mga parallel po na budget hearing, baka naman pwede po sa kabilang kwarto na lang po. Salamat po.
Madam Secretary, Madam Chair, do you have the existing pertinent data to those who are able to avail the DOH, including demographic, age, and location?
For Madam Chairperson, Congresswoman, yun pong sa UHC na nakaka-avail. Unang-una po sa UHC, all Filipinos should be automatically enrolled to PhilHealth. So ito po yung binibilang natin na nakapag-avail ng mga services and that can benefit from this UHC law na meron tayo.
Madam Secretary, tinatanong ko po ito kasi based on the report po, sa ngayon, mga 88% pa lang po ang naging miyembro. Kaya po kasi automatic kasi na nung na-approve yung act na ito, automatic lahat ng Pilipino ay maging miyembro ng PhilHealth. Pero basa po sa report ninyo, 88.8% pa lang yata. So saan na po yung 12%? Bakit hindi sila miyembro ng PhilHealth? But anyway po, Madam Secretary or Madam Floor, I would just like to ask na lang the data of na hinihingi ko na number of beneficiary na kapag avail na. I would like to proceed to my next.
Jam, do you wish PhilHealth to respond to your question, Attorney Santos, on the question on bakit 88% lang at hindi 100%?
Thank you, Madam Chairperson. Honorable Representative Baronda. Madam Chairperson, we have this 100% coverage for PhilHealth under the UHC law, meaning there is immediate eligibility for all Filipinos. However, there's a need for them to register. That's the only requirement, Madam Chairperson, Honorable Representative Baronda. Yes, we provide immediate eligibility, but there's a need to register. Madam Chairperson, Representative Baronda.
Baronda.
So meaning, Madam Chair, may 12% na hindi nakapag-register.
That's correct, Madam Chairperson, Honorable Representative Baronda.
Okay, Madam Chair, on February 12, 2022, the Asian Development Bank of the Government of Japan through the Japan Fund for Prosperous and Resilient Asia in the Pacific rolled out 2 million technical aid package to support the pilot implementation of policy reform on universal health care in the Philippines. How is this related to the ADB $600 million loan to the Philippines intended to build universal health care program?
Madam Secretary.
Yes, Madam Vice Chairperson, can we recognize Yusek Kenneth Ronquillo?
Yusek Kenneth, you're recognized.
Madam Vice Chairperson, can you allow for us to have just 1 minute? We're getting the documents.
1 minute suspension.
Madam Vice Chairperson, if Congresswoman Baronda will allow, we will just submit the documents to her office within the day.
All right, session resumed. Are you amenable to that, Rep. Baronda?
Yes, Madam Chair, I will just talk to them personally. And I would just like to ask how this will help us ensure the full implementation of Universal Health Care Act in the targeted 10-year period. Gusto ko lang po, Madam, tatanong to kasi kailangan talaga i-implement natin Universal Health Care kasi hindi para sa atin ito. Especially para ito sa taong bayang Pilipino na nangailangan ng better healthcare system sa ating bansa.
Madam Secretary, do you wish to respond?
Yes, Madam Chairperson. So meron naman ho tayong timelines for us to be able to implement in full. Right now, there are several reforms that we are implementing so that we can be able to achieve universal health care. Meron ho tayong 3 years na tinitignan sa ngayon kung saan kasama po doon, maiaayos po natin yung sources of financing, PhilHealth, national government subsidies, local government counterparts, and the rest. Meron ho tayong 2026 na oversight na magsasubmit na po tayo about the integration of sites, the different budget that has been allocated, and the different sources of funds. So if we can just submit to you, Congresswoman Baronda, but just to ensure the body that the DOH is pushing or doing ito pong initiatives natin so that eventually in the next 5 to 6 years, we can be able to fully implement universal healthcare in the country.
Madam Secretary, yes, don't worry, I understand because kakapasok niyo pa lang sa DOH. During the budget deliberation of Universal Health Care Act, the estimated funding requirement for 10-year implementation is as follows. Year 1, 257 billion. Year 2, 271 billion. Year 3, 286 billion per year, and year 4, 302 billion. Did you see this fund requirement estimates when you asked DBM and Congress for funding, or you just adjusted it?
Madam Secretary.
Yes, Madam Vice Chairperson and Congresswoman. Yes, for 2020, we had the total agency budget and allotted that 175, and then for 2021, 209. For 2023, it's 295. These are all part of the budget that we allocate so that we can implement universal healthcare. Just to give some information also, Congresswoman, it's not just the DOH budget that we are relying on. We are relying on PhilHealth for us to be able to finance the services for our people. Aside from that, we are also highly reliant on the sin taxes, which forms a huge part of the budget of the department for our universal health care.
Okay, thank you, Madam Chair. I will just proceed to Health Facilities Enhancement Program. Health facilities are an important pillar for success implementation of Universal Health Care Act.
2022 General Appropriations, your health facilities enhancement program was given allocation of 22.94 billion. This is good ever since. This is good because good news because ang this year budget natin na sa GAA ay umabot ng 23.5 billion per year, higher than 2021 na 13.3 billion, wherein 5.5 billion is unprogrammed fund. May we know your current utilization of 2021 and 2022 HPEP budget?
Yeah, yes, ma'am. May we recognize Director Nene Gorgolon to answer the question.
Director Nene, you're recognized.
Madam Chair, Your Honor, for 2021 utilization health facilities enhancement program, we have an obligation of 100% with a total disbursement of 59%. For 2020, we had an obligation of 100% with a total disbursement of 82%. For 2022, with 2022 approved budget, we had an obligation as of today, 49%, with 14% disbursement po. Salamat po.
Okay. What is your current national hospital bed to population ratio? Which region is the farthest from ideal ratio of 1 bed to 800 population, Madam Chair?
Yes po, Madam Chair. Can we recognize Director Tess Vera po?
Director Tess.
Thank you, Madam Chair. Actually, for the bed population ratio, BARM has the lowest bed to population ratio. Most of the regions has already met the 1:1,000, except for BARM and Region 8 as well as Region 5.
Excuse me, we can't hear. BARM, Region 8, and Region 5. Madam Chair, please take note of that. I'm asking this because I was the one who sponsored Republic Act 11946 that sought the expansion of Western Visayas Medical Center bed capacity from 425 to 700. But the medical center needs at least 200 million for the infra project for this year. Tama ito, aligned ito sa pangunahing adikain ng Pangulo na magkakaroon ng specialty hospital across the regions. What is good with the Western Visayas Medical Center, Region 6, dahil wala na tayo problema sa tao dahil may law na. Because of the law, it created more than 2,000 na plantilla positions. And I'm very thankful to DBM for the release last 2021 ng 1,030 plantilla positions. So, sayang kasi na meron na tayong kidney center, kulang na lang ng 200 million pesos para magkakaroon na ng region ng kidney center sa Western Visayas Medical Center. And I would like to thank Director Gorgolon na kahit papano meron na ilagay ngayon sa NEP ng 100 million. So we don't want this to happen kasi kung hindi natin bibilhin to, ang dagdag ng 100 million, sayang yung pasweldo ng tao, sayang yung equipment, sayang yung infrastructure na wala din naman na hindi magagamit. And Madam Secretary, nakita ko rin sa HPEP na sa building DD ng Western Visayas Medical Center kasi yung 440 million time pa yun ni Senator JV when he was the chairman ng Committee on Health. Patapos na po yun. Yung para sa kidney center. Ngayon meron tayong building D. Kailangan lang ngayon for at least 200 million para at least meron tayong accomplishment for 2023 para naman sa heart center na gusto din ng Pangulo. Remember, may tao tayo, meron tayong area. Kailangan lang po para mag-discongest din yung mga problema dito sa Manila, sa Heart Center at doon na lang sa Iloilo. We are serving more than 8.8 million inhabitants across the region or Western Visayas. Kaya Madam Chair, sana po matignan ito, mabigyan din ng pansin, mabigyan ng importansya para makatulong din yung Iloilo or Region 6 po sa problema natin sa health.
Salamat, Reparonda. Your time is up.
One last, Madam Chair.
Kindly, do you wish to respond?
Madam Chair, one last, Madam Chair.
7 minutes, Madam.
Last, Madam Chair. Sorry. Nagpasalamat ako in advance sa DOH dahil sa tulong nila sa atin sa approval ng Republic Act 11891 or the creation of Iloilo City Hospital. Last Friday, we have nag-ground break na kami. Pero nakita ko pa, wala pa pong pondo sa ngayon. But next year na po, hingin ko po ito, Madam Secretary, sa DOH, total na sa construction phase pa lang kami. And I would like also to manifest that to make sure the Section 3 of that bill, titignan nyo din po para sa next year's budget. Maraming salamat po, Madam Secretary and Madam Chair. Sana po madagdagan yung pondo, yung Western Visayas Medical Center, kasi po ito to be operationalized at para magkaroon ng medical kidney transplant and heart transplant in Western Visayas. Maraming salamat po, Madam Chair.
Madam Secretary, do you wish to respond?
Yes, Madam Vice Chairperson and Congresswoman Baranda, we take note of all of the requests, and we just like to say that we have allotted 200 million for Western Visayas Medical Center for 2023.
Salamat.
Madam Chair, point of order.
Yes, Vice Chair Albano.
Thank you, Madam Chair. My question really is, why are the regional directors of the whole DOH not here? This is supposed to be the most important meeting that you will have as a briefer, and yet the Secretary and the DOH chose to create a seminar and not have the regional directors here answer all our parochial concerns.
Madam Secretary, what
yes.
is your explanation for the absence of the regional directors in today's budget briefing?
Yes, Madam Vice Chairperson and Congressman Albano, some of them are going to arrive already now. We've already called on them, but the others will be arriving tomorrow.
Madam Chair, my regional director is in Igig. How will she arrive today?
They are within, nasa Zoom naman po sila kasi po limited lang yung slots na naibigay.
No. That is not. That is acceptable to this representation, Madam Chair. And I hope that this becomes a serious matter because, Madam Chair, my point of order is that if the regional directors here, most of the concerns and parochial concerns of most of these congressmen, which you have a listing of a long list of questions here, could have been addressed already. And this will help you in the plenary, ma'am. I am not getting mad at you for this just because I want to get mad.
Madam
I
Chair.
want to make sure that your budget will be passed because the health department is very crucial to the health system of the whole republic. And being that may, I would like to request, Madam Chair, that you make sure that next time they arrive here and that now the parochial concerns so that we can speed up this meeting can be addressed now by some of your USECs and directors so that we can move on and help you in passing your budget for this year, Madam Chair.
Thank you, Rep. Albano. Before I recognize Rep. Garin, just for your information, based on IATF rules, the maximum capacity of this room is 75. And so, yung ibang officials ay hindi makakapagpunta dito physically. However, hindi po kayo absolved, no? Meron po tayong Zoom facility sa kabila. Can you please tell your regional directors who are not present at the moment to log on right now? Kasi napakarami pong mga katanungan meron ng ating mga kongresista para sa kanila. At hindi po tayo matatapos. Napakahaba po ng listahan natin. And at the same time, pwede po ba, Madam Secretary, to instruct your regional directors to get in touch with the Congress, with the members of Congress in the next 2 days. They have to do this before the plenary debates. Otherwise, hindi po tayo matatapos. Napakarami pong health concerns ang nire-raise ng ating mga miyembro. Rep. Garin?
Madam Chair.
Yes, please.
With that, I move that all the regional directors be directed to immediately proceed to the holding room across, but those who are outside Metro Manila be directed to log on to the Zoom or to report to the House of Representatives in the next 2 days. And this will be a prerequisite prior to the plenary deliberations. And further, Madam Chair, may I request the Honorable Secretary to introduce the USECs and ASECs for Luzon, Visayas, and Mindanao so members of Congress can confer with the respective officials who are here today. So move, Madam Chair.
Right? Having been seconded, the Secretary is so directed.
Yes, Madam Vice Chairperson and the Honorable Congressmen and women. First, we like to apologize because as we have said, there are IATF rules that we cannot filled in as many of our officials here. But nevertheless, Congressman Albano, we are going to call all of our regional directors for them to join in via Zoom or meet with the respective congressmen and women of their districts within the next 2 days. Although I just like to inform the body that since the first time that we have met and you have instructed, they have already gone around and went to their respective congressmen and women. But we will still instruct them now. Madam Vice Chairperson, may I now recognize and introduce to all of you our Undersecretary for our Field Implementation and Coordination Team in charge for our Visayas and Mindanao areas, Yusek Abdullah Dumama. And also we have our Undersecretary for Field Implementation and Coordination Team for our Luzon area and the National Capital Region, Yusek Nestor Santiago. So they are the ones overseeing our operations and the regional offices, Madam Vice Chairperson.
Right, salamat. Now we proceed with the interpellation. Next to interpellate is from the minority. The chair recognizes Deputy Minority Leader Franz Castro.
Thank you, Madam Chair. Magandang tanghali po sa ating lahat. So yung first topic ko po is about COVID benefits of health workers. So Madam Chair, kanina narinig ko 425 health workers were dead. So natanggap na po ba yung kanilang beneficiary yung dapat na matanggap nitong 425 health workers, Madam Chair?
Madam Secretary?
Yes, Madam Vice Chairperson. Good morning po, Congresswoman. We have the different budget or health emergency allowance. Meron po tayo sa SRA, meron tayo ng OCA or HEA or yun pong iba pa hong mga benepisyo. Sa ngayon po, we have already released and have already around 805,000 plus healthcare workers who have benefited from these allowances and benefits. But as I've mentioned a while ago, Congresswoman, meron po kaming arrears sa ating mga healthcare workers worth 65 billion for 2021 to 2022 and around 76 billion ang needed for 2023, for which we were only provided for first 3 months of 2023 as budget, and the rest nag-a-appeal pa po kami kung meron po tayong pagkukunan.
Yes, Madam Chair. Yun po yung mga susunod kong mga tanong, yung sinagot na. Ito pong 425 na health workers na namatay. So ang tanong ko po ay nabayaran na po bang lahat yung kanilang dapat na natanggap? Natanggap ng kanilang pamilya.
Yes, Madam Chairperson and Congresswoman, meron pong kakarelease lang ang ating Department of Budget and Management, around 570 million. Ito lang po last previous 2 weeks kung saan this will be addressing our yun pong mga namatayan o di kaya mga nagkasakit na healthcare workers na bibigyan po natin ng compensation, ma'am.
So, kailan po kaya nila matatanggap ito, Madam Chair?
There is ongoing sub-allotment already to our specific units, ma'am. And also, it will depend on the submission as well of the requirements para po makumpleto na natin at maibigay sa kanila. But ongoing na po ang sub-allotment natin.
Okay, thank you po. Ito naman po, pupuntan tayo sa SRA. So, ilan po ba yung breakdown noong mga dapat na makatanggap ng SRA, yung AHDP, OCA at saka HEA. So meron po ba tayong breakdown nun, Madam Chair?
Yes po, Madam Vice Chairperson and Congresswoman. For SRA po, meron po tayong around 492,000 healthcare workers na nabigyan na po natin itong allowance na SRA fully disbursed from September of 2020 to June of 2021. Ngayon meron pa ho tayong 56,000 na ongoing disbursement for our healthcare workers from December 2020 to June 30, 2021 po ang kailangan. This is ongoing disbursement and 92% na po ang disbursed. Konti na lang po ang pinoproseso natin. Now, we still have funds na kailangan pa, remaining po, unfunded pa rin po ito. Around 55,844 healthcare workers are still to receive their SRAs. And we are still appealing and discussing with DBM. We've sent our additional request already to them, totaling around 1 billion and 40 million pesos po. We're still awaiting for their response on this, Congresswoman.
Madam Chair, kailan po sinubmit itong request na ito? Kung meron pong DBM representative, may I know their reply or may I know their answers to the request of the DOH, Madam Chair?
Before you answer, Madam Secretary, I would like to remind everyone that we have 2 holding rooms for your side discussions. Yung Belmonte and Villar rooms are reserved for purposes of side discussions, particularly with your regional directors. We really need to minimize the noise level. Hindi po tayo nagkakarinigan. Salamat po. Rep Castro.
Madam Chair, yung tanong ko po kung meron tayong representative from the DBM, since sabi po ni Secretary, they requested po doon sa funding for doon sa kailangan nilang bayaran para sa SRA and other benefits po. Kung meron pong DBM.
Director Abad, did you hear the question on the fund requirement to pay the SRA allowances na outstanding pa po?
Yes. We have the DBM received the request for the fund amounting to 1.045 billion last August 30 po, but the attachments or the documentary requirements were received only last September 6.
Madam Secretary.
Yes, we confirm the response of Director Abad, and we just like to clarify also that these are also the additional requirements that were asked from us by the DBM last September 6. Yes po.
Castro.
So sa DBM, Madam Chair, mababayaran ba ito? At may available na pondo ba ito kapag na-submit na lahat ng mga requirements?
Director Abad of DBM.
Madam Chair, the department is currently evaluating the request and the propriety of the claims, but we have identified a potential budget source for to cover the request.
Rep Castro.
So may potential. So ang tanong ko lang, mababayaran ba ito o hindi? Madam Chair.
Director Abad, yung pong potential amount, is that sufficient?
Yes, Madam Chair, the identified potential, the identified possible source to cover the request would be sufficient, but we are currently evaluating the propriety of the claims so that we can immediately process the release of the fund.
Okay, yun lang po, Madam Chair, ang gusto kong marinig, na may potential at mababayaran itong 1 billion na kailangan. Batay sa NEP, mayroong 38.92 billion para sa COVID benefits, both for DOH and UA. Mas mababa ito, Madam Chair, sa 51 billion na nasa ilalim ng GAA 2022. At marami pang health workers ang di nakakatanggap ng COVID benefits. Ang ilan ay namatay na at ito ay hindi pa rin natanggap. Halimbawa, Madam Chair, may mga ako dito na specific. Mindanao Central Sanitarium. All the 116 employees entitled to SRA hindi pa rin nakatanggap. Samantala, 981 naman sa Caraga Regional Hospital. Ang OCA at HEA naman ng mga kawani sa Philippine Heart Center para sa July to December 2021 and January to June 2022 ay hindi pa rin na-release. Despite all of this, bakit mas mababa ang proposed budget ninyo para sa COVID benefits and health workers? Baka pwede muna akong sagutin dun sa mga specific, Madam Chair, bakit hindi pa nila natatanggap?
Madam Secretary.
Madam Vice Chairperson and Honorable Congresswoman Castro, if you may request that we submit to your office regarding these questions about the benefits. But basically, meron ho kasi talagang difference. No? Kapag nagre-release po ng budget, may difference kung ano po yung pwede namin gamitin for the organic staff, yung PS at saka yung MOE part of the monies. Kaya minsan po, katulad po ngayon, ang pera lang namin is only for the organic staff. So yung mga contractual po, yung mga JOs, hindi namin mabigyan ngayon kasi yun na lang po yung natira sa budget namin. That's why we have submitted also a request to DBM for that. So may mga ganun pong mga issues tayo ngayon, but we're trying to work closely with DBM on this. So if we can just submit a specific request for specific facilities to her office, Madam Chairperson.
Rep Castro, are you amenable to a written answer?
Yes, Mindanao Central Sanitarium, Caraga Regional Hospital, tsaka Philippine Heart Center. Ay, general question ko po, despite all of this, bakit mababa po yung proposed budget natin para sa COVID benefits ng health workers?
Madam Secretary.
Madam Chairperson, we have submitted a total of 76 billion for us to be able to sustain the provision of these benefits and allowances to our healthcare workers. But we were only provided around 3 months of this 76 billion na kailangan natin. 19 billion, 19 billion ang binigay po sa atin as program. Tapos meron pa kung saan program yata na 18 billion. But this would only suffice for the first 3 months of the year. The rest of the year, wala po uling pondo para sa allowances ng healthcare workers.
Rep Castro.
Okay, thank you, Madam Chair. Doon naman po tayo sa mga unfilled plantilla positions. 2029, Madam Chair, merong 14,311. 2022, 14,005. 2021, 19,986. Tumaas din naman po yung mga filled position, mataas din po yung authorized na filled authorized position. Sa 2022, tumaas na naman yung unfilled, 21,038 at saka sa 2023. So this year, Madam Chair, DOH hired 16,951 JO and 9,947 under Human Resource for Health HRH. So bakit po, Madam Chair, nag-hire ng mga JOs and JOs and COs samantalang ang dami po ng mga unfilled position?
Madam Secretary.
Yes, Madam Vice Chairperson, Congresswoman Castro, una-una po, we had this election ban nito pong recent months. And then marami rin po tayo nabuksan ng mga ospital for this year. Kung saan before we can process and hire, medyo matagal din po. For the specialty naman po yung mga residente, meron pong approval pa kasing kinukuha or accreditation ng specialty societies before we can hire our residents as well. And meron din pong mga ibang mga allied professions na kulang po ang supply ng Pilipinas katulad ng mga occupational therapists, speech therapists. Yun din po, kulang din yung ibang takers for the other professions katulad po ng sa nurses. We all know, yun pong mga nag-a-apply ay kulang pa rin po. Kaya hindi natin na-fill up yung position.
Madam Chair, hindi tayo kulang ng mga nurses. Ang dami nga nilang hinire ng mga COs and GOs. Actually, sinasabi nga dito sa report namin, 3 months nire-renew yung kanilang mga kontrata. So marami pong mga vacant position na hindi po pinipilapan. So yun po yung katotohanan, Madam Chair. Ano po masasabi ng DOH dito?
Thank you for your understanding. That was your last question, ma'am. Madam Secretary.
Yes, just to respond, Madam Chairperson and Congresswoman Castro, ito pong mga plantilla positions po ang we're talking about, no, for us to be able to hire. And ito pong ating mga nasa JOs natin, some of their qualifications hindi rin po nagmamatch. Hindi rin po ganun kadami rin naman yung ating mga plantilla positions for these specific professions. But we are taking note, Congresswoman Castro, we will review po. But just so to for us to explain to our House of to the House of Reps, ito pong mga specific na challenges po natin ngayon sa hiring ng plantilla.
Madam Chair, for my interpellation sa plenary, can you provide us with the breakdown nitong 21,038 na vacant plantilla position at saka yung sinasabi ni Madam Chair na kailangan
para makita natin kung magmamatch talaga yung kailangan nila at saka dito sa mga number of JOs na hinire nila, Madam Chair. Para mabigyan na natin ng regular position itong mga laging mga JOs saka contract of service, Madam Chair.
Madam Secretary, kindly take note of the data request. Tatanungin po ako niyan sa plenaryo, so kindly provide the answer. Salamat po, salamat F. Castro. We now move to the majority. Next to interpellate, the Chair recognizes Deputy Majority Leader Wilter Palma.
Thank you, Madam Chair. To the DOH family, maayong to sa tanan. OIC Secretary Verheri, with all due respect, are you a member of the Interagency Task Force?
Madam Secretary.
Yes, Madam Vice Chairperson, Congressman, Palma. Yes po, the DOH, not a specific individual, but the DOH is the chair of the Interagency Task Force.
All right. How many are members of the composition of the Interagency Task Force?
Yes, Madam Vice Chairperson and Congresswoman Palma, we originally had, based on the EO, 8 members po. But because of the specific interventions needed for COVID-19 response, it was expanded to 34 agencies in the previous. But now we have reconstituted it back to just 8 members po.
Ilan, ma'am? 8? Out of the 8, how many are doctors or how many are non-doctors or non-medical allied?
Madam Secretary, pasensya na ulit. Nakikiusap po ako sa mga nandito sa loob ng kwarto. Hindi po kami nagkakarinigan. Hindi narinig ni Rep. Palma yung salitang 8. Again, there are 2 rooms where you can have your side discussions, Villar and Belmonte halls. Yes.
Excuse me, everybody.
Salamat po. Madam Secretary.
Yes po, Madam Chairperson and Congressman Palma. It is only the Department of Health in these specific meetings ang nasa medical po. Although some of the agencies will have their medical professionals, but during meetings for the principals, it's just DOH who is a medical person.
So in short, ma'am, out of 8, isa lang yung competent enough to address COVID-19.
Secretary.
Yes, Madam Chairperson and Congressman Palma, it's not really to say competent, but we are the ones with the evidences and qualifications to do that. Although the other agencies also are part of the response of COVID-19.
Yeah, the reason why, how can we come up with a good policy if people in the interagency task force are not expert, especially on COVID-19? So that's why this is a collegial body. During your deliberation, you were outvoted, as what Representative Blackman was saying kanina, na you're going to allow, because of compromise, the wearing of face masks. So out of 8, isa lang yung nasa medical field, tapos all the rest are civilian. Sorry for that. So outvoted ka. So sila nagde-decide as far as health is concerned. Dapat sana, the members of the interagency task force, if you will allow me, dapat sana, majority of which should come from the medical field. Any reaction, Madam Secretary?
Yes, Madam Vice Chairperson and Congressman Palma. Aside from the Department of Health, we also have our experts who are part and are allowed to join our meetings in the interagency task force. These are medical experts, sir. But the main objective po kasi nung creation of interagency during the time that it was initially issued was for these specific offices to develop policies regarding border control kapag may pumapasok po na emerging and re-emerging. That's why the other offices were part. But later on, this interagency task force evolved to discuss policies in the entirety of the COVID-19 response.
Yeah.
But specific lang po dati talaga, border lang ho talaga ang pinag-uusapan dito.
Yeah. In that case, ma'am, they are allowed to participate, but they don't have voting rights. Am I correct?
Yes, Madam Chairperson and Congresswoman Palma. Doon po sa EO mismo, nakalagay po doon that the members of the interagency shall agree on specific policies in order for us to respond to border threats. So by in interpreting that, we interpret it as such that the body will be collegial and will agree on a certain policy to be implemented as a response.
Okay. One last question as far as interagency task force. Do you think you can come up with a good policy that members of this interagency, with all due respect to the members, they don't have background as far as medical field is concerned, as far as this COVID-19 is concerned? Do you think you can come up with a good policy?
Yes, Madam Vice Chairperson and Congresswoman Palma.
Congressman Palma, ma'am.
Congressman, I'm sorry. I'm sorry po, sir. I'm sorry. My apologies.
Accepted.
Yes, I'm sorry. The DOH develops the policies. The IATF adapts. Sometimes there are agreements like this previous one for the mask lifting, where the IATF has ruled, and this will come out as a resolution for which all agencies should adapt. So your question, sir, if we can come up with good policies, I think there would always be a balance between and among sectors when we discuss it in IATF. But definitely the DOH positions to protect the most vulnerable in our population. We had been instructed to convene the IATF, Congressman Palma. That's why we needed to create or to convene the IATF. If it were for us, the Department of Health can also steer the sector and implement the policies. But right now, we have this existing executive order and instructions that IATF should convene so that it is a whole-of-nation approach at whole-of-government po tayo.
Yeah, because the way I look at it, your policy as against the policy of the interagency task force are two different things. For example, the wearing of masks. The interagency is allowing. The Department of Health, there's always reservation. Anyway, I'll go to other, how about, do we have expired vaccines right now and about to expire? This not only on COVID-19 but as well as for flu and other vaccines for that matter.
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Palma, meron po tayong mga bakuna for COVID-19 vaccines which we have reported to have expired. But for the other vaccines po, for the National Immunization Program, wala po tayong expired bakuna.
About to expire.
Wala po tayong about to expire also for the national routine immunization or vaccine.
But we have a lot of stocks available.
Yes po. For the routine immunization for children, we have our stocks available and also for COVID-19 vaccines.
Okay. May I just bring this to your attention, Madam Secretary. In Region 9, we lack medicines to include vitamins, maintenance, vaccines, and so on and so forth. What's happening with, by the way, ano bang sistema ng procurement natin? Is it by centralized or regionalized?
Yes, Madam Vice Chairperson and Congressman Palma, yun pong ating procurement. Pagdating sa vaccines, it's centralized because we get the economies of scale kapag centralized po yung sa bakuna. Pero yun pong mga basic commodities natin, we have specific essential commodities that are procured by our regional offices. But most of the commodities right now, like vitamins, mga gamot po na basic for our citizens, we have already nag-devolution transition po tayo kung saan we rely on our local governments to procure already.
Is that with the permission of the chair? Is that ongoing already, or is still on the planning stage ang regional procurement? Ongoing na yan, ma'am?
Yes po, dati pa po. At saka yung devolution transition po, nag-start po tayo ngayong taon. For the basic commodities like anti-lipidemia, anti-diabetes, yung mga maintenance medications po. This was part of the agreement already with local government.
All right. So what is the rate of procurement process on the regional scale? Are they doing good? Are they complying with the target, or may delay pa rin?
Yes, Madam Vice Chairperson. Congressman Palma, as to the procurement from our regions, they only procure the essentials. No? So yun pong mga basic commodities, it's for the local governments. But as to the procurement naman po, they're aligned with the RA that we have, and mas maayos na po at efficient ang procurement ngayon sa regional offices.
All right. How about the supplies? Regional or centralized pa rin? Centralized?
It depends on the supplies, Congressman Palma. What type of supplies po?
Beds, wheelchairs, so on and so forth.
This would be regional, Congressman Palma. Pag mga beds, mga wheelchairs, nakakapag-procure po, pero limited pa rin po yung budget ng aming regional offices sa mga ganitong supplies po.
Anyway, can I have a actual report as well as the medicines and so on and so forth? Can you please submit that before the committee and copy furnish my office? It will be possible before the plenary. Okay. With the permission of the chair, can I have another questions? Yung bang ano natin, ma'am? Yung immunization natin, on the news, nag-drop ata yung immunization natin eh. Anong intervention na makuha natin?
Rep Alma, that is your last question po. Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Palma. Yes, actually, kausap po namin yung development partners natin, particularly UNICEF. During this pandemic period that we've had, we now have around 1 million children less than 1 year old who are unvaccinated in the country. And when we discuss this with UNICEF, tayo po ay nasa lowest 10 among all of the countries in the world regarding our immunization for children. So having said that, we have already identified strategies like supplemental immunization activities. We have harnessed the cooperation po of our medical societies, pediatric society, kasi meron din pong impending measles outbreak kung hindi po natin mapunan yung measles na kailangan ng mga bata ngayon. So that's part of what we are doing. But what would be most important, nahati po yung healthcare workers natin sa COVID-19 at doon sa regular programs natin. So we're trying to integrate both of these programs, but nakahingi tayo ng tulong for additional manpower vaccinators, especially dun sa areas na kailangan like BARM, dun pa sa ibang far-flung areas from our development partners. Madam Vice Chairperson.
Salamat.
Madam Chair, one last, if you will allow me. This is very important. How about dengue? What is your approach? And do we have vaccine for dengue? Thank you, Madam Chair, for allowing me. Thank you, Madam Secretary.
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Palma. Meron ho tayong mga ginagawa ngayon na preventive measures for dengue. We are seeing that most of our regions, dito po for the past months, I think 2 to 3 months, talagang tumataas tayo beyond the epidemic threshold. we have mobilized our local governments and other sectors so that we can have our preventive measures done like the 4S. As to the vaccines, pinag-uusapan po ngayon, pinag-aaralan natin maigi kung ano po yung mga bakuna na pwede po para sa ating kabataan. But this has to go through all the regulatory processes pa rin po. Kaya wala pa ho tayong maisagot ngayon kung magkaka-available o meron.
Right. Salamat, Madam Secretary. Before we proceed, working lunch po tayo ngayon. Pasensya na, otherwise hindi tayo matatapos. And Comsec, can you kindly make sure that there's enough food on the side of the DOH? Nakita ko po kasi medyo nagkakaagawan na yata ng lunch dyan sa kabila. Number 2 po, just for the information of everyone present, especially the members, when the committee secretary when Chairman ko wrote to OIC Secretary Vergere, August 31, 2022, second paragraph of the letter, babasahin ko lang po. In this regard, may we invite you, your senior officials and regional directors, including the heads of agencies and corporations under your department on September 12, 2022, which is today, 9 a.m., etc. So in other words po, nasabihan naman po natin ang DOH family na kailangan pong present ang regional directors natin. And although may 75 packs na capacity ang kwartong ito, naglaan po tayo ng 2 pang kwarto, no? Para nang sa ganon, IATF compliant tayo. So, again, pa-remind na lang po ang ating regional directors to either come or if hindi talaga pwede, to log on sa Zoom. Number 3, upon the request of my favorite seatmate, Representative Edsa Lagman, kindly submit your devolution transition plan to the committee, again, before the plenary debates. Ang susunod po na mag-interpellate mula sa minority, the chair recognizes Representative Arlene Brosas.
Maraming salamat, Madam Chair. Madam Chair, sa PhilHealth ang mga tanong ko. Madam Chair, sa buong budget, health budget, magkano po ang mapupunta sa PhilHealth? At ilang porsyento ito ng total budget?
Attorney Santos.
Madam Chairperson, Honorable Representative Brosas, based on the approval of the Department of Budget, PhilHealth was given 100.2 billion pesos as the budget for 2023. Madam Chairperson, Honorable Representative Brosas.
That is how many percent of the total budget?
Attorney Santos.
Madam Chairperson, Honorable Representative Brosas, may we be given just 2 minutes to compute the percentage, Madam Chairperson.
Okay, Madam Chair, next question ko po para sa DOH. Magkano ilang percent naman para sa operation ng DOH hospitals?
Ilang percent?
Yusek David.
Yes. Thank you, Madam Vice Chair. So we have 60 billion po for our DOH hospitals.
How many percent po yan ng total budget?
DOH. This is 31% of the DOH OSEC budget.
Magkano po yung total health expenditure ng Pilipinas? Meron na po ba tayong data niyan, Madam Chair?
Yusek David.
Madam Chair, can we ask for 30 seconds just to retrieve the data?
Okay, at this point, baka alam na ng PhilHealth kung ano yung percent to total budget, ang 100.2 billion. Are you referring to the corporate operating budget, Rep. Rosas?
No, from the total budget lang, Madam Chair.
Of DOH and attached agencies?
Yes.
So paki-divide na lang po ang 100.2, divide that by 301. Yun po ang sagot.
33% po, Madam Chair.
po. Ako na sasagot para sa inyo, PhilHealth.
Magkano po yung out-of-pocket expense ng mamamayan natin noong 2020? Or do you have yung latest kung meron po?
Yusek David? based on the national health accounts, magkano po ang total out-of-pocket expenditures?
Yes, Madam Vice Chair. So the total out-of-pocket was 44.7% po. And to answer po the earlier question, the total health expenditure is in 2020 was 1 trillion.
So 1 trillion. Yung out-of-pocket expense ng 40% lang po ang binigay ninyo. Magkano po ang buo?
44.
Yusek David?
Tapos
The total out-of-pocket was 44.7 billion.
44.7 billion. Yung sa DOH po, magkano yung nilabas ng DOH? At magkano
Sorry,
rin yung
before you
inambag ng
proceed,
PhilHealth?
Rep. Rosas, parang hindi tama. Kung 1 trillion ng total healthcare expenses, hindi ba kulang-kulang 50% ang out-of-pocket? Bakit 44.7 billion lang, Yusek David? Parang hindi tama.
Yes, Madam Vice Chair. 30 seconds lang po. We will check.
Rep. Rosas, do you wish to proceed to your next question
Yes,
first?
Madam Chair. Yung sa magkano ang ambag ng DOH, tapos magkano rin yung sa PhilHealth?
Attorney Santos, what is your share in total out-of-pocket?
Madam Chairperson, Honorable Representative Brosas, out of 100 pesos, as PhilHealth pays 66 pesos out of this, meaning 66%, Madam Chairperson. Thank you very much.
Madam Chair, ang tinatanong ko po ay yung sa total, no, na inambag for 2020 ng PhilHealth.
Rep. Rosas, I think what you wanted to say is for every 100 pesos in hospital spending, ang 66 po of that 100 ay binabayaran ng PhilHealth.
So, 66%, 66%?
Attorney Santos.
Madam Chairperson, Honorable Representative Brosas, that's correct, Madam Chairperson, 66%.
Oh. Sa DOH po, magkano? Since yung out-of-pocket expense ng mamamayan natin hindi pa nasasagot, magkano rin yung inambag ng DOH?
Madam Secretary.
Yes, Madam Vice Chairperson, may we refer it to Yusek Lilibet.
Yusek David.
Yes, Madam Chair, just to answer the other question earlier, out of the 1 trillion po, 890 billion is for current health expenditure. So of this current health expenditure, 44.7% is out of pocket.
Is that in pesos? Yun ang tanong ni Rep. Rosas.
Yes.
Ano yung doon sa 890 billion, sabi nyo, i-multiply nyo by 44%. Yun yung sagot doon sa tanong ni Rep. Rosas. Tama po, Rep. Rosas?
Yes, Madam Chair. Madam Chair, gusto ko lang sabihin, kung 40.7% ang out-of-pocket expense ng ating mga mamamayan, ano na lang ang naiambag ng health, ng PhilHealth sa kabuuan ng pangangailangan ng ating mga mamamayan. At gayon din, nagpopondo tayo ng magkano 60.82 billion para sa operation ng DOH hospitals. Hindi po ba sa bilang na ito lumalabas na mas malaki yung inilalabas ng ating mga mamamayan sa kasalukuyan? Sila kasi ngayon ay nagko-contribute sa PhilHealth. Mas malaki yung nakukuha through sa contributions ng mamamayan kesa sa pagsagot sa pangangailangan na pangkalusugan, pangkalahatan nitong inilalaan natin na magkano lang na budget ng operation ng DOH hospitals. So yun, Madam Chair, saan na naman mapupunta yung budget natin? Again, that's about, sabi nyo kanina, 33% sa PhilHealth, tapos sa DOH hospital, ilan po yan? 31%. Samantala ang 40% plus ang out-of-pocket expense ng ating mga mamamayan. So, yun lang, Madam Chair, parang kawawa naman yung mga tao. Bayad sila ng bayad ng premium, tapos magkano yung balik sa kanila, 'di ba?
Yeah. Yes, Madam Vice Chairperson.
Madam Secretary, do you wish to respond to the manifestation?
Yes, actually, meron naman pong iba na tayong sources of assistance that we provide to our citizens. And also, we'd like to point out as well that when we compute for the out-of-pocket expenses, we need to look at the different services and individuals being included into this computation, because the out-of-pocket expenses would also include the private individuals who avail of these high-end services that can contribute also to the out-of-pocket computations of the population. Although, Congresswoman Brosas, we understand your point, and we take note of that, and we are trying our best to rationalize the sources of financing for our citizens. But what we need to do right now is to determine the out-of-pocket expenses specific to our indigent patients so that we can provide further assistance. Madam Vice Chairperson.
That process?
Yes, Madam Chair, kasi under the Universal Healthcare Act, dapat 'di ba, mas makikinabang ang ating mga mamamayan. Kung 14 or 15% lang ang nailalaan natin para dyan, di bakit pa tayo nag-Universal Healthcare Act tapos hindi naman pala mag-out of pocket expense naman ang ating mga mamamayan. Yun po yung point ko. Now, to my next question po, kaugnay ito sa unprogrammed appropriations. May DBM representative po tayo dito, Madam Chair, di ba? Yes, last September 7 po, 2022, ang DBM on the zero provision for procurement of COVID-19 vaccines, sabi nyo, may standby fund na amounting to 22 billion under the unprogrammed appropriations for the procurement of COVID-19 vaccines, nakalagay po. Sa previous NEPs and GAA natin, may specific line item tayo dito. Bakit siya ngayon, naka-lump ngayon, nasaan po siya? Doon sa ninyo?
Director Bad of DBM?
Yeah,
you respond.
Under our 2023 NEP, the 22 billion allocation for the vaccine is lodged under support for infrastructure projects and social programs.
Yan, Madam Chair, bakit siya nakalump ngayon sa ibang item? Bakit nasa infra siya? Dati kasi nakahiwalay yan eh.
Social program.
Director Abad?
Madam Chair, it is included under social projects. The particular purpose of particular purpose for that is support for infrastructure projects and social programs.
Yes. Process?
Yun, Madam Chair.
Final question. It's na po 5 minutes.
Yes, Madam Chair, may detailed breakdown ba of the lump sum items under the unprogrammed appropriations? Halimbawa, how much is the proposed budget for COVID-19 vaccines? Kasi before, meron ng 2.72 billion budget for the procurement of Omicron vaccine booster shot. Unfunded ito. Meron po ba kayong breakdown nito?
That was your last question, Rep. Process.
Yes, I have so many questions, Madam Chair. Pwedeng paano na lang ng mga kailangan ko pang document in preparation for the plenary, Madam Chair.
Yes, please proceed. But do you want a response first from Director Abad? Director Abad?
Madam Chair, may we clarify the question of Madam Speaker?
Rep. Process.
Madam Chair, I was asking kung naka-line item yung sa mga unprogrammed appropriations para mahanap natin saan yung proposed budget para sa COVID-19 vaccines at kung ano-ano pa. Yung breakdown lang po ng lump sum item ng unprogrammed appropriations.
Is a detailed breakdown available, Director Abad, at this point?
Kasi Madam Chair,
and if so, kindly
Oo. Sinasabi
available?
natin pag naghihingi tayo ng budget, sinasabi natin kung saan nilalagay. Wala pong secret dito. Kailangan malinaw po kung saan nilalagay ang budget ng taong bayan.
Director Abad?
Madam Chair, under our NEP, the provision is lodged as mentioned earlier and is part of the 149.69 billion under the support for infrastructure projects and social programs.
Well, what Rep. Rosas wants is a breakdown of that lump sum. Is it available?
We will provide, Your Honor.
Kindly submit to the committee before the plenary debates.
Thank you, Madam Chair.
And Rep. Rosas,
Request na
for
lang.
your final manifestation.
Yes, thank you, Madam Chair. Request na lang po for a list of corporations from which PhilHealth bought corporate bonds, including the amount and maturity nito. Madam Chair, yun po.
Right? Salamat, Rep. Rosas.
Thank you.
And Attorney Santos, kindly take note of that data request and submit at the soonest possible time. Salamat, Rep. Rosas. Ang susunod po, from the majority, we have Representative Salvador Plato.
Good afternoon, Madam Chair. Saka sa ating mga bisita from the DOH. This representation is truly happy when President Marcos continued the service of Undersecretary Berheri as officer in charge. And will be more happier if you will be appointed as secretary. Because we knew for a fact that you're one of the pillars of our health system. That's why we succeed and about to surpass the pandemic. We would like also to commend Madam Chair, the good secretary, for establishing Soper Health Center, which is a medium version of a polyclinic, an improved version of the rural health unit with the following services: laboratory facilities, pharmacy, birthing facilities, outpatient department, dental services, comprehensive physio outpatient department, and other minor services. Madam Chair, we would like to thank the Secretary. Maraming salamat po, Madam. When we meet first here 3 weeks ago, nabanggit ko po na we are a newly created district in the province of Bulacan, which is composed of the municipality of Angat, Norsagaray, and Santa Maria, which is my hometown. Our district now has a population of more than 550,000 and has only one government hospital with 150 bed capacity. The said hospital capacity is far below, based on the ideal ratio of one hospital bed per 1,000 population. It catered patients also from 3 adjacent municipalities other than our district. The hospital needs major rehabilitation because it was constructed more than 60 years ago. Unfortunately, when I reviewed the proposed budget of 2023, I was amazed why my district was not included in the health facility enhancement program. Our district needs one super health center per municipality and the immediate repair rehabilitation of our existing hospital. We have a letter request to the good secretary dated August 25, 2022. Madam Chair, may we know from the Secretary this, I would like to follow up this request. Thank you, Madam Chair.
Madam Secretary.
Yes, Madam Vice Chairperson, and good afternoon po, Congressman. Doon po sa Region 3 natin, meron po tayong mga super health centers that were identified. Nung nag-request po sila sa atin ng kayo po, Honorable Congressman, nung inyong super health center, we referred it to our regional office so that it can be validated kung po maaari na natin gawin ito, no? So I'll refer this to Director Nene Gorgolon just to give a brief response, Madam Vice Chairperson.
To differentiate it from.
Thank you, Madam Chair, Your Honors. Actually, I received the letter, sir. And particularly for one super health center, we have responded to it. So we are reviewing the NEP and we can correct that sa NEP for our final version. For the hospital that you are requesting, we refer this to the regional office to check on the profile and the status of the hospital. Once we will get the information, we will act on that, sir. Thank you very much.
Later.
Thank you, Madam Chair. Maraming salamat po, ma'am. Thank you po.
All right, salamat, Rep. Rito. Before we move to the next, Attorney Santos, yung pong sinabi ninyo kanina kay Rep. Brosas na of the 100 pesos, ang inaambag po ng PhilHealth ay 66. Parang based po dun sa sinagot ng PhilHealth kanina na 44% is out of pocket. Parang hindi po tugma. Kasi kung of the 100 pesos, 44 is out of pocket, ang maximum na pwede manggaling sa gobyerno is 56. Pero, so yung 56 na yan, merong PhilHealth share at meron din naman DOH share kasi meron tayong mga programa tulad ng MAIP. So parang tignan na lang ulit kung tama yung sinasabi ninyong 66 pesos ang inyong support for every 100 pesos. Itatanong ko na lang mamaya po. Salamat po.
Thank you, Madam Chairperson.
We now proceed to the next interpellator. Ang susunod po na 44 na magtatanong ay mula sa majority. The chair recognizes Vice Chairperson Christopher Devanesha.
Thank you, Madam Chair. Good afternoon na pala to the DOH family. Thank you, Sec. Rosario, for being so action-oriented and compassionate and accommodating to all our requests. You've also been a voice of calm and reason during this whole pandemic, as I have repeatedly said. So our constituents are very grateful for you. So while we're already in constant communication with the good secretary regarding the compliance of DOH with RA 10614, especially with the completion of the 7-story hospital building, I'd just like to put on record the following. First, that the lack of rooms and hospital beds in R1MC over the years has translated to my constituents and other patients being cared for in hallways and parking lots. In fact, sometimes they even share hospital beds, 2 or 3 patients, because again, we're not able to comply with the law that was passed in 2012 by my mother. Second, that we have been lobbying for the completion of the 7-story building since the time of Sec Obial. And third, that under my kabalayan, Sec Duque, who's also from Dagupan, the 7-story building was finally allocated some funds in the 2020 GAA. But unfortunately, 2021 and 2022 GAAs, no funding was allocated to the facility under the MAYOA or the multi-year obligation allotment. Of the 7-story building, 3 stories have been constructed, but it's still not usable until the whole building is completed. And that we're happy to see in the 2023 NEP that I think 125 million had been allocated for the facility under the MAYOA. However, we hope that this MAYOA amount could be increased so that at the soonest possible time, this facility can be used not just by my constituents, but the other Pangasinenses from Balance Pangasinan, and as it's called, Region 1 Medical Center, also from patients from La Union, Ilocos Norte, and Ilocos Sur. So we hope that this can be strongly considered by the department, and could be here, Madam Chair, a quick response from the good secretary in this regard.
Madam Secretary.
Yes, Madam Vice Chairperson, may I request Director Nene Bergolon to give our response.
Director Nene.
Yeah. Madam Chair and Honorables, thank you for that question. Actually, we had opted already on that letter, sir. We had discussed this with the management of R1MC. We have extend the MAYOA years instead of 2023. It will be 2024 until the project will be completed. So the proposed amount for next year is a regular expense. And then MAYOA will start 2024 so that in 3 years' time, the project will be completed. So we had acted on that, sir. Thank you very much.
Thank you. So happy to hear that, Madam Chair. I guess my next intervention is on the Green Health Facilities Program, which I saw in the special provisions of the NEP of DOH. May I know, Madam Chair, how much budget is allocated for this? If it's in fact a program or if this is just in the research and development stage?
Yes, Madam Vice Chairperson and Congressman, may we recognize you, Sec. Lilibet David.
Thank you, Madam Vice Chair. So yung ating pong Green Health Facilities Program has been developing standards for the integration of these Green Health Facility standards in the construction po of our Health Facilities Enhancement Program projects. So in the checklist po for the construction of health facilities, the green facility standards are included in the checklist po before they are approved. And we've also been already building green building professionals through certification trainings po. So that's what we're trying to do already with the Green Health Facilities Program.
So, Madam Chair, the program is already in effect, basically. Or it's still in the development stage?
That's correct po. We are already building our green health professionals, but at the same time po, we've already integrated the green health facility standards in our construction of our facilities.
Madam Chair, may we know, like, of all the current facilities of DOH, how many are already certified as a green health facility?
Yusek David.
As of now po, we don't have a completely certified green health facility because we've just recently integrated the standards po in our construction of health facilities.
Okay. So, Madam Chair, I'd like to put forth the suggestion of consulting with our creative industry stakeholders from the architecture sector for this purpose. Because one in particular that we had met in previous hearings we've conducted under our creative industry committee here in the lower house, we met this architectural firm that actually specializes on architecture that focuses on human health and wellness to improve sustainability. In fact, their output, which is this building that they had constructed, is the sole recipient of the Well Building Standard certification. So obviously, this is a global benchmark. We have one building here in the country that has passed that standard. So it would be, I think, beneficial to DOH to work with them and perhaps even with the rest of the architectural sector to be able to develop these standards. We were so happy to see this special provision in the NEP of DOH this year, especially since it aligns with what the DBCC through NEDA shared with us 2 Fridays ago here in the lower house, that part of the midterm goals of the Marcos administration is really to create more livable and sustainable cities. And I think a huge metric or pillar of sustainability and livability is green or green facilities. So we look forward to this innovation being undertaken by the DOH, and I hope that they could seriously consider our intervention to work with the architectural sector for this purpose, and let's tap their talents and their ideas as well. Thank you so much, Madam Chair.
Salamat, Rep. De Venecia. Please take note of the excellent suggestions of Rep. De Venecia. Do you wish to respond before we move on to the next interpellator, Madam Secretary?
We take note, Madam Vice Chairperson and Honorable Congressman Tofi De Venecia. We take note and we will be working with your group to further improve dito po sa mga facilities natin in terms of this discussion, Madam Vice Chairperson.
Salamat, Rep. De Venecia, Madam Secretary. The Chair now recognizes Rep. Jeff Nisay.
Thank you, Madam Chair. Jeff Nisay, ma'am. Blessed Monday to everyone. Sana po ang lahat ay medyo nakakain na. So, as an valid health advocate, I know that health promotion plays a very pivotal role sa ating health program implementation. At sa unang pagkakataon din, since the Universal Healthcare Law was passed, it is laudable and I commend the DOH na yung proposed allocation ng inyong ahensya para sa health promotion ngayong 2023 has now reached at least 1% 1% of the total budget as mandated. Ang una ko pong tanong, bukod sa idinagdag na pondo ng Health Promotion Bureau, it is also noted na yung ating National Health Promotion Framework Strategy has already been developed and adopted. Ang tanong ko po, Madam Chair, how will the Health Promotion Bureau assist or support health promotion at the LGU or community level? Can all LGUs, particular ang mga probinsya, syudad at munisipalidad, can access the health promotion o mayroong limitation as to the number of LGUs that will be assisted?
Yusek Bev.
Thank you very much, Chair. Sir, we are constrained by the budget that we will be having, but definitely meron pong naka-allot na grants for LGUs, both for healthy communities and healthy schools work, and we might be able to share the list with you. Alongside this are also the health promotion playbooks that the LGUs can already implement. So for this year, 2022, we have 33 LGUs who are doing the healthy communities and 9 LGUs who are doing the healthy schools program.
Yusek Bev, kindly submit the list of LGU beneficiaries. Rep. Isay.
Thank you, Madam Chair. Ang second question ko po, under Section 30.13 ng Universal Healthcare Law, IRR, the DOH and DILG are tasked to issue a joint memorandum to implement, monitor, and evaluate health promotion programs in LGUs. Has the DOH and DILG issued a joint memorandum already at ini-implement na ba ito? May we know if under the proposed budget for 2023, pwede ba namin i-expect pareho ang DOH at DILG to collaborate closely to implement this good provision of the Universal Healthcare Law? Thank you, ma'am.
Yusek Bev, pakainin muna natin si Secretary Varere.
Yes, sir. The joint memorandum circular with the ILG has already been issued early this year, at nagkaroon na rin po kami ng technical working group for healthy communities that regularly meets every quarter to implement this. From the DOH side, meron pong grants na available for the LGUs, the province and citywide health systems, but from the DILG side, that's yet to be committed po.
Siguro po yung akin pong pangatlong tanong, aside from LGUs, interested po akong malaman kung posible ba na makakuha tayo ng direct na suporta tulad ng grants or technical support on the promotion of health initiatives. Ang mga komunidad o legitimate civil society organizations, can the DOH develop guidelines on this para we can support local initiatives sa community level to help establish a healthy environment and improve the health outcomes of our population?
Yusek David, I suppose, for the sino bang assigned sa local health initiatives guidelines? Yusek Bev then. All right.
Ma'am, this is Chair. This is part of the participatory action research that's also under the UHC law and in the health promotion budget. So, like, we're asking for help po, sir, because we will be hoping to transfer some of this money to UP Manila to help give out the grants to our civil society. Kasi as of this time, wala pong mechanism yung DOH to directly give grants to civil society. So this is part of our special provision request kasi we recognize the CSO also have difficulty getting grants from typical science and technology research institutions kasi medyo mas stringent po yung request, no? Usually research proposal siya. Pero what we want is actually action researches, no, or community level activities.
Yusek Bev, kindly submit your proposed revised special provision.
Last one, under Section 30.9 naman po ng Universal Healthcare Law, IRR, the DOH and DepEd are required po na mag-submit ng integrated annual report on health promotion and health literacy programs that both agencies have respectively implemented, including its impact to health outcomes. The question, Madam Chair, does the DOH and DepEd have regular coordination with respect to health promotion initiatives? And did your agency submit a report already to the OP, Senate, and the House of Representatives?
Bev?
Thank you, Chair. Sir, we have already submitted our report for 2020 to 2021. That's isa na lang po yung report namin for both years. It's already been submitted, I think, last week or the week before. As for healthy schools, we have a joint memorandum circular also with DepEd, CHED, TESDA, LEB, as well as DSWD. So all agencies na may authority po over learning institutions. So for DepEd specifically, we already have the pilot Healthy Schools program this year. So it's being undertaken in 9 province and citywide health systems, covering at least 250 last mile schools. Hopefully next year po, we will be able to scale it up with the budget that has been provided. And this will focus on interventions that are not in the current OK sa DepEd program, which is on sexual and reproductive health, immunization, and mental health. So yun po yung main interventions that we are focusing on.
Kindly submit the said reports to the committee. Rep Nisay?
Thank you, Madam Chair. Ako po ay kaisa ninyo para pagtrabahuhan ang malakas at malusog na Pilipinas. Maraming salamat.
Salamat po, Rep Nisay. Ang susunod po ay si Representative Edgar Chato. You have the floor, sir.
Madam Chair and Madam Secretary, the rest of the DOH family, good day. First of all, allow me to express my deepest thanks and appreciation to the DOH family for continuously supporting our healthcare program in the province of Bohol, particularly in the first district, but even at the time when I was still serving as governor, DOH has always been my partner. And the realization of our multi-specialty medical complex project in the province of Bohol would not have happened without the DOH. And thank you for the support of the entire DOH family for the passage of Republic Act 11883. And also special recognition to the Secretary's office, the other bureau directors, and of course, Director Gorgolon. Should I say you, ASEC, USEC, or what? Because of the, again, sustained and continued support. May I likewise just inquire, is the IRR already completed? And has it already been signed of this law, 11883?
Madam Secretary.
Yusek David also was present in Bohol during the groundbreaking.
Yes, Madam Vice Chairperson, if I may recognize Director Tess Vera to answer.
Director Tess.
Yep. Thank you, Madam Chair and Honorable Kong Chato. Actually, the IRR has been submitted already is currently being processed for approval. So we are expediting the approval of the said IRR.
Thank you, Director Vera, also with your help. Just also, I am very interested to know if in 2023, we are expected to finish phase 1, Madam Secretary. And by the end of the year, once completed, it will be nice to see both the infrastructure and the equipment already in place, because these are now in the procurement stages. The implementation of phase 1 and phase 2 are ongoing. But I'm concerned about, once the project is completed before the end of the year, is the 2023 budget providing personnel already, so that once the equipment and the infra are there, we can initially operate or fully operate by 2024. But I think the hiring will have to be done for the training on 2023. We do not want to see a scenario where you have the facility and you have the equipment, yet you cannot run it because the personnel are not there. This is just an advanced thinking on my side and raising it to the DOH for your kind consideration.
Secretary.
Yes, Madam Vice Chairperson and Congressman Chato, we take note and we will be facilitating and working with your team. Director Tess and Director Nene will be working with you para po sabay-sabay po yung components para hindi po tayo magka-delays.
Thank you, Madam Secretary. Madam Chair, this is a multi-specialty medical complex, and it has a hospital in Tagbilaran and another hospital also in the town of Cortez. We're really looking forward that DOH, of course, expectedly will be providing the technical support for the operationalization of this hospital in 2024. I think this is something which is a big challenge, but it will help not only in the strengthening of the healthcare system in the province of Bohol, but it can even provide also opportunities for other those who would like to go to Bohol rather than go to Cebu, because this will be a facility that will provide multi-specialty services. And by the way, another important point to stress is that the Bohol Island State University will be opening its College of Medicine. And we are asking DOH to be in official partnership with the Bohol Island State University so that both entities can really help in providing better health services to our constituents. And this is in line also with the President's directive, a part of his SONA, that we should bring the facilities of multi-specialties to the countrysides. So once again, thank you to DOH. Madam Chair, thank you very much.
Salamat, Rep. Chato. Do you wish to respond?
We just want to ensure, Congressman Chato, that we commit to assist po, especially for the Bohol Island University. We will be doing, that's part of the directions also of the department.
Thank you, Madam Chair. And CHED is already putting it on the approval level. It should be able to open soon. And we need a MOA between DOH and BICOL. Thank you very much, Madam Chair, Madam Secretary.
Salamat, Rep. Chato. And once again, OIC Secretary, kindly instruct your RDs to please proceed to the HOR as soon as they can. Isa pa lang po ang nandito, si Director Ernie Vera, who is the RD of BICOL CHD. Si Director Mario Baquilod and Director Ariel Valencia are on the way. Baquilod represents Mimaropa and Director Valencia is from Calabarzon. So, hindi po tayo matatapos, I promise you, kung hindi nyo pina-participate ang regional directors dahil napakarami po talagang concerns ang ating mga kongresista. Salamat po.
Madam Vice Chairperson, just so that we would like to inform the body that we've already instructed all of our regional directors. 3 of them are here. Director Vera, Director Valencia, and Director Baquilod. And then the rest are on Zoom. Some of them will not be possible for them to go today because of the location. But definitely po in the next 2 days, they will be going around the different districts, respective districts within their jurisdiction po, Madam Vice Chairperson.
All right. Salamat po. Next interpellate, Representative Rufus Rodriguez. Sir, you have the floor.
Thank you very much, Madam Chair. Stella Kimbo, my distinguished colleagues in Congress present today, physically and on Zoom, and especially the official dome of the Department of Health, from where our modern heroes come from. And from the bottom of our hearts, we thank the Department of Health, headed by now Secretary Maria Rosario Singh Verjaer. Diba? No. So yan. I would also like to, may I have your permission to call you Secretary Verjaer? Okay. I have the permission of the owner of the name. So, Madam Secretary, your people in Cagayan de Oro, especially the 2nd District, the DOH Regional Office, headed by your outstanding Regional Director, Boy Lacuna, who was also our Assistant Regional Director 10 years ago, had been serving in an outstanding manner our people in this COVID-19 pandemic era, including now. And he is supported by your DOH personnel and also the Northern Mindanao Medical Center, the premier hospital in Mindanao and the Philippines. The NMMC is headed by a very efficient and outstanding director, Jose Chan. And among your ranks, I can see my very good friend, Uaway Bacaresa, who is now with PhilHealth, and we can depend on him to straighten up PhilHealth. Now, we go now to the budget. I am really happy that you have a 10% increase from the GAA, from the budget of 2022. 10%. From 189, you are now 196. But I'm sure that you asked for more because the battle against the epidemic, against the pandemic continues to rage. Plus the dengue and the monkeypox probably coming over. How much was your proposal for 2023?
Madam Secretary.
Yes, Madam Vice Chairperson, and magandang hapon po. We have a total of 300.
Kong Rufus.
Yes, sir. Kong Rufus. I'm sorry. Kong Rufus, magandang hapon po. We have proposed a total of 345 billion. 25 billion for 2023, but we were approved for 301 billion, Congressman Rufus.
It's a difference of more than 40 billion. And if there's any agency which our government should provide more funding for 2023, I put on record, it should be the Department of Health. Now, therefore, in the proper time, Madam Chair, we will ask, of course, Secretary Vergere, what are the most priority expenditures that you should have and submit it to the committee. We may not talk about the from 342 to 310, about 30 billion, but we must be talking in terms of about 3 to 5 billion because everybody would agree you have the backing of the people of the Republic of the Philippines that this should be increased. I've received a lot of texts and messages. DOH is the priority always. Of course, education is there, but DOH is the battleground right now. Now, I would like now to go. So please submit to us a priority list for 3 to 5 billion. We'll try to work out. Because if Stella Kimbo is here and Congressman Janet Garin, there is no way that they will deny our request. Yes, okay. And of course, Edsel Segman, the legal luminary of the entire Congress of the Republic of the Philippines. Now, I go now to my favorite topic. This is where now it is really HFEP. Ayon. I am really, I normally do not get mad, but I may in the budget given Cagayan de Oro. Madam Chair and Secretary Vergere, you see, you have a budget of 5.6 billion pesos, 5.6 billion pesos for the 688 RHUs, which include my rural health units in my barangays. May I ask you, how much are you giving to Cagayan de Oro, 2nd District, for 2023 out of the 5.6 billion pesos?
Yes,
I have my figure here, but please read, because you yourself will be ashamed to read that.
Yes, Madam Vice Chairperson, Congressman Rufus, we have allotted 12 million pesos for the RHUs in the 2nd District of Cagayan de Oro.
Oh, my figure is different. It's only 5 million. May we know whether...
Okay na, Reproductive.
Wala kasi I am asking for only this one. Just for the record, because we are representatives of our districts. When we talk here, we are carrying the needs and the requests of our district. And here is what we have. Can you kindly check? Because the last time I know, I am in constant touch with your director and Engineer Mallorca, your engineering, implementer there. I am not asking, Madam Chair, for the 100 million for the hospitals. No problem. The hospitals can do there very well, Jerbora and the others, no? But this is what my request is. I'd like to know if it's in your list. Number one, the health center of, how can I enlarge? Yes. Health center of FS Catanico, yes, FS Catanico of 2.5 million. Is that there?
Madam Secretary.
Yes, Madam Vice Chairperson, we only have the Gusa Super Health Center here, but I will refer the question to Director Nene Gorgolon.
Yes,
Rodriguez.
Yeah.
Your 5 minutes are up.
Yeah, we
Anyway,
just
meron po
finalized,
kayong
Madam Chair.
140% increase.
No,
from 5
because
million to
what
12
we have,
million.
what I know, this is to make clarified, Madam Chair. We cannot have this just passed on, no, because only 5 million was given to us. Can you confirm that? Gusa. Because I am really disheartened, Madam Chair. And we don't want anymore to go to the plenary to be helpful for us to these minute things. I'm only requesting, because what was said 12 is not the case. Can we have the one in charge of the housing? Yeah, so that we can know.
Madam Secretary, can you confirm, is it 5 or is it 12 million?
Director Nene, can you recognize?
Director Nene?
Yes, Madam Chair, Your Honors. I would like to confirm that it's 12 million as corrected. I would like to emphasize that Cagayan de Oro is already category 2, meaning under Mandana's ruling, it's already devolved as early as 2022. That's why the allocation for barangay health station is not included po.
Madam Chair.
For your particular district po, you have Northern Mindanao Medical Center, wherein we have a total budget of 325 million, sir, Your Honor.
Yeah, we're not talking about that. We're talking about the Health Facilities Enhancement Program. Can you answer properly? We're not talking about the Northern Mindanao Medical Center. That is the big medical center in Cagayan de Oro. What we're asking are my barangays. Which barangays are included in your 12 billion, I see? Because only 5, Gusa. And my God, when I saw that, I really felt bad because 5.6 billion, even Cagayan de Oro, there's a Mandana's ruling. These are very small. How much are we asking? Only 13.5 million. That's in the proposal. Only 13.5. And you gave us 5 million only. Oh, how can I explain that to the people of Cagayan de Oro? Very small request. Because I'm not asking for the 100 million for the hospitals. No, only the barangays. Because that is where it's needed. Cagayan de Oro is a highly urbanized city. The residents there are burgeoning because that is the center of industry, commerce, and services in Region 10. So can you tell me now, what are the barangays?
Before you answer, Rep. Rodriguez, your time's up.
No,
so
Madam
sorry
Chair,
about
I would
that.
like to ask because
Director Nene,
it's just
yes, Director Nene will answer.
It's the last question. It's just clarification.
Tama po, she will answer po.
What are these barangays that you gave 12 million? Let's see. Read them one by one.
Kindly read out the names of the barangays that will benefit from the 12 million allocation.
Sir, Gusa Health Center.
That's 5 million. That's the one I know.
It's corrected already, sir.
To how much?
It's 12 million, sir.
Oh, see? Only one barangay you've corrected. But you have not corrected my 7 other barangays out of 56 barangays.
Sir, we will review and we will
I will
coordinate
cut
po.
it short because Secretary Verjair is here. Would you be willing to receive my letter? Only requesting, aside from the 10, another only 13.7 million, 2.5 million each for the rehabilitation of 5 barangays, 1 for 9.5 and 1 for 3. We can cut this short. We are asking the committee, our secretary, can you kindly look at this, adding only 7 barangays out of 56 barangays of Cagayan de Oro? What is the answer of the secretary? Because I will stop once the secretary commits.
Salamat, Secretary. Salamat, Rep. Rodriguez.
Let's hear the secretary.
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Rufus, we will receive your letter. We will evaluate again, and then we will be providing you with feedback, sir.
With that is the right Secretary of the Department of Health. You know, because she has seen the needs of my city. Imagine, one barangay lang bibigyan ng 12. How about my other barangays? So thank you very much. My thanks and the city of Cagayan de Oro, the city of Golden Friendship. Thanks, Secretary Verjair, for that immediate commitment for our city of Cagayan de Oro. Thank you very much, Madam Chair.
Salamat, Rep. Rodriguez. The next interpellate
Kakain ako.
is Vice Chair Luisa Cuaresma. No, kasi nagpa-move siya to number 8. Okay, she's not around, so we move to Representative Ramon Gutierrez. All right. We return to Vice Chair Cuaresma. Are you around via Zoom, ma'am? How about Representative Ramon Gutierrez? Are you on Zoom?
Madam Chair.
There you are.
Madam Chair, I've already manifested to the Secretariat that my question has been answered. Thank you po, Madam Chair.
Salamat, Rep. Gutierrez. Next interpellate is Deputy Majority Leader Jose Bong Teves Jr., who likewise has yielded to Representative Cali Dimaporo. Finally, sir.
Thank you, Madam Chair. My first question is again about the Universal Health Care Act. I'd like to get from the DOH again, Madam Chair, what are the provinces enrolled into this into the UHC? Do we still have pilot provinces, or is this being implemented nationwide?
Madam Secretary, I believe you are referring to the 58 integration sites. Is that correct?
Yes, Madam Vice Chairperson, and magandang hapon po, Congressman. Meron ho tayo ngayong 58 sites, tapos may 13 tayo na bago. Dito po sa 58 na integration sites na to, we have been starting our implementation of the reforms. We've started integrating financially and technically. Ito po sa new sites na ito, we will still do the same process as before. They are given additional assistance also in order for them to implement the reforms, Congressman.
Madam Chair, my question was specifically provinces. I'd like to know which sites are provinces.
Madam Secretary, or Rep. Dimaporo, do you wish to ask about your province?
Well, I would like to ask, my next question is in regards to the preparation for these provinces or the identified sites. If part of the reform is for the local government units, specifically provinces, to come up with their province investment plan for health.
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Dimaporo, we have 59 provinces as part of these integration sites. And the PIPH, or the Province-Wide Investment Plan for Health, is part of the reforms that we are doing.
Madam Chair, I'd like to ask, this province-wide investment plan for health, is this somewhat of a wish list that the provinces can give to the DOH so that they can counterpart in terms of investment into healthcare facilities?
Yes, Madam Vice Chair and Congressman Dimaporo, the provincial or the province-wide investment plan for health is a basket of investments for us to be able to harmonize and align all of the initiatives within a specific area dun po sa iisa lang na plano na naandun din po na pwedeng pag-usapan kung ano po yung mga sources of funds. So in effect, maaari pong nagiging wish list din dahil binibigay po ng province yung kanilang mga kailangan at tinitignan kung match naman po yung mga needs na yon based on the resources that had been identified. So yes, that can be Congressman Dimaporo. But although there should be at the end of this undertaking an agreement between and among kung ano yung dapat na priorities at dapat mapondohan for specific timelines, Congressman Dimaporo.
Madam Chair, is the province-wide investment plan for health an output or a result of the Universal Health Care Act that was passed by the House of Representatives and the Senate?
Yes, Madam Vice Chairperson and Congressman Dimaporo, the PIPH has long been here even before the universal health care. It is being used by the provinces or the local governments for them to be able to determine what are their needs and what would be the sources of funds. So even before the UHC law, ginagawa na po ito. Mas na-streamline lang po at mas naging institutionalized when UHC law was passed.
So that I take note that it was institutionalized when the UHC was passed. I'd like to ask my next question. What's the total amount that the provinces are asking or need to invest to properly implement the UHC? It should be totaled up, all of these different provinces. How much do they need for their investment plan for health? And how much has the DOH given them? For example, if all provinces that are being rolled out need 100 billion, the DOH has released roughly 50 billion. So then that means that there's 50 billion that's left that needs to be invested for local government health systems.
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Dimaporo, may I request Yusek Kenneth Ronquillo to respond to the
Yusek Kenneth, you're recognized.
Madam Chair, so things go fast. I'll just have them submit that data to the committee secretariat. I'd like to now ask, now this investment plan for health for the provinces has been affected by the Mandanas ruling?
Madam Secretary.
Actually, I don't think that this investment plan will be affected by the Mandanas ruling. It's just so that it's going to be more rational because we are going to just, shift the resources that are needed for these basic commodities in this devolution transition as a result of the Mandanas-Garcia ruling to local governments, getting it from the national government side. So it's just rationalizing and shifting the resources where it's going to come from. But the investment plan, as I've said, is a basket of all of these investments. So wala po tayong gagalawin, walang tatanggalin. Yun lamang po, kung sino na yung magbabayad ngayon, yun po yung mababago.
Thank you, Madam Chair. And so if, for example, part of the investment plan for health requires an investment from the DOH or an assistance from the DOH through the HFEP for new buildings in the provincial hospitals, that has been struck out. That's my understanding because of the Mandanas ruling. We now need to look for local funding.
There is this classification, Madam Vice Chairperson and Congressman Dimaporo. We call it the allocation framework. And because we are trying to prioritize also as we do not have that ganun kadaming funds. So ngayon po, we did our framework where those areas which has capacity and lesser gaps, ilalagay ho natin sila, mas ipaprioritize po natin yung mga areas na mas mataas ang gap at mababa lang ang capacity nila to invest. So that's why if there are areas, katulad po nung areas na may mga high capacity, o kaya mababa lang naman po yung gap, hindi po namin sila na-prioritize. Ang prioritize muna po yung mga merong matataas po na mga kailangan at mababa po ang capacity to have resources po. Madam Vice Chairperson and Congressman Dimaporo.
Thank you, Madam Chair. And the point that I'm trying to drive is, this needs to be a whole-of-nation approach. Local healthcare reform needs to be a whole-of-nation approach. And the problem that I foresee because of the Mandanas ruling, and if it's true that my assumption is correct, that there has been a budget that has been decreased in terms of the allocation of assistance to infrastructure project to our provincial government and municipal governments, then we no longer have the carrot that we will be dangling on the local government units, because we have to ask this question. There is autonomy. And what if the local chief executive does not care about healthcare? What are we going to do about that?
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman Dimaporo, we take note and we fully understand your point, and that is something that has to be considered. But in this, ayos lang ho namin, we'll discuss. But the very reason why we have this allocation framework was because of the lesser resources that we have right now. Because meron nga pong Mandanas Garcia at hindi rin po na-approve yung entirety ng hinihingi natin from the national government coffers. But we fully understand your point, sir, and we will try to discuss this also within our teams.
Well, I hope, Madam Chair, that the DOH will look into the fact that the UHC is a new law. Therefore, the Mandanas ruling should not apply on the HFEP, especially when it comes to a program such as the UHC, which will invigorate local healthcare reform. I'd like to ask the next question, Madam Chair. What's the budget for barangay doctors to the barrio, nurses to the barrio, and medicines to the barangay health centers and the rural health units? Are we still giving for 2023?
Yes, Madam Vice Chairperson, Congressman Dimaporo, it's 16.95 billion for our deployment program or the National Health Workforce Support.
Is that for all items mentioned?
Yes, Madam Chairperson, it's a total.
It's a total, Rep. Maporo.
Well, I'll ask for a breakdown in terms of medicines to our barangay health units, medicines to our RHUs, nurses for our RHUs, and doctors to the barrio, and exactly where it will be distributed and deployed. The reason why I'm saying this is, again, what if the local chief executive does not care about healthcare? The budget no longer comes from the local government unit, but instead all of these subsidies from the national government. I'll give you an example. I'm very happy you have given one municipality in my district a super center RHU. Pero walang MHO, zero budget for medicine. It's only whatever's for free from the national government. That is the wrong mentality that we are propagating in our local, in our municipalities. And there should be some sort of check and balance. I'd like to know, Madam Chair, is there a check and balance as far as the DOH is concerned?
Madam Secretary.
Yes, Madam Chairperson and Congressman Dimaporo. Yes, we have this check and balance, Madam Vice Chairperson. If I can ask Yusek Kenneth Ronquillo, is our expert on health human resources, to respond.
Yusek Kenneth, you're recognized.
Sabihin mo muna yung total if you're interested in.
Good afternoon, Chair, and thank you very much. Well, as I said, the total budget is 16.3 billion for all cadres. This is divided into very specific numbers. Per professional, we can provide that, and we can also provide the specific numbers for your district, Congressman.
Rep. Dimaporo, you have 20 seconds. Kindly wind up.
Well, that's not what I'm looking for, but I would like them to submit to my office or to the committee secretariat for all of their barangay health centers that they're giving, for all their RHUs improvements that they're giving. I'd like to know exactly what is the municipality investing in. Have the barangays hired midwives? Have the municipalities hired doctors, pharmacists, and so forth? Because if they're not, then it's a one-way implementation of it's only the national government that's working, not the local government unit. And one of the things that could be looked into is, in the LGU, we have the seal of good housekeeping. And I don't know if the DOH has utilized some sort of governance framework device, such as seal of good health standard or something like that, as a prerequisite before assistance or financial assistance or projects will be given to the municipalities, because that will also allow us here in Congress to track whether or not our municipalities have kept up to the standards of the DOH. That's my last comment and question, Madam Chair. Thank you for the time to ask questions.
Salamat, Rep. Dimaporo. Madam Secretary, Rep. Dimaporo raised excellent points. Dun po sa devolution transition plan ninyo, does it have an assessment of the current situation? Yun po ang tinatanong niya. And number two, does your plan identify specific measures to address the possibility of underspending or lack of willingness of the LGUs to actually pay for the devolved health services?
Yes, maraming salamat po, Madam Vice Chairperson and Congressman Dimaporo. Yes, we have this assessment done dito po sa devolution transition. That's why we have this allocation framework. That's why we have these different classifications. Kasi kapag wala pong capacity yung local area, hindi po yung devolution will be different from those with higher capacity na areas, just like with HREP. The second question would be as to the deployment. We are really challenged by this. If you remember Doctors to the Barrio, it was implemented decades ago. Nung in-implement po ang Doctors to the Barrio, it was originally, ang objective was a band-aid solution for us to have doctors, but eventually, ma-absorb ng local governments para meron tayo. Unfortunately, this kind of arrangement doesn't happen. Most of the local governments will not hire the DTTB that will be deployed. So kailangan po namin na regular na nagde-deploy because most of the LGUs cannot afford apparently to hire these doctors na nilalagay po natin sa kanila. So that's a gap. Kasi hindi tayo makaalpa sa deploying instead of having them as permanent in the locality that we have deployed them.
Right, so please also take note of the requested submissions. Next to interpellate is Vice Chair Luisa Quaresma.
Thank you very much, Madam Chairman. And magandang hapon po sa inyong lahat. I'm just concerned with just one. Marami sana ito, but I already asked Congressman Garin to bring to you yung aking mga problema. It's all about the unfinished construction of unfinished barangay health station. There's been a long, I think there's one or two in my district that the construction was started like 2-3 years ago, and up to this time po, hindi pa ho natatapos. Kaya what I'm planning to do now, para hindi naman nakakahiya sa mga tao, is for me already to allocate from our hard fund for the completion of this barangay health station. And isa pa po, Madam Chairman, is that mga bulok ang pagkagawa ng ating barangay health station. You kindly instruct, Madam Secretary, your contractors to also do a better construction of barangay health station. Imagine mga cabinet, di pa it was not yet endorsed completely to the LTU, pero sira na yung mga cabinet, something like that. Try to visit some barangay health stations in my area, in my district. Nakakahiya. Kaya pagka sinabi nila sa akin, all I have to do is hayaan nyo, sasabihan natin sila. All the time. Yun lang ang concern ko. Marami sana ako, but I know that a lot more to ask question. Madam Chairman, thank you very much.
Salamat, Rep. Quaresma. Madam Secretary, kindly respond.
Yes, Madam Vice Chairperson and Congresswoman Quaresma, we commit that our regional director will go to your area to visit this unfinished construction and this poor quality of construction of your barangay health station so that we can address it immediately.
Yeah, and Madam Chairman, thank you, Secretary. I can accompany your regional director in going around so that she could really see for herself kung ano yung klase ng ginagawa ng inyong mga contractors. Another one is support. We need support for Region 2 Trauma and Medical Center. Like, for example, there's the construction of our evacuation center and the construction of biomolecular, what's that? RT-PCR laboratory, something like that. Hanggang ngayon, I think there's something wrong with they have a problem with DBM releases. Hindi nababayaran po yung mga contractor. So it's a delay. In other words, if the construction is delayed, lalong magmamahal po sa ang lahat, di ba? It started a long time ago, but up to this time, because the contractor has never been given a payment. So because I don't know what's the problem with this DBM. Kaya alam ko rin, I understand your situation, you in the Department of Health. Dahil ang problema naman lagi nasa DBM, di ba? Kaya yun lang, Madam Chairman, kindly look into the situation or the predicament of Region 2 Trauma and Medical Center. And if there's a way, because in the previous, there's already a Republic Act or that my the bed capacity of Region 2 Trauma and Medical Center from 200 was improved to or adjusted to increase to 500 bed capacity. Kaya lang, how can we accommodate all these 500 patients when we do not have structures or buildings to accommodate yung patients? So may I appeal, Madam Chairman, to the Department of Health, to our Secretary, if there's a way for you to please also add an additional fund for the construction of some additional buildings to accommodate these 500 patients in my district. Thank you. In Region 2 Trauma and Medical Center. Maraming salamat po.
Madam Secretary.
Yes, Madam Vice Chairperson and Congresswoman Quaresma, we have allotted 188 million for Region 2 Trauma and Medical Center. This is 116 million for infrastructure and 72 million for equipment, ma'am.
Is that already, is the dialysis equipment a part of that you mentioned, Madam Secretary? Kasi you just provided like I think 12 dialysis machine in our area. In Nueva Vizcaya, in my district, ang nagda-dialysis po is more or less about 500 patients. Yun po. That's why we need an additional for the equipments. Pero parang there's like, we have actually a new director. Gusto ko yun. Kasi really he's working for change, something like that. Maayos siya. And we just need the support of your agency, ma'am. Thank you.
Madam Secretary.
Yes, Congresswoman Quaresma, we commit that we will be facilitating the assistance. And yung dialysis po, the 72 million are for equipment. So we will have a regional director discuss with you what would be of priority para yun ang unahin natin since this will go through rin naman po dun sa ospital. So i-prioritize natin kung ano lang po yung pinakakailangan yun ang uunahin natin.
Salamat, Rep. Quaresma. OIC Secretary, tomorrow we are setting aside one room at the 4th floor of this building para po yan sa mga regional directors ninyo na kailangan po makipag-usap sa mga kongresista. Baliwala po kung pumunta sila sa distrito kasi karamihan po sa amin ay nandito ngayon sa Kongreso. So could you kindly instruct them to please see their representatives tomorrow or a day after tomorrow. So 2 days po namin i-reserve ang kwarto na yan sa 4th floor ng building na to.
Yes, Madam Vice Chairperson, all of them were instructed. All of them will be going here tomorrow. 4th floor po dito sa South Wing Annex.
Salamat, Secretary. Beginning 9 a.m., no? Beginning 9 a.m. Beginning 9 a.m., 4th floor of the SWA building. Ang DOH regional directors ay present po dito sa House of Representatives. Next interpellate is Vice Chair Alfonso Umali. Vice Chair Alfonso Umali, second call. We now move to the chairman of the Committee on Health. The chair recognizes Representative Gato.
Thank you, Madam Chair. To our esteemed colleagues, our guests from the Department of Health family, headed by and attached agencies, headed by our Secretary Verhiere. Good afternoon. I will not have any questions, just a short manifestation.
Go ahead, please.
Alam po natin, nasa gitna pa rin tayo ng pandemya. Kahit gumaganda na ang figures and stats ng COVID, pag nating kalimutan, meron pa tayo mga non-COVID, communicable diseases, infrastructures, equipments, medicines and vaccines na kailangan natin pondohan. So it is in this light that I join the Department of Health family in earnestly appealing to the esteemed members of this committee to increase and approve in consonance with the original budget of the Department of Health. Thank you very much, Madam Chair.
Salamat, Chairman Gato. Madam Secretary, do you wish to respond?
Yes, Madam Vice Chairperson and Honorable Congressman Gato, maraming salamat po sa inyong pagsuporta. Totoo po, marami pa rin pong pangangailangan outside of COVID and we have submitted already the list of the appeals of the department for our 2023 budget. Maraming salamat po.
Salamat. Ang susunod na mag-interpellate ay si Representative Christian Onabia. Next is Representative Joel Chua.
Thank you, Madam Chair. Madam Chair, nais ko lamang pong tanungin ang ating masipag na secretary. Pag tayo po gumagawa ng budget, lalong-lalo na po yung mga big hospitals, di po ba gumagawa po tayo ng mga forward estimate? Tama po ba? Yung forward estimate po, yung pong project cost hanggang dulo po, tapos kung ilang year po yan para mapondohan, tama po ba? Okay. Sa project cost po, meron po diyang mga multi-year, tama po ba? Now, dito po sa sinubmit po ninyong budget, meron po ba tayo ditong mga existing project na mga hospital na pinondohan this year pero hindi na po mapopondohan for next year?
Madam Secretary.
Yes, Madam Vice Chairperson, if we may recognize Director Nene Gorgolon to respond.
Director Nene, you're recognized.
Yeah, Madam Chair, Your Honor. Yes, that can happen po, especially if the proposed costing or the forward
Estimate.
estimate is not enough because yearly we have a limited resources or allocation for HFEP. That's why we opt to have this MAYOA for us to be assured of continuity of funding for that building to be completed and functional. It will happen po. Thank you very much.
Okay, so yung mga unfunded project po for this year, for next year po, ano po ang gagawin natin doon? Like for example, nagpondo po tayo ng isang ospital, nakatiwangwang na po to, puro poste na lang po nakalagay, and then hindi na po natin itutuloy because that is not included in the budget for next year. So ano na po mangyayari ngayon doon? That is like parang white elephant na po siya doon na nakatiwangwang.
Actually, sir, yun ang isa sa mga ating sinasabi sa lahat ng ating hospital in our availment guideline number 1 to complete the existing structure for it to be functional. That's why we ask them to resort to MAYOA kasi talagang limited po yung ating allocation for each year. So talagang tinutugunan po namin na yan ng HPEP.
Yes, I will give you one example. One example is my district, the 3rd district of Manila. Dito po sa Mother and Child Hospital, meron po dyan mga nasimulan po kayo. I think you allocated 50 million para po sa pagtatayo ng hospital. But unfortunately, parang hindi pa po parang poste pa lang po yata o foundation pa lang po. And now, when the director visited me, sabi niya it will be funded. But I was surprised when the NEP came out, hindi ko po makita yung pondo. So what happened now? Tititigan na lang po ba namin yung poste?
Titingnan ko yan. Baka yun naman yung ating sinasabi dahil usually Manila po is category 2 or 4 na high capacity. So talagang nasasagasaan siya ng Mandanas ruling. So we will review on that, sir. And then we will update you po. Thank you very much.
Yung pong lagi nyo binabanggit yung Mandanas ruling, but did you bother to coordinate with the local government?
Madam Vice Chair. Yes, Madam Vice Chairperson, Congressman, we will please submit to our office. We will be considering this since na-umpisahan na po. Titingnan natin how we can manage and then we will be updating you, sir.
Thank you, ma'am. Maraming salamat. Kasi po, sa totoo lang, ang laki po nung nakatiwangwang po doon. Lahat po tinatanong kami. In the City of Manila, for the information of the good secretary, hindi na po niya ma-accommodate yan. I used to be the chairman of the Committee on Appropriation in the City Council of Manila. Alam po ninyo, inallocate po namin yung, tingnan po ninyo, the City of, ang pondo po ng Manila, 45% po PS. Pero alam naman po natin, hindi lamang po natatapos doon yung PS sa 45% dahil may mga general services pa, yung mga JO na hindi po kinakount sa PS, nasa MOE po yun. So yung pagpapasweldo po, halos 55%, may 5% pa po para sa disaster na ina-allocate. Tapos nagpasa po kami ng mga allowance para sa senior. So halos na wala na po, halos na ubos na po yung pondo namin. Now, yung Mandanas ruling po, noong 2021 to 2022 budget, 1.2 billion lang po ang in-increase. Surprisingly, noong 2022 to 2023, nagkaroon po kami ng decrease na 700 million. And ang projection po ng DBM sa 2024, mas bababa pa po. So parang wala rin pong nangyari dun sa Mandanas ruling. May regular naman po talagang increase yung IRA na ngayon po. And ang tawag na, iba na po yata ang tawag nila ngayon, hindi na po IRA. NTA na po. So, sa totoo lang, wala na pong matitirang pondo para sa City of Manila. Kaya, sana po mapondohan po natin because we've been a good host to the Department of Health. And in fact, during the pandemic, marami po kami po ang nagsusupply ng gamot. Marami po mga, hindi lang po sa Manila, sa buong Pilipinas po, may mga tumatawag po sa amin. Kami po nagbibigay ng remdesivir, tocilizumab, so forth and so on. So sana naman po, kasi napansin ko po dito sa pondo po ninyo, wala pong City of Manila. Wala po talagang pondo ang City of Manila. So sana po yung ating pong department ma-consider po itong ating ano. Another thing po, ito po.
Pasensya na po. Your time is up.
Tapos po agad. Sige, thank you po, Madam Chair.
Madam Secretary, kindly respond.
Yes, Madam Vice Chairperson and Congressman Kua, I was just given the feedback that we have allotted 50 million for 2023 for the Justice Jose Abad Santos General Hospital. And just to clarify po, Congressman Chua, marami rin po tayong nilagay din sa districts na iba sa Manila. And we will continuously support naman po ang
Thank you po, ma'am.
Manila.
Thank you po.
Salamat, Rep. Chua. Next to interpellate is Representative Florence Reyes of Anakalusugan.
Thank you, Madam Chair. Madam Secretary, thank you. Good afternoon. Okay, few things on the budget. There is a portion there, the LFP, Public Health Emergency Benefits and Allowances budget. Can I confirm po if the what is supposed to be the program fund is supposed to be payments for arrears on the healthcare workers? Is that correct? Or can you correct me if that was what it was for?
Secretary.
Madam Vice Chairperson, can we recognize Director Weng Laura again to respond
Director
to
Laura.
this question?
Good afternoon po, Madam Chair. With regards to the payment for arrears, we are actually requesting for the health emergency allowance that remains unpaid from July 2021 up to December of 2021 in accordance with the law po. Thank you po.
Okay, thank you. Madam Chair, I was just wondering as to what was the delay, what caused the delay on the payment of the arrears? I mean, these are healthcare workers that have already provided the needed service already, especially during this COVID response. Can you detail as to what caused this delay?
Madam Secretary.
Yes, Madam Vice Chairperson and Congressman, una-una po, there is this provision that was stated in RA 11712, which specifically stated that there is retroactive provision of these allowances from July 2021 to the current time. So when this law was issued, wala pong pondo, it was not funded, yun pong July 2021 to December 2021. And that was the result. The result of that would be we have now arrears to our healthcare workers where we do not know where to get the funds for about 64 billion pesos.
Sorry, Madam Chair, Madam Secretary, 64 billion pesos.
Yes, Madam Vice Chairperson and Congressman, yes po, 64 billion ngayon po yung listahan ng arrears namin. Kasama na rin po doon yung mga 2022 na allowances na kailangan pa namin ma-release din na hindi pa huli namin na ibibigay.
Okay, and this one already you have already allocated it into this incoming NEP.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, we have proposed 76 billion for the year 2023. And this is for us to continuously provide the benefits and allowance, the health emergency allowance until the end of 2023. But we were only given 19 billion as programmed funds. So this would only last for the first 3 months. But we still do not have funds for the arrears for our healthcare workers.
Madam Chair, Madam Secretary, I think we do need to pay close attention to this because this is already for our workers, and we cannot just keep on kicking the can down the road and then say na pwede bang hintayin na natin yung dumating yung allocation for the funds. Is this because this is what was provided by the DBM only, Madam Secretary, Madam Chair?
Yes, Honorable Congressman, yan lang po yung funds natin sa ngayon. I think yun po kasing provision sa law rin, yung retroactive, was something that we were all not prepared for. So ito naman pong mga iba natin, mga forward-looking, yun po, kulang pa rin for 2023 ang na-i-approve sa atin.
Okay, thank you, Madam Chair, Madam Secretary. I think we will work, our representation will work on how we could actually find a way on how to fund this, because I think this is long overdue. And I think you share the same sentiments of our representation that we do need to compensate them already for this. Thank you. Then the next one, I think when we asked a few days ago with regards to our plan for the vaccine immunization, Madam Secretary, Madam Chair, when we were talking, we were looking at a 50% total immunization of the first booster by October 8th. And then we were looking at around 75 to 80% by the end of 2022. If I'm not mistaken, it's just supposed to be in this budget na rin. Would you already have the catch-up plan that we were requesting?
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, we have the catch-up plan for our first booster doses until the end of the year. And we do not need any funds for us to procure additional vaccines, but only for the other requirements as to this plan, ito pong catch-up plan. We have our special vaccination days, and we are working with other sectors for us to improve on the vaccination coverage. Yun po yung meron tayo ngayon for us to improve our first booster doses for the population.
Thank you. Yes, I wish to manifest that our representation is ready to work with the DOH on how we could assist in this, because this one is really important to us. Thank you. Then the next one is on the super health centers. Can we know the parameters on how this is prioritized on the construction or identification of the sites, and how come some places already have 2 centers, some do not have none? When what we do intend is to have at least 1 per municipality, can we know the parameters?
Director Nene.
Yeah. Madam Chair and the honorables, I would like to emphasize that the Super Health Center was only conceptualized last year for this year 2022. So we envision that this is an upgraded issue for us to be able to complement our primary care facilities under UHC. So because of the limited resources, we ask our regional directors to at least identify 1 super health center per congressional district, which is not redundant to the existing. So the parameter is the super health center should have a manpower to operate when this will be completed, and first of all, a lot. So yung readiness ng site. So ang regional offices po yung ang nagsasubmit doon and try to check kung talagang may lot at saka may presence of HRH para pag matapos po ito magiging functional. Salamat po.
Okay, thank you, Madam Chair, Madam Secretary. So yes, we will. I will get in touch with the regional heads so that we could determine these sites and find a way on how to expedite. We've expressed our desire on how to deploy it, because based on our anecdotal feedback, these have become quite the effective program. So we intend to pursue this. Thank you. So the next question would be in PhilHealth. Attorney Ellie, yes, would we already have, when we asked around last week, if we already have the actual fund life of PhilHealth, basically the fund that we have? for PhilHealth so that we could continue our services.
Attorney Santos.
Madam Chairperson, Honorable Representative Reyes, may we request our acting SVP for Actuarial Services, Ma'am Neri Santiago. She is present online, Madam Chairperson, please. to answer the
Mr.
question.
President, would you know the actuarial life of the fund that you manage?
2027.
Yes, Madam Chair, I wish
So I
to
think
because
you can answer the questions.
because I think such kind of basic information is very important already. I mean, we are talking of the fund that is supposed to be servicing the citizens, and the basic number, that kind of basic information should be available, and especially to people who are already in this meeting.
Attorney Santos.
Madam Chairperson, Honorable Representative Reyes, Madam Chairperson, we already
Could you kindly speak closer to the mic?
Madam Chairperson, we will, on the side of PhilHealth, we will confirm if we have already submitted, and I believe we have already submitted the documents. We just need to confirm it. Madam Chairperson, if we already submitted it, the required actuarial estimates of PhilHealth, Madam Chairperson, I have here part of the submission of PhilHealth. Madam Chairperson, Honorable Representative Reyes, if PhilHealth receives the government subsidy for indirect contributors, as well as the PAGCOR share and PCO's share, Madam Chairperson, we estimate that we will survive beyond 2027. We have another scenario, Madam Chairperson, if we will only receive PAGCOR and PCO support for 2023 per DBM recommended NEP with subsequent years. We have until 2027, Madam Chairperson. But if we have no further support, Madam Chairperson, by 2027, based on the projection of PhilHealth, we will only be until 2027, Madam Chairperson. However, Madam Chairperson, may I request that we be allowed our representative from the Actuarial Services, Ma'am Neri Santiago, who made this projection, be allowed, Madam Chairperson, to confirm this information. Madam Chairperson, please.
Representative Reyes, are you satisfied with the answer?
Well, I guess that's where it was leading to. We just needed to find out how long can PhilHealth last given its current rate of replenishment and depletion. We only have until 2027. Can I confirm this?
Attorney Santos.
Madam Chairperson, if we receive all the subsidy from the government and we implement the programs of PhilHealth, yes, we will last beyond the year 2027, Madam Chairperson, Honorable Representative Reyes.
All right. Thank you, Madam Chair. Then what does PhilHealth have? Because from a risk management standpoint, and you know I always specify risk management because this is an insurance fund, not a basic health fund. So we have to look into that. We have to look through that. How can we find a way to extend the life of this fund?
Attorney Santos.
Madam Chairperson, again, from the side of PhilHealth, we really need the support of the national government in providing for the subsidy. We really need the support as provided under the Universal Healthcare Law coming from the PCSO and the PAGCOR as well as from the Syntax. Madam Chairperson, if we receive all this support, then PhilHealth will definitely last beyond the year 2027. Madam Chairperson, Honorable Representative Reyes.
All right. Thank you, Madam Chair. Next, I will go through the details of the NEP. There is one portion there that is a line item for special projects, a special purpose insurance coverage. Can you please expound this program?
Attorney Santos.
Madam Chairperson, Madam Chairperson, please give us 1 minute to answer the question, Madam Chairperson. Honorable Representative Reyes, sir, please.
Rep Reyes, do you wish to proceed to your next question?
All right, thank you. Then here's the other one because we wanted this as KPI. Data on the performance information of percentage of indigent patients with no out-of-pocket expenses. Actually, we're looking for the data, or rather, there seems to be no data in the NEP. Why isn't there any data for 2021 on the percentage of indigent patients with no out-of-pocket expenses?
Attorney Santos.
Madam Chairperson, again, for the second time, may we request 1 minute to prepare our answer, Madam Chairperson. Please, Honorable Representative Reyes.
Okay, thank you, Madam Chair. So dalawa na yon.
Rep Reyes, but your time is
Okay,
up.
one last, ma'am. I wish to reiterate with PhilHealth one thing, because we have one of the things that we were discussing back then was the inclusion of both dental and optometry services. Because if I'm not so sure if you know the data, 87% of our population suffers from dental cavities decay. So I think it is already about time that we already include this. But when we were asking this, the initial rollout program was on 2025 pa lang. I think it's about time that we try to expedite this. We've tried to find a sample size wherein we will be able to deploy this so that we could address this issue already of these health concerns. So that's it, Madam Chair. But I do wait. That's my last question, but I'm still waiting for the response.
Yes, Attorney Santos.
Madam Chairperson,
Dental health.
This has already been asked of PhilHealth, and we commit to reconsider the recommendation of our Honorable Representative Reyes concerning the concern of inclusion or developing benefits for our optometrists, for the optometric services and dental services, Madam Chairperson. Probably this may be included in the comprehensive outpatient benefit package of PhilHealth, Madam Chairperson.
And what is the answer on the question on indigent patients out-of-pocket payments?
Madam Chairperson, may we request that Ms. EVPCO Walter Bacaresa be recognized, Madam Chairperson.
COO Away.
Madam Chair, Congressman Reyes, we have actually data on the NBB separated per region and desegregated per hospital. We will be happy to furnish.
Pero hindi ba by law, wala dapat silang babayaran. So by law, dapat zero. So what you're saying is hindi natutupad yan at meron kayong datos.
There are challenges po in the hospitals being able to afford NBB. One of which is some policies in our like the pay whichever is lower policy and other procurement problems in the regions. We propose sana this can be also be part of the scorecard for our local government units for Madam Chair, so that to encourage the LGUs to afford NBB.
Rep Reyes, just
Madam
very
Chair,
brief reply because your time's up.
Yeah, I know. I mean, we've established that we're violating something. That we're not able to follow what is provided by the law. So I don't know how we're supposed to address this moving forward. So you wish this to be institutionalized?
Yes, sir. Madam Chair, under the law, 90% of the government hospitals must be no balance billing.
Yes.
Wala pong babayaran dapat.
Yes.
But we are still encountering challenges to make that happen. And we will provide your office, Madam Chair and Congressman Reyes, with figures for.
Let's begin with that submission, Rep Reyes.
Yeah, Madam Chair,
in
the soonest possible time, please. Thank you very much.
Vice Chair Suarez, for a quick interjection.
Madam Chair, I notice it's an empty promise because working from a local government point of view, hindi naman sinasagot ng PhilHealth lahat So yung sa hindi nasasagot ng PhilHealth, ang nag-shoulder noon, local government unit. At ang problema, pag may pasyenteng lumabas ng ospital na hindi nasunod yung no balance billing, ang bilis kagad mag-act ng PhilHealth na i-discredit kagad yung hospital, tapos hindi na ma-implement yung PhilHealth program sa hospital na yon. So I wanted to go along the tone of Congressman Reyes on this because it really needs a lot of fine tuning. Because the burden is really on the local government unit. Because kung di ako nagkakamali, malaki na yata yung 50 to, laki yata yung 50, 60% talagang sagot na talaga. Tapos meron pa silang policies doon, Madam Chair, na bawal bilhin yung gamot sa labas ng ospital. Dapat within the hospital, dapat binibili yung mga gamot. So pagdating sa mga ganon, ang nahihirapan yung local government unit kasi pagdating sa realidad sa on the ground, pati yung mga pasyente ng pamilya, mas lalong nahihirapan din.
Thank you. Vice Chair Suarez, we take note of those observations. At this point, just a response to the first question, which is on that fund. Very quick reply before we move on to the next.
Madam Chair, sorry if I may. There's one more thing, the special purpose insurance coverage.
Yes, that's the last one, and your time's up.
Thank you.
And I mean it this time.
Madam
Yes,
Chair,
COO Waway.
These are for the Pamana, Bangsamoro, national athletes and coaches, SK officials, financially incapable seniors, and other sectors po, Madam Chair, Congressman Reyes.
All right, salamat. Just take note of the requested information to be submitted to the committee ASAP.
Yeah, today po, today.
Next interpellate is Representative Panaligan.
Good afternoon, Madam Chair. Good afternoon, OIC Secretary Berhere and the senior officials of the DOH. My first question is, what is the policy of the Department of Health on the establishment of new DOH-administered regional hospitals by converting existing provincial hospitals owned by the provincial governments into regional hospitals? I raise this question because I filed a House bill, as has been referred already to the Committee on Health of the House, seeking the conversion of the existing Oriental Mindoro Provincial Hospital into a DOH regional hospital, the Mimaropa Regional Hospital. And I filed this bill because I was told that in the whole country, only 2 regions have no regional hospitals, Mimaropa and Barm. Ang Calapan City po, kung saan nandun yung Oriental Mindoro Provincial Hospital, is a regional government center. At doon dinadala sa provincial hospital na ito ang mga pasyente coming from other provinces of the region like Occidental Mindoro, Romblon and Marinduque, and of course yung mga taga-Oriental Mindoro. So because of that, I saw the need to convert this provincial hospital into a DOH regional hospital. Pangalawa po, kailangan din na ma-upgrade ang hospital na ito. The provincial government wasn't able to invest sa upgrade ng hospital na ito into a tertiary hospital. Siguro because of funding issues. Kaya nangyayari, pag hindi na kaya sa provincial hospital, dinadala pa sa Batangas Regional Hospital or sa Maynila. So kawawa ang pasyente, and considering na ang karamihang gumagamit ng provincial hospital ay mga mahihirap o low income, talaga ito yung malaking pahirap. Kaya nga, I filed this bill and I'm seeking the support of the DOH sa bagay na ito. Kaya gusto ko rin malaman ang inyong stand tungkol sa bagay na ito.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, we will support you po in this, no? And we are aligned. That's the direction that we will have all of our regions to have this regional hospital. So we will support you on that, Honorable Congressman.
Maraming salamat po, Secretary Berhere. Inline din po yun sa sinabi ng ating Pangulo sa kanyang State of the Nation address na kanyang gusto rin ay magkaroon ng mga specialty hospitals sa mga regions. So maraming salamat po, Secretary Berhere. My second question about yung HFEF din po. I was informed or nakita ko din doon mismo sa NEP ng DOH for 2023 na zero ang allocation ng Oriental Mindoro sa 2023 doon sa HFEF. Dalawang distrito po Oriental Mindoro, first district na yung aking distrito at District 2 kay Congressman Umali. So can you confirm na walang allocation ang dalawang distritong ito para sa 2023?
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, we have a corrected version already of this annex. We have for your rural health units, we have allotted for Puerto Galera Rural Health Unit, Socorro Rural Health Unit, and Subaan Rural Health Unit. And also we have allotted for the Camp Regional General Efigenio Navarro for additional 5 million. So meron po kayong allocation for Oriental Mindoro, sir.
Kaya Madam Secretary, kung magkano yung allocation sa binanggit ninyo, Puerto Galera, Socorro, and yung sa Camp Navarro, which is a police camp, ano? So para sa mga pulis yun, hindi sa general population.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, a total of 17 million was allotted to Oriental Mindoro First District, 12 million for the rural health units, and additional 5 million for the Camp Navarro facility.
And also, Madam Secretary, meron pa rin mga unfinished DHS, yung construction. I hope that mapapondohan din, sana, yung completion for 2023 of the unfinished health centers and BHS.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, we will have our regional director go to these unfinished barangay health stations to assess so that we can discuss it and we can further manage, Honorable Congressman.
Yes, thank you very much, Secretary Vergere. That's all, Madam
Salamat, Rep. Panaligan. Next to interpellate is the Deputy Majority Leader, Lawrence Defensor.
Thank you, Chair. Good afternoon, Secretary. Can you give us an update on the status of your vaccination policy, if there is one already, on minors below 5 years old?
Yes, Madam Vice Chairperson and Honorable Congressman, as up until now, we still do not have any recommendations coming from our experts for the COVID-19 vaccination of less than 5 years old among the population.
Yes, Secretary. I ask that because we are using Pfizer and Moderna vaccines here in the Philippines, made in the United States, where their FDA and CDC have a policy, a vaccination policy of 6 months and above. I hope that we could expedite our own policy because preschools have opened. We have a relaxed mask policy. I do not want to see that our vaccines have expired. 20 million have expired at the amount of approximately 13 billion. If the makers of the vaccines that we use here are already vaccinating children 6 months and above, there is no reason for us to delay any further. We all have children. I have children. And they also need protection since the economy is now more open, especially our health protocols have relaxed. More importantly, are you aware of, or do you have any data on infected children here in the Philippines below 5 years old?
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congressman, may I refer you to the head of our Epidemiology Bureau, Director Thea de Guzman.
Director de Guzman, you are recognized.
Thank you, Madam Chair. Madam Secretary, if I may have just 1 minute to look for the data for the disaggregation per age group.
Yes, can you just submit the data to me if you have one? I would just like to reiterate, Madam Secretary, why I'm asking us to expedite our own policy. Because as of July 24, 2022, the World Health Organization has stated that at least 2.47 of infections are on children below 5 years old. Napakalaki pong numero niyan if you look at the numbers globally. In the US alone, 14 million because of the Omicron variant. Let's have that sense of urgency to expedite our policy for minors 5 million and below so we can have a better utilization rate of our vaccines, especially Pfizer and Moderna, where the United States is already using it. I hope you will consider my recommendation, Secretary.
Secretary.
Yes, we take note of that, Honorable Congressman, Madam Vice Chairperson. Actually, the health technology assessment is already ongoing, and we already have FDA applications ongoing for the 0 to 4 years old vaccines for COVID-19. We will be submitting data, sir, Madam Vice Chairperson, kung pwede lang po, last note lang from our surveillance unit.
Director De Guzman.
Thank you po, Madam Chair and Madam Secretary. Yes, Mr. Congressman, we'd like to confirm that among all of our cases, so we have 93,054 cases which were infected, which are aged under 5. And this comprises around 2.39% of all of our cases. What we have observed, Madam Chair, is that even with increases, the contribution of this age group is relatively the same. So, for example, in this recent spike of cases, it contributed around 5,800, and that's around 2.9% of all of the cases contributed.
Thank you for that. Thank you, DOH Secretary and the DOH family. Let's expedite our policy on vaccination for 5 and below. Thank you, Madam Chair.
Salamat, Rep. Defensor. Madam Secretary, can you confirm the information 20 million had expired? 20 million units? What is the exact figure of expired vaccines?
Yes, Madam Vice Chairperson, as we have reported, there were around, the initial report was at 20 million doses. Now we are doing re-inventories. Meron po sa National Warehouse na 12 million doses. So yung pong ibang mga additional 8 would be coming from the regional warehouse.
No. The expired ones are 20 million.
Meron na po. Yes.
Madam Chair, the expired vaccines, can I be recognized, Madam Chair?
Yes, please.
It's 20,660,354 COVID-19 vaccines as of August 12.
And the 12 million that you were referring, Madam Secretary, what does that refer to?
Meron ho kasing classifications. No? So we have the national warehouse, we have the regional warehouses. If it was bought by national government, if it was donated, if it was LGU procured, it was private procured. So among all of these which have expired, it's about 20 million plus doses. And I confirm yung sinasabi ni Honorable Congressman, 12.1 million of this would be in our national warehouse, and the rest of this 20 million would be in our regional warehouses. Among all of those that have expired, a big part of that would be coming from the LGU and the private sector procurement.
And what is the peso value of the 20 million expired?
As to the peso value, Madam Vice Chairperson, we do not have the figures kasi yung actual na number or amount is under NDA pa po.
Could you kindly just make an estimation? I will ask you again later on.
We will submit it to your office, Madam Vice Chairperson.
No, I will ask you in a bit.
Okay. Yes, we will do that, Madam.
Thank you. Thank you, Rep. Defensor. Next to interpellate is Deputy Speaker Democrito Mendoza. Deputy Speaker Mendoza. Right. Next is Vice Chair Mitzi Kahayon Uy via Zoom.
No, Madam Chair. Good afternoon, Madam Chair, to our Chairman, Chair Saldi, and to the rest of our colleagues here. Good afternoon, DOH family. My concern is on the other programs that you have earlier, you have presented and you focuses on the MAIP, HFEP, HRH, and UHC, but barely mention about public health programs like immunization, dengue, rabies, TB, HIV, and lifestyle diseases like hypertension and diabetes, which also needs budget allocation. These are all equally important programs that I've noticed medyo few or not receiving attention, especially now that there is a rise in the number of dengue cases. Shouldn't there be more realistic budget allocation for dengue and infectious diseases? And also, may I know the data of the dengue cases of NCR compared to other regions, Madam Chair?
Madam Secretary.
Yes, Madam Vice Chairperson, if we may recognize Yusek Beverly Ho to answer the questions.
Yusek Bev.
Thank you, Chair and Ma'am. First, for your question on diabetes and hypertension, this is part of our devolution transition plan. And in fact, the medicines for hypertension and diabetes are actually the first part of the first wave of commodities that are part of the DTP. So in fact, this year, we have ceased to procure them, a lot of them. No, so except for insulin, which the DOH will continue to procure just because it's actually very difficult for our local our LGUs and local hospitals to procure them. So our work on non-communicable diseases have actually shifted more to health promotion, also promoting active transport, better diets, etc. As to your question on dengue, we have to date sub-allotted around 35 million pesos to our regional offices in order to support our LGUs on dengue response. At the national level, our policies have not changed because clearly we still follow the 4S strategy. And then also for dengue, we have around 300,000 RDT kits that already have been distributed to our LGUs, particularly those that have outbreaks that are ongoing.
Madam Chair, thank you for that response. But however, Madam Chair, if I may request the DOH family to please provide us this representation of the data that I'm requesting right now for the comparative of dengue cases in NCR and the rest of the region of the country. However, with that allocation, as you have mentioned on the hypertension, if I may ask, you are did I hear it right? You are placing it on the LGUs, distributing it to the LGUs, because the reason why, Madam Chair, this representation is asking such question because there are lots of barangay health centers that is at the end of the year running out of this supply. So may we ask as well for the data or the process that you have been doing in allocating the said budget for that, Madam Chair. If I may go to my next question, how about your plans of sustaining current health initiatives on the priority diseases like TB, HIV, or AIDS, which are currently funded by international agencies such as USAID and Global Fund once this funding ceases? Madam Chair.
Madam Secretary.
Yes, Madam Vice Chairperson, it's not just the development partners or international organizations that are subsidizing or providing funds for these priority diseases in the country. Actually, most of our budgets for infectious or communicable diseases are focused, a large part are focused on TB, HIV, and the other infectious diseases. So, hindi lamang po doon. So, we also are looking at being more independent from our international partners on this. So mostly po ito, pag humingi tayo ng tulong sa kanila, mostly would be drugs that cannot be easily procured in our country at sila po makaka-access globally.
If I may request, Madam Chair, to the DOH family again, for the allocation that you are placing, if our country is placing an amount on this, may I know? And also the programs that you are initiated by our country, not just depending on the budget of the foreign aid, Madam Chair.
Yes, ma'am, we will be submitting to your office this list on how government has allocated funds for this and what would be the share of international partners.
Yes, please. Yes, please. So being the head of the Council for the Welfare of Children, this is one of our program before when I was there, focusing and looking for funds through UNICEF on the programs that we could give to the victims of this HIV LG. But if I may have my last question, Madam Chair,
Proceed.
we can maybe ask the DOH on its plan of action regarding the devolution of the health services to the LGUs, as we have known that it is only DOH ang settled pa lang on the transition for the Mandanas ruling, and their view on the role of malasakit centers in bridging this concern, Madam Chair.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congresswoman, our devolution transition plan would include commodities that are part of the routinary programs of the department. So for example, it starts 2022 wherein we have included the basic commodities like anti-hypertension, anti-diabetes, and the other drugs. As to the malasakit centers, these are inpatient services that are being accessed by our indigent members of the community, wherein they are financially covered by our malasakit program. So for us to be able to link both of these programs, this outpatient for the devolution plan or transition plan plus the malasakit centers, we'll need to further discuss this. But what we are thinking would be there should be this PhilHealth coverage po kasi para sa outpatient. So we use PhilHealth coverage for our outpatient and then the malasakit program or the medical assistance for our inpatient so that we have rational subsidies for our clients who are indigents.
So again, Madam Chair, if I may request from the DOH family to give me a clear picture on how and where the malasakit will come in on the kasi this representation, Madam Chair, is thinking of localizing the malasakit center because with the fundings that through the Mandanas ruling, might kumbaga is this sufficient enough for to fund the malasakit referrals? So yun po, inihingi ko lang po, Madam Chair, sa DOH kung kaya pa ba ng DOH na i-sustain yung mga inihingi natin for the malasakit center referees, Madam Chair.
Madam Secretary.
Yes, Madam Vice Chairperson and Honorable Congresswoman, we will be submitting to the office of Honorable Congresswoman and to you, Madam Vice Chairperson. We'll try to map out all of these subsidies and other sources of funds so that we can be able to match based on the needs. Like for example, we did devolution transition, there is Mandanas ruling, tapos ito po yung pumapasok yung mga iba't ibang sources of funds natin so that we can appropriately try to see how rational we are doing dito po sa ginagawa natin. So we will submit, Madam.
Opo. Madam Chair, quick na lang po. We need kasi po to know talaga on what already had been devolved dito po sa DOH through the Mandanas ruling. So if you could give me the big, yung picture as you have suggested, Madam, if Madam Chair, kung paano nyo po nilatag na yung pagdidetalye on yun dito sa naging Mandanas ruling po na to. Kasi kayo pa lang po ang alam kong ahensya na unang inasikaso para dito sa transition po. So kayo pa lang po yung inaasahan namin na may malinaw na pagkaka-distribute po ng ating nakuha natin from the Mandanas ruling. Thank you so much, Madam Chair. And this representation is requesting for the regional director to have one-on-one kahit papano po briefing on further questions, Madam Chair. Thank you so much.
Thank you, Rep. Uy. Madam Secretary, kindly take note of all the requests by Rep. Kahayon Uy. And at the same time, yung regional director po, pwede pong papuntahin bukas dito sa 4th floor. Salamat po. At this point, I yield the chair to Rep. Janet Garin.
Thank you very much, Co-Chair. Next to interpolate from the majority is the Honorable Mark Go.
Yeah. Thank you. Thank you very much, Madam Chair. Magandang hapon po sa ating mga kasama sa Department of Health. Tatlo po yung tanong ko. Unang-una po rito tungkol sa
PhilHealth. The budget of PhilHealth this year is 80 billion pesos. And next year, the increase is 100 billion. I would like to find out what brought the increase in the PhilHealth, Madam Chair and Madam Secretary.
PhilHealth, please respond.
Madam Chairperson, Honorable Representative Go, our data shows that the increase in the request for budget covers the PWDs that are unemployed, amounting to 143,422 members at an annual premium of 2,400 pesos. We also requested funding for the financially incapable members, as well as for the senior citizens and the NHTS. Madam Chairperson, Honorable Representative Margo, thank you very much.
Madam Chair, in other words, you're saying that there is an increase in the number of PhilHealth members in 2023. Is that correct, Madam Chair?
PhilHealth, please respond.
Madam Chairperson, Honorable Representative Margo, we requested through the GAA 21 billion through as part of the support from the PCSO and PAGCOR. That is part of the increase of the budget of PhilHealth. Madam Chairperson, Honorable Representative Margo.
So if you will calculate this, how many government or how many individuals will now be covered in 2023 as compared to 2022 in your forecast for 2023?
Hello, sir.
Madam Chairperson, Honorable Representative Margo, the increase in the benefit package improvement that will be covered by the support from the PCSO and PAGCOR involves improvement of the benefit packages of PhilHealth. This does not specifically cover individuals. It covers the increase in the improvement, enhancement of benefit packages provided under PhilHealth. Thank you very much, Madam Chairperson.
Attorney Santos, ang tinatanong lang po ni Repgo is ilan yung dagdag na beneficiaries. Tama po?
Tama po
From
yun.
2022 to 2023. Hindi po yung benefit enhancement. Ang tinatanong po bilang ng tao na naidagdag bilang membro ng PhilHealth.
Additional families, Your Honor.
Madam Chairperson, Honorable Margo, we have here the number, but as to the particulars, whether or not there was increase or decrease, may we be given 1 minute to submit the data. Madam Chairperson, Honorable Representative Margo.
Just tell us how many now are currently enrolled sa PhilHealth and paid by the government, Madam Chair.
Yeah, PhilHealth, please respond. It's a very basic question as ilan yung enrolled last year, ilan yung enrolled this year, ilan yung i-enroll next year. That's very basic. And may we request PhilHealth to please shorten your answers in the interest of time.
Madam Chairperson, Honorable Representative Margo, for this year, we have a total of 21 million members as approved by the DBM. This will be supported by the subsidy of the national government.
Yung pong current na naka-enroll ngayon, never mind the DBM, ang inano na, Madam
the indulgence of the Honorable Mark Go. PhilHealth, napaka
Apologize, but we need to gather the data to answer that question, Madam
My God.
Chairperson.
Madam Chair, may I request for 1 minute suspension? Can I-
Yes, you have the data that you submitted to us.
Madam Chair, I think we will just ask them to submit probably this afternoon or tomorrow how many people are now covered by PhilHealth, paid by the government last year, this year, and the forecast for 2023, Madam Chair. Okay, let me go to the other question which is related to my first question is, how many have availed of the benefits under PhilHealth, considering the number that you have right now enrolled and in the previous year as well as the forecast for 2023. So kasama na rito when you submit the report, Madam Chair, the total availment in terms of peso value by all these people who are registered or are covered by PhilHealth, Madam Chair. Okay, can we get the answer from our friend from the PhilHealth?
Madam Chairperson, Honorable Representative Marco, we will comply with the directive to submit the report immediately. Madam Chairperson, Honorable Representative Marco, thank you very much.
Okay, I'll go to the next question. This is about devolution, and I would like to ask Madam Secretary Berhere, to what extent have you devolved the functions and responsibilities of DOH to the different LGUs? Madam Secretary, Madam Chair.
Madam Vice Chairperson and Congresswoman Garin, gandang hapon po, Congo. Meron po kaming devolution plan na ginawa which starts on 2022 and which will end on 2025. Meron po kaming iba't ibang programa na sinama. Part of that would be the public health program commodities. Yun ho sa public health program commodities, inuna po natin yung mga basic or essential medicines that local governments can procure for their citizens. Katulad po ng mga anti-hypertensive, katulad po ng mga diabetes na drugs, nakauna na po talaga yon. And may iwan po sa national government yung mga priority programs at kailangan bilhin because of economies of scale, katulad ng TB drugs, ng bakuna po para sa mga bata at sa matatanda. And then we also have our health facilities enhancement program. Kasama po siya doon sa devolution plan natin. That's why we had been explaining yung allocation framework. Kung saan inuuna po natin ngayon yung mga low capacity na areas, sila po yung priority natin so that we can capacitate them further. Ang next po, yun din pong ating human resources for health na deployment is part of our devolution. So out of all of these programs and priorities that we have included, ang basic objective po, unahin po namin tulungan yung may low capacity na areas since we know that there are additional funds for our local governments and the high capacity areas can be able to cope. Ito pong even kaunti lang yung assistance. So we'd like to augment sa priorities natin yung mga low capacity muna in this devolution transition plan po, Congressman.
Thank you po, Madam Secretary, Madam Chair. If you will cost this devolved function or program for 2023, ito po ba'y comprehended sa budget niyo? Because this will be savings that will be generated by the DOH, but it will be an added cost to the local government. Meron po ba kayong estimate nito kung magkano ang estimated cost saved by the Department of Health, which will be an added cost to the LGUs, Madam Secretary, Madam Chair?
Yes, Madam Chair at saka Honorable Congressman Go, may we request that we submit to you the estimates, but we agree with you that that is the objective and the principle that the national government would start the devolution of these commodities to local governments, the procurement of such, and in the same manner, mapi-free up yung funds na gagamitin namin will be used for those low capacity areas. So we will submit to your office, Congressman Go, ito pong ating mga estimates tsaka paano po natin ginawa yung matching.
Okay, ma'am. Thank you. Thank you very much. So we'll expect the data that you will send us with regards to this, ma'am. The other question is a parochial question that I would like to ask. May I know, Madam Secretary, the specific budget allocation for the health facilities enhancement program for the city of Baguio? This is my district, ma'am, and I would like to get inputs from you if there is an allocated budget for the health facilities enhancement program for our district, Baguio City. Thank you, Madam Chair, Madam Secretary.
Yes, Madam Vice Chair, and also Honorable Congressman Go, may I refer the question to Director Nene Gorgolon so that she can provide the response.
Thank you, Madam Chair, Honorable Go. Actually, for 2023, we have a proposed budget, which is part of the NEP for Baguio Gen Hospital, a total of 125 million for infrastructure and 100 million for equipment po. You don't have Super Health Center because we have already funded this for this year. So more on the Baguio General Hospital po, yung appropriation for Baguio City po. Salamat po.
Actually, we have a submission earlier for 4 barangays for their health facility, but I don't know if this was included in the budget of the Department of Health for 2023. But you are saying now that there is none right now except for Baguio General Hospital. Yung pong additional budget ninyo for Baguio General Hospital, is this part of the increase of the bed capacity from 500 to 800, or this is now an additional budget for the increase of the capacity from 800 to 1,500, which was already passed into law last Congress, Madam Chair?
There are 2 budgets for Baguio General Hospital, the completion of the multi-specialty center, and the other one is the existing completion of the regular HFEP that can be responding to the increase in bed capacity po. So dalawa po yung ongoing project ngayon, dalawang building, multi-specialty center, which is charged to Mayowa, and then the regular infrastructure, which can be part of the increased bed capacity po.
Okay, sige. Thank you. Thank you very much. Ma'am, Madam Chair, I'm okay now. I completed already my interpellation. Thank you.
Thank you, sir.
Sino yung next? Teka. Sorry. Yeah. The next,
Chairperson.
skip nakalagay, skip.
Nasa ano ma'am, naka-speaker. Tawagin mo.
The next interpellate is the Honorable Jefferson Konghun. Next interpellate is Deputy Speaker Isidro Ungab. Next interpellate is the Honorable Zia Alonto Adjong. Nasa ano rin siya. Yeah. Then from the majority, we have the Honorable Wowo Fortes.
Thank you, Madam Chair.
Hi.
Hello, good afternoon. Good afternoon to everyone. Madam Secretary, good afternoon, and to all the other DOH personnel. My question is relative Executive Order 138. There was a previous mention in the interpellations of the Devolution Transition Plan. EO 138, to be specific, refers to devolved functions mentioned under the Local Government Code, more particularly under Section 17, Paragraph 2, Subparagraph 3. Under the health services, it stated that health services such as programs, projects on primary health care, maternal and child care, communicable and non-communicable diseases and control services, access to secondary and tertiary health services, and purchase of medicines, medical supplies, and equipments. These are specifically the functions defined under Section 17 by the Local Government Code that are supposedly to be devolved to the LGUs. Previously, there was made mention of infrastructure, which you incorporated in your devolution transition plan, which I understand in 2024 will be fully transferred to LGUs. Of these health services I mentioned that you can find in Section 17, what other kind of services will you be devolving eventually?
DOH, please respond.
Yes, Madam Vice Chairperson. Yes, magandang hapon po, Congressman Cortez. Aside from the health facilities, we are going to eventually devolve the procurement of various commodities. If you remember in the Universal Healthcare Law, meron po tayong distinction between individual-based services and population-based services. Within this specific law for universal healthcare, individual-based services will be covered by the Philippine Health Insurance Corporation, and the population-based services to be covered or subsidized by the national government. So we intend to map out and identify those that are going to be population-based to be retained within the mandate of the national government through DOH, and those that are individually provided can be covered already by PhilHealth, and the local governments can provide to their constituents. Aside from that, we also included our surveillance units. The surveillance officers and the functionality of this will also be devolved. Ngayon po kasi, it's more on the national. We're very heavy on the national for our surveillance units. We need to have these units hanggang sa baba. So we're going to capacitate them until we can fully devolve this kind of service to our ground units. Pangatlo po, meron ho tayong deployment ng health human resources. And this also would be eventually devolved to our local governments, Congressman Cortez.
Okay, thank you, Madam Secretary. But as a follow-up question, are this devolution transition plan in line with EO 138, or is it also just a policy direction of the DOH?
Yes, Madam Vice Chairperson and Honorable Cortez, Congressman Cortez, this is aligned with the executive order as well as the policy direction.
Yes, that in the absence of EO 138, you won't be doing this.
Yes, but eventually because of universal healthcare also and the distinction between...
So meaning it's not only under EO 138, but also because of the universal healthcare law?
Yes, Honorable Congressman.
Okay. Let me go to another point. In the NEP, one item is a funding for the operations of blood centers and a national voluntary blood service program. Madam Secretary, Madam Chair, I understand that this line item consists of two things. One are blood centers, and the other is blood services program. So there is a center and there is a program under this one item budget consisting of 669 million to cover PS and MOOE. Wala silang capital outlay. Now, my question is, do you suggest that we should separate the centers from the program, which currently are joined under the DOH?
Yes, Madam Vice Chairperson and Honorable Congressman Cortez. Una-una po, yes, the program does policies, does research, tries to assess the implementation of the different policies being implemented by the centers for blood. So ito pong Philippine Blood Center natin has different regional blood centers counterpart. And we agree with you that there should be a separate line item for these blood centers, no, as compared to this program. Yung program po kasi, siya po yung policy development part, and we have the blood centers or operational units for our blood program.
Okay, thank you for that information, Madam Chair, Madam Secretary. I actually have a proposed bill for the establishment of a Philippine Blood Center, which currently is House Bill 3457, separating the program from the centers, but that's another story. My point now is, in the line budget, there is a conglomeration of funding for the program and the center. In line with my proposal to have a different center, would it be possible that at this point in time for 2023 budget, because I do not, I anticipate that the incubation period of a proposed bill would take some time. Would it be possible that for this 2023 budget, we now segregate the budget for the center and that of the program, so that I can make it a basis for my proposal that we establish its own center, so that in the crafting of the bill, I may be guided accordingly into the funding based on your suggestion on the separation of the funding for the program and the center, if it's only feasible to do that at this point in time.
Yeah, that's the last question, Your Honor.
That would be fine.
Yeah,
Yes.
Thank you very much. DOH, please
I
respond.
would just ask for the reply on my query now.
Yes, so DOH, please respond.
Yes, Madam Chair and Honorable Congressman Cortez. Yes, we will be defining Honorable Congressman, and we agree with you, and we will be working towards our disaggregation or the differentiation between the program and our regional blood centers.
Thank you for that very candid reply, Madam Secretary, and I wish you luck for the next year. Thank you very much. Madam Chair, thank you very much.
Thank you very much, sir. Next is from the minority, the Honorable Felimon Espares.
Thank you very much, Madam Chair, and good afternoon sa atin lahat, and would like to convey our gratitude for the warm welcome of our Secretary and the staff during my visit. Madam Chair, I would like to have a clarificatory question or information on our NEP, page 263, on the item professional fees. No? Because I have noticed here that the actual for 2021 is just 9 billion, and now for 2023 was increased to 23 billion. So I think around 130+% increase. So may I know, Madam Chair, what this is all about? Bakit ganito yung pag-increase, no? And then it's really necessary.
Madam Chair, if we may ask 1 minute lang po, titingnan lang ho namin yung page 263 just for us to give an accurate response.
Yeah, 1 minute suspension.
On page 263. Chair, thank you.
Yes, thank you, Paul.
Madam Chair.
Deliberation of the proposed budget is resumed. The DOH is requested to please respond.
Yes, ma'am, if we can recognize Director Weng Laura to provide response to the question.
Director Weng is recognized.
Good afternoon, Madam Chair, Mr. Yeah,
Please
Congressman.
proceed.
Yes, ma'am. We have to validate with DBM, but we believe that this is for the payment of job order and contractuals, professional services, and other services. Object code were being used to pay for the salaries of contractuals and other job order personnel. Thank you po.
Madam Chair.
Please proceed, Kong.
Yeah. I don't think so, no, because kung contractual nasa professional fees siya na full, no. May mga general services tayo, then other, I think may mga other items din, no. But then would like to know talaga, no, ano ba to at sino yung ka-engage. So if they are not ready to this, Madam Chair, can we request the list or sino-sino yung i-appropriahan natin ng 23 billion for the 2023 NEP natin?
Madam Chair.
Please proceed.
Yes, Madam Chair and Honorable Congressman, if we may submit to your office this requested briefer or explanation on this 23 billion amount.
No problem, Madam Chair, because I usually support the budget, but then of course, we need really to know, ano ba to? Baka hindi naman siya importante. We might be looking into other items which really could be of best program for our department. Thank you, Madam Chair, that's all.
Let's now proceed to the next interpellator, the Honorable Christopherson Yap.
Thank you, Madam Chair. DOH family, fellow colleagues, may buntag, may udto na tanan. It was mentioned earlier by Congresswoman Jam Maronda, the lady from Iloilo, pertaining the population to bed capacity ratio. And Region 8, my region, was mentioned, was not reached the bed capacity. This representation would like to ask if there is an allocation to provide additional beds to fill up the lack of facility. Our province, especially my district, was hit by Typhoon Odette and twice landed in our area. Marami pong natulong po yung DOH, but we need more medicines, kung medical caravan, kung meron, and other equipment for our hospital. In line with the priority programs of our President, BBM, na mababa ang mga specialty hospital to the region and mababa rin po sa mga probinsya ang quality of health services. Kung may near expiry po tayo ng mga medicine, pwede po ba natin mabigay sa mga nasalanta ng Super Typhoon Odette, especially in my district in Southern Leyte? Thank you po.
Will the DOH please comment?
Yes, Madam Chair and Honorable Congressman, we'll ask our Regional Director to coordinate with your office, Honorable Congressman, and whatever assistance that our resources will allow, we will be providing assistance, Honorable Congressman.
Thank you very much. We now proceed to the next interpellator, our Deputy Majority Leader, the Honorable J.J. Suarez.
Thank you very much, Ate Janet. Very quickly lang, page on your, I don't know what page this is, but number 9, health promotion. I just noticed a huge increase from the 2022 GAA to the 2023 NEP. 529 million in 2022, then all of a sudden 2.14 billion in 2023. Can you please explain to me why the increase?
Yes, Madam Chair. Magandang hapon po, Congressman Suarez. Dito pong 2.14 billion increase is aligned with the universal healthcare provision, wherein we need to be able to allot at least 1% of the DOH budget to health promotion. This health promotion is not just the regular communication and information that we provide.
Ma'am, sandali lang Can we request some silence while we're conducting the hearing? Thank you. Yes.
Thank you, Honorable Congressman. So as I've said, ito po would be our health promotion would be for us to be covering both communicable and non-communicable diseases. For us to be able to empower and capacitate our local governments, we will be providing funds. So alam po natin that 100% in a whole pie, 20% lang po yung for direct care services na makakapag-manage ng PhilHealth. 80% will be socio-economic determinants of health. So ito po yung main objective kung bakit tumaas ng ganito yung health promotion. So we'll do participatory action research, health impact assessment, and the other things. So basically, we will be providing grants to local governments so that they can do their health promotion initiatives on the ground.
Siguro magandang tingnan natin yung aspeto na to, Madam Chair. Kasi una-una, lumaki na yung pondo ng local government units because of the Mandanas ruling, and then we'll still be providing them grants. It's counterproductive. Why are we increasing their funds when they're already receiving a lot of funds? So maybe we can harmonize this policy, Madam Chair, so that we can put a little bit of rhyme and reason to the utilization of funds. Maybe there are other programs and projects that we can focus on na mas makakatulong sa pangkalahatang pangkalusugan ng ating mamamayan. Pangalawa, Madam Chair, gusto ko lang malaman kung anong position ng DOH doon sa first 1,000 days of life.
Yes, Madam Chair.
Please proceed.
Opo, sorry. Yes, Congressman Suarez, we are very much supportive with the first 100 days. Actually, kasama po kami. Opo, first 1,000 days. Kasama po kaming nakapagbuo nung bill na yon, yung batas ngayon. So this is also aligned to what we are doing right now, integrating our policies according to life stages. So yes, sir, very supportive po.
Kasi nakakabahala po yung latest na data na inilabas ng United Nations Development Program na tumaas na naman yung level ng stunting, tumaas na naman ang level ng hunger, tumaas na naman ang level ng mga Pilipinong walang access sa potable water system. If the last 2 years has already lost us a generation of Filipinos that will be competitive once they become old enough to enter the workforce, if we don't address this issue now, we'll be losing another generation of Filipinos again. So I think what we need is not just support. What we need is clear action from the Department of Health para lang matutukan talaga yung programa kasi kinabukasan ng mamamayan ang pinag-uusapan natin dito.
Madam Chair.
DOH, please proceed.
Yes, Honorable Congressman, we currently have this project, the Philippine Multi-Sectoral Nutrition Project, which is a project in collaboration with the World Bank, wherein this is going to be a project with the Department of Social Welfare and Development. This is a 9 billion project kung saan po we will be helping our priority local governments to alleviate the issues and the challenges regarding the nutrition status of their children in the area. So aside from that, meron din ho tayong work with UNICEF and UNDP regarding the sanitation and environment kung saan nakita po natin that a lot of these factors affects the health of our children. Ngayon po, we have 70 million families without toilets. So isa po yan sa priority programs na pinagtatrabaho natin with UNICEF.
Ma'am, sana hindi mapadagdag sa 5 minutes ko. With the permission of our OIC Secretary, hingi na lang ako ng appointment sa inyo because during the time when I was governor, I implemented the program and I implemented the program for 5 years. And after 5 years of successfully implementing the program, we noticed that we decreased stunting. We noticed that we improved the nutritional level of the kids. We also noticed that the kids under the program improved in the 7 tests to determine early child development, which was given by the DSWD. So i-share ko na lang po yung input sa DOH para masama. Last point, Madam Chair, wala pa naman yung bell. Regarding sa programa ng DOH, parochial issue, in Quezon Province, DOH is currently putting up the Lucena City General Hospital. Thank you for the funding. However, for 2023, I did not see any allocation for this project. So how are we to make sure that may continuity ang mga ginagawa natin kung inumpisahan natin ang proyekto kasi sa susunod na taon wala naman palang proyektong ito. Wala naman palang pondo ito.
Yes, Madam
I
Chair.
believe the Honorable J.G. Suarez will be meeting the Honorable Secretary Verhedi to discuss this matter further. Can we now?
Actually, I'll be waiting. If that is what pleases the Secretary, then I can wait till we do sit down. But given that it seems to be a common issue among all those that have spoken earlier, what the congressmen are looking for, Madam Chair, is continuity in programs. Kasi inumpisahan ang laki ng pondo, parang 200 million yata ang inilaan ng Department of Health para sa 2022. Kaso nung tinignan namin yung 2023, wala. So ano po ang gagawin natin sa hospital na to? Iiwan lang po ba natin itong nakatenga? Iiwan lang po ba natin itong white elephant? Dahil po ba nagbago ng administrasyon, hindi na natin itutuloy ang proyekto? Kasi kung pakikinggan po natin ang statements ng ating bagong presidente, President Bongbong Marcos, indeed, he wants to emphasize in improving the health services and he wants to bring it down to the regions and to the provinces. And, this policy of not continuing projects that have already started is incongruent with what the administration wants and what the administration hopes for. So can I just get a reply from the DOH?
Madam Chair. Madam Chair.
Please respond. And I believe the context of the Honorable J.G. Suarez being a former governor is that he can contribute to giving inputs as to the practicability and the impact of the program. With that, I believe the request is for DOH to sit down with the Honorable J.J. Suarez, aside from their current response, so that he can give inputs to this program.
Yeah, yes, Madam Chair and Honorable Congressman Suarez, we will try to again assess, kasi may previous allocation dun sa 200 million. But nevertheless, we will see po kung paano natin ma-manage para there's continuity of this project.
Sec, I hope you do understand my concern. What we're looking for are, clear answers that are seen on documents with numbers that correspond to the projects. Because if we're gonna reply now, we will see, we will look, we will assess. Wala po yatang katiyakan yon. So sana ma-address natin to. Of course, before we hit the budget in the plenary level, just so that we can avoid any untoward incident, especially with programs and projects that are not for us, but rather for the people that have elected us in position.
Madam Chair.
Yeah. Can we?
30 seconds back.
Can I just respond one more time? Yes, Honorable Congressman, we had a previous allocation of 200 million and according to our report, nasa pre-bid pa lang po. Kaya titignan po namin ngayon yung status so that we will know how much we still need to provide or provide as additional based on the status of procurement po for the previous 200 million.
Okay, thank you very much, Sec. Remind ko na lang, hingi na lang ako ng appointment with your executive assistant para we can discuss what we did in Quezon Province for the first 1,000 days. Maybe I can, contribute a little to what the DOH is already doing. It's something very close to my heart. And then also yung mga health facilities lang namin sa probinsya. Alam kong higit na makakatulong kayo para may pagpatuloy at matapos po ito. Maraming salamat.
Thank you very much, Kong. May we now proceed to the next interpellator from the Honorable Ed Durama from Cebu City.
Maayong hapon, Madam Chair. Maayong hapon sa DOH family. I just would like to ask what the criteria is in constructing the super health centers.
Madam Chair, may we recognize Director Nene Gorgolon to respond to the query. Director Nene.
Yes, Madam Chair, and good afternoon, Honorable Rama. Yeah, the criteria for the identification and construction of super health center is number one, it should not be redundant to an existing rural health unit. So it should not be within one area. Second is the identified super health center proposed should have a ready site. And third is the identified super health center proposed should have manpower to operate once it is completed po. Thank you very much. And then we are asking if we can have at least 500 to 1,000 square meters for the super health center so that we can build it in according to the requirement, because this is a ready facility in terms of primary care facility under UHC po. Salamat po.
1,000, Madam Chair. Did I hear it correctly? 1,000 square meters?
500 to 1,000 square meters, because the medium, we have a small size super health center, we have a medium size super health center, we have a large size super health center. For the large size super health center, it's almost 500 square meters. But we request for an allowance for an additional building which will house eventually later hemodialysis and parking. That's why we request at least 500 to 1,000 square meters po. Salamat po.
So hopefully we could allocate more for the city of Cebu, since we have a population of more than 1 million. In my district, we have a population of close to 600, 700,000. And the super health center that was allocated was only one, I believe, as compared to the neighboring cities in Cebu, wherein I see 2 and 3 super health centers. Hopefully we can allocate more to decongest the national hospitals in our city, Madam Chair. That's possible.
Yes, sir, we will plan for that. But given that Cebu is under category 4, meaning Cebu is with high capacity, so we have to look into that. But we will consider, sir. Thank you very much. We will collaborate with the regional office.
Thank you very much, Madam Chair.
From the minority, may we call on the Honorable Wilbert Lee.
Good afternoon, Madam Chair. Good afternoon, Secretary. I only have one question, so since most of my questions have already been answered. This is addressed to the USEC, no? Meron bang, kasi napansin ko lang, bakit hanggang ngayon, OIC pa rin yung sa DOH? Meron bang parang balakid para ma-appoint na talaga as isang permanent secretary, no? Because I've seen the passion and the competency of the good USEC OIC. Bakit ba meron bang balakid? Bakit hindi pa na permanent? And also, maraming agencies na puro OIC, no, including yung PhilHealth, OIC pa rin hanggang ngayon, no? Is this because OIC pa rin yung sa DOH, kaya yung ibang agency OIC pa rin?
With due courtesy to our honorable colleague, I believe it would be self-serving if the Honorable Verheri will answer that.
Maybe someone can answer.
Yeah, just to align, Your Honors, because they came from the DOH family. Yusek Verheri, OIC Secretary Verheri, is actually a career DOH official. Simply said, she will still be there for the next 3 presidents if she will not be appointed as secretary. If appointed as secretary, she will be there for 6 years. But of course, we leave it to that's a matter, that's the discretion of the president, and maybe we can move forward to questions relating to the proposed budget of the Department of Health and its attached agencies.
With all due respect, Madam Chair, the reason why I'm asking this is because I'm concerned if this having an OIC, no, with all due respect to USEC Verheri, because I know she's very competent. I'm just asking because I'm afraid that this might affect the delivery, especially now that we're still in this pandemic. Not having a permanent secretary would affect, no. But nevertheless, I submit, Madam Chair, to your wisdom. Thank you, Madam Chair.
Yeah. Honorable Budgetary, being an OIC vis-a-vis being an acting secretary, will your capability to manage public health and the attached agencies affect?
No, Madam Vice Chairperson and Honorable Congressman, whatever position I may have, 100% naman po ang ibinibigay, and it doesn't affect our services and the delivery of and the decision making kasi halos pareho lang naman, sir. So wala po tayong disruption.
And you have the full powers to implement all programs, am I right?
Yes, I was given by the Office of the President the discretion and the full powers to provide directions and to implement programs for the department.
So that answered my question, but it seems it's different from PhilHealth, Madam Chair, because I have had some complaints, or not really complaints, because there are some hospitals, especially now that it is pandemic, that has been asking me to help them na ma-reaccredit or ma-reinstate or yung accreditation because of some issues. But ang sinasabi kasi wala pa raw na-appoint, no? OIC pa lang, kaya hindi sila makapag-decide or hindi makapaggalaw, no? But since you have said that the President has given you the full authority and the full power, then I am confident na okay na po yun, no? Nasagot na yung katanungan ko. Yun lang sa PhilHealth, kaya ako tinanong din kasi OIC pa rin hanggang ngayon, pero yun nga ang sinasabi. Pero nakausap ko naman sa labas actually si BP, yung
Waway?
Yeah,
Waway Bacareza?
Kasama ni Fernando Antonio, no? Nakausap ko sila doon, no? So they will look into this, no? Madam Chair, the reason why I'm asking all of this is because during this pandemic, especially marami tayong hospitals na I mean, yung kailangan yung mga hospitals, so kailangan talaga na-accredit sila. Otherwise, hindi nila masaserve yung dapat nilang masilbihan, no? Yung mga kailangan na mag-avail ng benefits ng PhilHealth. That's all, Madam Chair. I submit to your... Thank you, Madam Chair.
Thank you very much, Kong. May we now proceed to the next interpellator from the majority, the Honorable Lord Dan Suwan.
Thank you, Madam Chair. Good afternoon, everyone. Madam Chair, may I ask if there's an inadequacy in the number of mechanical ventilators, just in case there will be another COVID surge?
Madam Chair,
please respond. The Honorable Yusek David is recognized.
Thank you, Vice Chair. With regards to mechanical ventilators po, during the onset of the pandemic in 2020, we experienced some inadequacy of the numbers of mechanical ventilators. But we have been tracking those numbers daily. And as we progress po with the pandemic, we have already seen adequate numbers of mechanical ventilators among the public and private hospitals. And we have seen po na there is already a lot of available mechanical ventilators in the market that can be outsourced by the private sector and the public sector when there are surges po in COVID-19. So right now po, we are okay with mechanical ventilators.
Another question, Madam Chair. I also noticed that there doesn't seem to be an equitable distribution of these mechanical ventilators. Even in northern Mindanao, we only have around 14 mechanical ventilators in Cagayan de Oro City, which is considered the regional center in northern Mindanao, in our region. Do you have any programs or courses of action in order to remedy this inequitability?
Yes, Madam Vice Chair and Honorable Congressman, our mechanical ventilators have been procured have been donated and procured. But right now po, our main source of our mechanical ventilator needs is outsourcing by the hospitals, and they can use MOOE for that. And yung ating pong mechanical ventilators are only for our hospitals, usually level 3, some level 2, that have the ICU capacity for the use of the mechanical ventilators.
On another topic, Madam Chair, may I ask if there is any truth to the reports that the possible cause of the recent spate of spam messages could be the unregulated and unchecked contact tracing of some private establishments during the height of the pandemic?
Secretary Vergeire, please proceed.
Yes, Madam Chair and Honorable Congressman, we don't think that would be a cause or a factor from our contact tracing systems, as these contact tracing applications were vetted by the DICT as well as the Data Privacy Commission. So meron pong mga conditions and requirements for a specific local government to be able to establish their contact tracing application. So we don't think that the leakage in personal data came from this kind of contact tracing efforts of the government.
Last question, Madam Chair. Since I'm also a member of the Ways and Means Committee, and we might be tackling the syntax on sugary beverages very soon, may I inquire about the pros and cons of increasing the syntax for these beverages?
Madam Chair, if we can recognize Yusek Beverly to answer the question.
Please proceed.
Thank you, Chair. Sir, so for us, of course, the advantages would be deterrence for specific target populations like young children to actually consume these beverages. Also, similar to what was stated in the approved SSB tax law in 2017, that there will be revenues that may be allocated for the health sector. However, we're also acutely aware that this may unintentionally impact the poor people who we know are reliant on cheap, high caloric goods. No? So just to get them by the day for their work, etc. So these are the two main things that we might need to balance out. Thank you.
Thank you, Madam Chair. That's all.
May we now proceed to the next interpellator from the majority, the Honorable Patrick Michael Vargas.
Thank you, Madam Chair. Good afternoon, everyone. I have 2 points. First of all, for the record, I've been a cancer prevention advocate since both my parents passed from cancer. Having said this representation is fully supportive of all the programs of the DOH. I'm earnestly asking my colleagues in Congress, particularly in the Committee of Appropriations, to reinstate the allocation for free medicines, cancer care, and treatment under the Cancer Assistance Fund in the proposed 2023 budget of the Department of Health. I'm making this appeal together with my brother, former Congressman Alfred Vargas, the principal author of the National Integrated Cancer Control Act. After learning that the allocation for the CAF has been decreased from the proposed 2023 budget of the DOH, CAF is supposed to cover expenses for chemotherapy and other cancer treatments. Our battle for the big C remains as a major health concern in our country, and the Cancer Control Division of the DOH estimates the number of cancer patients in the country at 156,000. This means 189 of every 100,000 Filipinos are afflicted with cancer, and based on the data we have in 2021, an estimated 20,000 to 24,000 indigent cancer patients were able to avail themselves of the benefits from the cancer programs with a total of only 756 million. DOH previously sought a budget of 900 million each for the CAF and other related cancer and supportive palliative medicines access program. Napakahalagang maisama muli at madagdag natin ito sa National Expenditure Plan ng Department of Budget and Management. And I hope that DOH, along with myself, ma-push natin ito together na maibalik naman or malagyan ng budget itong batas na inilaban ng aming pamilya. Maraming salamat, Your Honors. And then that's my first point. My second point is about the PhilHealth. We're getting reports from hospitals that there are still no payments for months. And sometimes the dues umaabot ng daang milyon para sa mga private hospitals natin. So I know there's a new implementation for PhilHealth. Can you do a very quick walkthrough on how the payments or the hospitals that still have dues sa PhilHealth will be managed by the DOH? Thank you.
Yeah, that will be a question for PhilHealth to answer. Payment of hospital reimbursements.
Thank you, Madam
Yeah.
Chairperson.
Attorney Ella, if you can just go quickly, just enumerate ano ba yung process ng reimbursement.
First, Madam Chairperson, is that the hospital will submit its claim, and PhilHealth has 60 days to process and pay the claim. And the outcome of this is probably three. One is payment. One is that claim will be returned to the hospital. And third is that the claim will be denied. So upon receipt of PhilHealth, PhilHealth has 60 days to process and pay. We are happy to report, Madam Chairperson, Honorable Congressman Vargas, that at present our average turnaround time, meaning from receipt, processing to payment, is 48 days. So may I request, Madam Chairperson, Honorable Representative Vargas, information as to which hospital is suffering from delayed or non-payment of claims. We are willing to reconcile and communicate with them so that the issue of non-payment or delayed in the payment of claims will be settled as soon as possible. Madam Chairperson, Honorable Representative Vargas. Thank you.
Thank you, Madam Chair. Thank you, sir. We can submit a list to your office. Perhaps we can exchange contact information right after this conversation. Thank you very much, po.
Does the Honorable Vargas have any further question, or we can proceed to the next interpellator?
No further questions, Madam Chair. Thank you.
Thank you very much. Next interpellator is the Honorable Luistro. While waiting, we can proceed with the Honorable Jose Maria Zubiri. Servil, no? Vervil. Jervil. The Honorable Ria Vergara, virtually present. The Honorable Joboy Aquino. Yan.
Always here. Thank you, Madam Chair, Madam Secretary. First po, ang tanong ko lang yung may kasamang kasi ako sa probinsya na nag-retire na 2 years ago and used to work with the city government. But ang inanole, yung hazard pay daw, up to now, di pa na may, it's with the national government because she made a letter addressed to, former secretary noon sa health, no? And up to now, wala pa rin. Maybe I think yung katabi niyo may answer.
Madam Chair. Okay, Honorable Congressman, good afternoon po. Yes, can we just get the details so that we can facilitate po?
Okay, sige, I'll submit. Second, medyo naguguluhan lang ako dito. May health center, may super health, ano ba yung kanina, binabanggit. Ngayon, I just talked, I have one municipality under me, no? And yung mayor, who is a new mayor, the daughter, the former mayor, was asking help from me para naman sa RHU.
Rural Health Unit. I think that's the meaning, no? And humingi siya ng tulong sa akin na kung pwede yung funds for the building, no? And sila yung munisipyo na daw ang bahala sa equipment. Sabi ko, sige, I'll try my best na makaano naman para sa Rural Health Unit. It's a municipality of Las Nieves. Ma'am, mahirap po hindi tumulong sa mga mayor na babae. Nahihirapan mo ako. Lalo na pag mga magaganda. Joke lang. Yes, kasama na kayo dyan. Yung dalawa. So ma'am, Secretary, do you think you can help me with that?
Yeah. DOH, please respond.
Yes, Madam Chair and Honorable Congressman. First, RHU, Health Center are the same. These are outpatient facilities. The Super Health Center has been patterned dun po sa polyclinic na tinatawag, which had been done successfully in other countries. Ngayon po, ito pong sa area nyo, sa Agusan. It's okay. Municipality. Marami pong nakalagay na munisipyo, but we have Las Nieves. We will look through this, sir, but definitely, ayan, meron. 12 million po for a super health center.
Thank you. May nakalagay na for medical equipment, 20 million. Is it possible if I can submit medical equipment part of that 20 million, na mabili sa 20 million? And this came from the director of the Butuan Medical Center.
Yes, Madam Chair and Honorable Congressman. Yes, you, pwede po, Honorable Congressman, you can submit to us the list of equipments that you would need in coordination with the Butuan Medical Center po.
Yeah, I have it received early this morning, and the name is, I think, your Legislative Liaison Officer, Mr. Castillo. Yun ang naka-receive doon sa the other room siguro. Anyway, that's all, Secretary, and thank you, Madam Chair.
Thank you very much, Honorable Joboy Aquino. Next to interpolate is the Honorable Jefferson Konghun.
Secretary, good afternoon at sa lahat ng DOH family. Secretary, isa po ako sa nag-introduce ng bill establishing multi-specialty hospitals in different regions to facilitate the access to specialized care, no? Dahil alam naman po natin sa amin lugar, napakadaming mga kababayan natin doon na sobrang nahihirapan, lalong-lalo na pagpupunta sila sa Philippine Heart Center, Lung Center, sa National Kidney Transplant Institute, kailangan pa nilang lumuwas sa Maynila para makakuha ng mga espesyalista, ng mga doktor at mga gamot. Secretary, for the meantime, habang hindi pa ito na isa sa batas, ano po ba ang mga measures na ginagawa natin para at least mapadali yung paghihirap ng ating mamamayan? Kasi yung pagpunta pa lang doon, Secretary, mahirap na po.
Yes, Madam Chair.
Yes, please proceed.
Yes, Madam Chair. Magandang hapon po, Honorable Congressman. Una-una po, meron po tayong plano na for Health Facility Development Plan. Kasama na po doon yung mga multi-specialty centers natin. So in this plan, meron po tayo mga existing hospitals that we will be improving the capacity for us to have these multi-specialty centers, aside from the establishment eventually of the others. Pero ngayon po, meron na tayong 40, We have 48 facilities with the specific specialties na meron across all regions. But we will not stop here. Meron ho tayong mga budgeted, proposed budget right now for NEP 2023 that will be able to further improve the capacity. Aside from that, Honorable Congressman, meron din ho tayong cadres or healthcare workers or specialists that we will need for these multi-specialty centers. So we are now working in parallel so that the development and capacitation of our personnel or specialists will be there once we have established all of these multi-specialty centers in the country.
Thank you, Madam Secretary. My second question, Ma'am, is ano po ba ang advantages? Kasi sa Zambales, sa Olongapo City, wala pong mga hospital, DOH hospital doon. Ano po ba ang advantages and disadvantages kailangan gawin para maging ang isang hospital ay maging isang DOH hospital? I mean DOH run hospital.
It depends on the law which has established the hospital. That's first, Honorable Congressman. The second would be the capacity of the local governments. If they have established the facility, they need to maintain that. I think you're asking if you kung ililipat po yung management to the Department of Health, like renationalizing. I will call on Yusek Lilibet David para po dito just to give you an initial response from the department.
Yusek David, you're recognized.
Thank you, Madam Vice Chair and Honorable Congressman. So, we know that the management of hospitals is really a very complex and expensive endeavor. So alam po namin na the management and maintenance of hospitals is a very complex and difficult endeavor, especially for the local government units. So for the DOH po, we would really like to encourage the upgrading of all hospitals to increase the bed capacity to fill all the gaps for our health facility needs in the country. We only have to contend with the Mandanas ruling for the devolution of services, lalo na po yung for provincial hospitals and district hospitals to provinces. But certainly po, if we see that it's really needed in an area that the LGU cannot develop it, the DOH is very willing po to help the LGU and assess and bring it for renationalization.
Okay. For parochial concerns naman, Secretary, sa Zambales kasi, yung CT scan machine, yung mga equipment galing sa DOH yung mga yon. I just want to know, meron ba tayong mga after sales services, kasi nahihirapan po kami lalong-lalo na sa mga services, after sales services ng CT scan, kasi galing po sa inyo yung CT scan sa Zambales, nasira po siya. Nahihirapan po kami sa after sales services, pre-procure ng DOH binigay sa Zambales. Paano po ba yung mga services repairs niya? Napakahirap po.
Yes, thank you, Madam Vice Chair and Honorable Congressman. So yung ating pong equipment, meron po yung 2 to 3 years warranty so that the supplier can do it for the hospital. However, we're also trying po for other future procurement to extend that the warranty and services for 7 years po.
Paano po pag halimbawa nag-expire na mo yung warranty? 3 years bago pa po yung equipment na yon. ano po ba yung po pwede natin gawin? Kasi minsan, yung supplier po ng DOH, iniiwan na lang po yung mga equipment. Hindi na alam ng LGU kung saan sila tatawagan, saan sila kukontakin para i-repair yung mga medical equipment. Lalong-lalo na po pag ito'y galing sa DOH.
Yes, so we really need to understand po the specific case in your area. So we will ask po yung regional director namin to look at it. And if we really need to assist you po, we will assist you.
So may mga contact pa naman po kayo sa mga supplier ninyo. Kahit lagpas sa warranty, po pwede nilang i-repair o ayusin yung mga nasirang medical equipment. Kasi ang nangyayari po, once na nasira na yung mga medical equipment, minsan pre-procure ng DOH, hindi na po mapakinabangan. Kasi hindi alam kung kanino ipare-repair, sinong gagawa. Dahil syempre ang procurement po nangyari sa inyo, sa Department of Health.
Yes, so we will have to find out po yung case ng situation that you're mentioning. And then, pero the better solution po is to increase the warranty period to 7 years for future transactions.
Anyway, thank you po. Last concern lang po, meron daw pong delay no sa pag-deliver ng ating mga pneumonia vaccines, flu vaccines. Ano po bang nangyari kung bakit merong delay ng pag-deliver ng mga ito?
Madam Chair. Yes, Honorable Congressman. Una-una po, wala po tayong delay sa deliveries ng ating mga pneumonia vaccines and the other vaccines coming from the department.
Flu vaccines.
Flu vaccines. Ang nangyari lang po, nagkaroon lang po nung konting delay dun po sa ating procurement process. Whereby kasi nagkaroon lang po ng yung sa bidding process po natin because of the choice of the vaccines. Pero wala naman po tayong naging delays as to deliveries.
Before po, Secretary, final question na po talaga. Before po, ang procurement ninyo, PSDBM po ba nagpro-procure o DOH na ngayon? Kasi narinig ko dati yung mga equipment na ginamit noong panahon ng COVID, PSDBM ang nag-procure, tama po ba yun?
It has never, we have never used PSDBM for the procurement of our vaccines.
Okay.
We have used PSDBM or course through PSDBM for some of the COVID-19 response commodities.
So DOH is now the head procuring agency pagdating sa mga vaccines, equipments, and everything that the DOH use.
Yes, Honorable Congressman.
Thank you. Thank you. Thank you, Madam Chair. Thank you, Secretary.
Thank you very much, Kong Hoon. The next interpellate is the Honorable Jervil Luistro.
Good afternoon, Madam Chair. Good afternoon to our colleagues from the Department of Health. For our first concern, may we know the ratio of physicians and nurses, the ideal ratio of physicians and nurses in the Philippine health facilities under DOH?
Madam Chair, if we can have Yusek Kenneth Ronquillo to answer the question. Sa UHC.
Yes.
Yusek Ronquillo, please respond.
Thank you very much. Well, the ratio for health workers muna in general to population, that's 44.5 to 10,000 population. Yung 44.5 based on WHO referencing uses doctors, nurses, and midwives. But of course, in the Philippines, we have other cadres more than doctors, nurses, and midwives. But that is the ratio that's used globally, so we also use that. When we try to divide yung ratios for doctors, for nurses, and for midwives, so for doctors, it's about 7 to 8 per 10,000, 27 per 10,000 for nurses, and the remaining 8 are for midwives. So yan po yung ginagamit natin na reference for ratios per 10,000 population in the country.
Given that ideal ratio, Madam Chair, may we know the status of the number of health workers, government doctors and nurses in the Philippines, the current status, Madam Chair?
Well, the current status that we have based on the cadres that we have, and for only the three cadres that I mentioned, our current status is we at least 19 per 10,000, ma'am.
That is for health workers, Madam Chair. How about for physicians and nurses?
Well, for nurses, that's about 54 po ata. But for nurses, we're much above the current ratios for nurses. But for doctors and for midwives, we're below the ratios that I mentioned earlier po.
Given the ratio of 7 to 8 per 10,000, I think that's for government doctors. What is the status of the number of government physicians that we have in the country, Madam Chair?
Physicians. So we have the number of physicians. If I may just talk about the numbers in absolute numbers. The supply that we have as of yet is about 40,850. That gives us a ratio of 3.7. But the demand is about 158,177. For nurses, the ratio currently is 16. We have a total of 175,900. The demand is 301,944. And for midwives, it's 5.2. The current supply is 57,108, but the requirement is 30,000. So we have a little more of midwives.
Yes, to simplify the data, Madam Chair, from the ratio of barangay workers, barangay health workers, government physicians, and nurses in the government health facilities, would the DOH agree that we are 40% behind the ideal ratio?
Yes, we may say that. Opo.
Yes, and may we know, Madam Chair, how the DOH addressed this concern?
Well, under the Human Resources for Health Master Plan, we made a projection over this administration. We looked at the need versus supply and demand, as well as the adjustments because of mobility of health workers. We ask at the production side, we're working with CHED to increase enrollment so that we come up with the workforce in the future. But as of now, we are augmenting LGU needs through the deployment program of the Department of Health.
Yes, Madam Chair, I understand that we have a law, Doktor para sa Bayan, which I think is an offshoot of the COVID-19 pandemic. May we know it is part of the indulgence of the DOH to address the insufficiency of number of medical professionals in the government, to consider the same program with respect to the nurses, medtechs, and other medical professionals, Madam Chair.
Yes, for the Doktor para sa Bayan scholarship program for doctors is now under CHED. So what the DOH is finishing are the previous enrollments of medical scholars. But starting this year, nagsimula na po yung CHED to get into the medical scholarship program. But for midwives and the other cadres, pharmacies and medical technologists, it's still with the Department of Health. And we're meeting with CHED this week or next week to see how this program can be transferred to CHED, because CHED is telling us that as of yet it has not been budgeted under their 2023. So if that is so, we will still continue with enrollment of health allied professionals in the DOH, but for 2024 it will be transferred to CHED.
For purposes of confirmation, is it correct to say that the DOH is working with the CHED for the purpose of scholarship of other health professionals?
Yes.
Thank you, Madam Chair. For my next concern, May we know the current data on Filipinos who are inflicted with AIDS or HIV? Do we still feel the need to have a separate agency catering this concern, or is it possible to integrate this agency with the OSEC programs?
Can DOH please respond?
Yes, Madam Chair. We're getting the numbers right now, Madam Chair and Honorable Congresswoman Luis Ro, but for the need to have a separate agency for that, we don't see the need, as we also have the Philippine National AIDS Council, which helps the department to do intersectoral collaboration for us to be able to address the challenges that we have for the program. If we can recognize, Madam Chair, Yusek Beverly Ho for the statistics on HIV.
Yusek Beverly Ho? And those data is actually under declared because we don't have mandatory HIV testing.
Yes, ma'am. Thank you. For our targets for HIV/AIDS of 95, 95, 95, we do have just 61% HIV diagnosis, 65% treatment coverage performance, and 96% viral suppression performance po.
Yes, may I just manifest that I hope the PNAC is addressing very well this concern of HIV, why we are overwhelmed perhaps of our concern on the continuing COVID-19 pandemic. And for my next concern, Madam Chair, for Bayanihan 1 and Bayanihan 2, we had appropriation of 48.9, 48.99, and 48.94, both in billions, respectively. This is for the purchase of vaccines and expenses under the health system enhancement. However, it appears that 12.9 billion of the same budget remains to be unobligated as of 2022 budget. May we be enlightened on this, Madam Chair?
DOH, please respond.
Yes, Madam Chair. This is Honorable Congresswoman. This is part of the loan, the HEAL loan from World Bank, and dito po sa ADB may loan din po tayo, which have comprised the funds for us to procure vaccines. During the time that we have undertaken this loan, meron po talagang mga needs pa tayo for vaccines. But right now that we have savings already for this. We have requested for the realignment of these funds already so that we can use it for other purposes for the COVID-19 response. So ito po yung aming, we are trying to discuss this right now with both World Bank and ADB so that we can use the funds for other purposes, Honorable Congresswoman.
Madam Chair, may we know when this loan started? Because I presume that having this as a form of a loan, it means that the government is also addressing our obligation with respect to the interest of the one which provided the same. In this case, I think this is ADB and the World Bank, Madam Chair.
Yes, Madam Chair and Honorable Congresswoman, this loan have started in the late 2020s when we started planning for our COVID-19 vaccine deployment program.
With that, Madam Chair, may we be enlightened if as to the percentage of the loan that we were able to utilize for the intended purpose, and the percentage of the same which remain unutilized, but the interest continue to accumulate.
Madam Chair and Honorable Congresswoman Luistro, may we be allowed to submit the required details of the coming from the questions of Honorable Congresswoman Luistro to her office?
Yes, Madam Chair, for clarification, I wish to be furnished with a copy of the loan from the ADB and the World Bank, and to reflect in the report that portion which was utilized and that portion which remains unutilized, notwithstanding the accumulation of the interest from the financial facility. For our next concern, Madam Chair, for 2023 budget, it appears that the HFIP will receive 22.0 billion. This is for the construction, rehabilitation, and upgrading of health facilities, including the purchase of medical equipment for these facilities. May we know how the Department of Health provide budgetary support to LGU with HFEP as one of the major programs of DOH under its Devolution transition plan, Madam Chair.
Madam Chair,
Please proceed.
if I may call Director Nene Gorgolon to respond to the question.
Director Gorgolon, please respond.
Madam Chair, Honorable Estro, and the rest, HFEP 2023 budget proposal are aligned with the following: Universal Healthcare Act, the Philippine Health Facility Development Plan, the Garcia Mandanas Rolling Devolution Transition Plan, the Local Investment Planning for Health, and our Priority Availment and Prioritization Guidelines for 2023 po. So doon namin binabase yung mga allocation for DHS, RHUs, LGU hospitals, DOH hospital, and other healthcare facilities po. Salamat po.
Yes, Madam Chair, I understand that HFEP is being used to support the LGU health facilities. May we expound on the extent of support that this program is intended to be utilized by DOH and as far as the LGU health facilities are concerned?
Particularly for the local government unit assistance, we now pattern the parameters under the National Allocation Program. So this is with regards the Garcia Mandanas rolling, wherein we have 4 category of LGUs. We have the low capacity high gap LGUs, which is category 1, and high capacity high gap LGUs, which is category 3. And low capacity low gap LGUs is category 2, and high capacity low gap category low gap, which is category 4. So basically, yung priority ngayon ng HFEP is more on the category 1 and category 3. So definitely yung identified under category 2 and category 4 has been started devolving for this year and next year. Kaya doon po namin pinapattern. So, but we also have recognized the need of those LGU with GIDA areas. So we can still fund for this particular facilities. Thank you very much.
That is noted, Madam Chair. With respect to Mabini Community Hospital in our legislative district, particularly in Mabini, Batangas, I understand that most of the medical equipments, and I think portion of the infra, came from the HFEP. Confronted with the inability or incapacity of the LGU to support its operating expenses. But considering that the infra and the medical equipments came from the HFEP, may we be enlightened if there are options on how the DOH may be able to support its operating expense? Madam Chair.
Madam Chair.
DOH, please respond.
Yes, Honorable Congresswoman, the operational expenses are the responsibility of local governments, as the Department of Health's mandate is to provide the infrastructure and the equipments to our congressional districts, Madam Chair.
Thank you, Madam Chair. With that manifestation from our Honorable Undersecretary OIC, may I just solicit the support of the Department of Health in my bill creating for Batangas Tourism Specialty Hospital, perhaps to put an end to our dilemma of finding operating expense to continue the operation of Mapini Community Hospital. That would be all, Madam Chair. And thank you to Yusek Berher and of course to our guests from DOH.
Before we proceed to the next interpellator, are the members present in this hearing, did the Secretariat coordinate with the Secretary General for the session? Yeah. So we have all been declared present. Thank you. The next interpellator is the Honorable Ria Vergara, who is virtually present. The Honorable Marvic Copilar. Hindi, okay lang. The Honorable Marivic Copilar.
Madam Chair. Madam Chair, for my first question.
Please proceed, Kong.
Thank you, Madam Chair. Madam Chair, through you, I would like to ask the Department of Health, particularly the Secretary, why are the private hospital exempted from medical facility? Why are the private hospital exempted from medical facilities and institutions accepting guarantee letters to lessen the fees of our underprivileged citizens?
Madam Chair. Yes, Honorable Congresswoman, hindi po naman actually straightforward na exempted. There is that provision also wherein sa special provision nga po for 2023 we have proposed to DBM that we include the inclusion of this specific clause that we can do MOAs with private hospitals. May conditions po kasi kapag wala yung services sa government, we can do the private or do MOAs with the private hospital. So that's part of what we intend and to push para po mas maraming access ang pasyente natin. So it's not really that private hospitals are exempted from this medical assistance.
Yes, Madam Chair, to you again. Secretary, kasi ang problema, like ang sinasabi natin, pag hindi tinanggap ng public hospital o wala siyang facility ng yung public hospital na to, itong pasyente na ito, tsaka lang natin pwede i-honor no, na yung guarantee letter pag lumipat sila sa isang private hospital. Pero did we take into consideration na minsan pag may sakit, talagang pupunta na talaga siya dun sa ospital na tingin niya na pwedeng lunasan yung kanyang sakit. Mahirap yata yung ating clause na pag hindi umubra yung isang ospital na ito o walang facility na ito, tsaka lang pwede sa isang private hospital, tsaka lang pwedeng i-honor yung guarantee letter. Secretary?
Yes, Madam Chair and Honorable Congresswoman. First, sa JA 2022, specific po yung nakalagay for medical assistance for indigent patients na nakalagay po that the private hospitals can only be subcontracted if the services from the government hospitals are not available. The second one would be we are very much in agreement with you that there would be instances that our patients won't have that access to our government facilities because hindi available yung serbisyo. That's why some of our regional offices right now have outstanding contracts or MOAs with the private facilities in order for us to have this network of facilities where our constituents or the indigents can go to. Ang isa ho namin gustong i-emphasize, aside from the medical assistance, we have PhilHealth also. So if they will be accessing services coming from private facilities, they can use PhilHealth as well, both for outpatient and inpatient services. But nevertheless, Honorable Congresswoman, meron po kaming nire-recommend ngayon for the special provisions ng JA 2023, NEP 2023 maisama, na ito nga po, yung MOAs natin with private sector hospitals ay makasama na doon para we can be able to further study on how we can provide better access po para sa indigents natin.
Well, Secretary, the reason why I asked this, kasi not even the indigent, hindi lang naman indigent could also benefit from RGL. Kahit naman yung mga basta may sakit, no, sana pwede rin nating matulungan because especially kunyari may kaya siya pero taxpayer siya, mapakinabangan man lang niya yung tulong ng ating pamahalaan, Madam Secretary. That's why I hope you take into consideration na talagang sana you could develop a MOA with other private hospitals that pwedeng puntahan ng ating mga pasyente, whether indigent or not indigent, and the GL will be honored by this hospital. Madam Chair, for my second question, I would like to know how many cancer specialty centers do we have across the country? Are they equitably distributed according to the population density and number of cancer patients per area or region?
Yes, Madam Chair, if we can have Director Tess Vera to respond to the question.
Director Tess Vera is recognized.
Thank you, Madam Chair. To the Honorable Congresswoman, relative to the cancer care, briefly, I just want to explain the resource stratified framework, wherein we have different levels of care to be provided by the different cancer centers. So we have the National Specialty Center, that's a single specialty facility that provides treatment for cancer patients. And for the different regions, we have these basic comprehensive centers, and this will be established in selected DOH hospitals, as well as advanced comprehensive centers that will provide higher service capability. So this will also be put up in selected facilities. So far, for the different areas, so different regions will have this basic comprehensive cancer center. And for the advanced comprehensive, we have 11. And for the basic comprehensive center, we have 13.
Okay. Madam Chair, for my last question, Madam Chair. What are the flagship programs of the National Nutrition Council? What are the responding major accomplishments?
Yes, Madam Chair and Honorable Congresswoman. Right now, we have the Philippine Multisectoral Nutrition Project. This is a project in collaboration with World Bank, and this is worth 9.8 billion pesos, wherein the Department of Social Welfare and Development is also part of this. So our major goal is for us to reduce stunting. Stunting currently in the country is around 33%. And dito po sa ating ginagawa ngayon na PMNP or the Philippine Multisectoral Nutrition Project, we will be having this nutrition sensitive and nutrition specific interventions, and we will be focusing on specific local governments with this increased incidence of stunting. We will be reinforcing the capacity of our regional and local nutrition councils. We will also be having our barangay nutrition scholars go to the ground. We will be helping them, capacitating them so that we can further assess situation and they can focus on families on the ground. We will also have our local nutrition scholars or workers where we have these modules already being prepared so that they can also be capacitated. Aside from that, we are going to do this in an integrated manner where we are going to implement
Thank you so much, Madam Chair. Oh, meron. Oh.
Sorry, you don't look like my husband. The Honorable Samantha Santos is recognized.
Good morning and thank you, Madam Chair. To our OIC for DOH, to the member and the family of the DOH, maraming salamat po. My first question for today would be, with the Mandanas-Garcia ruling, some medical services will not be provided by the DOH. And because of that ruling, a lot of people at the same time, sa mga probinsya, sa mga munisipyo will be affected. I would just like to ask, what are the things that cannot be provided anymore? If that makes sense.
Yes, Madam Chair, and good afternoon, Honorable Congresswoman Samantha. For the first one, as we have mentioned a while ago, there is this devolution transition for our commodities. So the first line of commodities that we are going to devolve for this year to our local governments would be the basic medications on hypertension, on diabetes, which the local governments actually mostly procure for their constituents. It's just supplement for us. No, we just augment the budget of local governments for this. A second one would be we've started off with the national allocation framework for our health facilities, wherein we've used this tool for us to classify the different areas of the country, whether they are of high capacity or whether they are of low capacity. So we have prioritized those areas of low capacity to be included into our health facilities enhancement program. Aside from that, we also have deployed human resources. And in this deployment of health human resources, again, we have prioritized those areas with low capacity, but there is high need. And the least prioritized are those that we will still be augmenting our assistance, but not so much as to those priority areas, would be those higher capacity and lesser need. So may timelines po tayo ng devolution or devolution transition plan. We have submitted it to the House of Representatives, and we are very much open to sit down with local government so that all of us will be aligned and maintindihan din po maigi para magkaroon po tayo ng collaboration.
Thank you po, OIC. Just a follow-up question. How do you identify the said priority communities? Is it when it is identified as a fifth class or a sixth class? Is that correct?
Yes, Madam Chair and Honorable Congresswoman, it's based on the level of income of an area.
Thank you for the clarification. For my second question, it's regarding the MAIP. We would just like to ask, how do we actually appropriate the funds for the MAIP? At the same time, how do we utilize its effectiveness when it's implementation?
Yes, Madam Chair, if we can recognize Undersecretary Sharid Grande to respond to the query.
Asek Sharid.
Good afternoon, Madam Chair. Honorable Congressman, in utilizing our MAIP, of course, we download it to our hospitals, to the different DOH hospitals, including SUCs, LGU hospitals. So we provide them. And in fact, we also have MOAs with private hospitals. So that is the coverage of the utilization of MAIP. And in so far as its utilization, of course, depending on the diseases, depending on the bill, we have also the malasakit centers in the different hospitals where patients can go and avail of the MAIP funds, Madam Chair.
I think I have to clarify my question. How do you allocate the funds among the congressmen to actually, paano niyo po ba na-measure kung gaano kalaki ang ibibigay per congressman, or is it because of the district?
Actually, ma'am, our basis is the bed utilization as well as the bed utilization and the number of beds as well as the utilization of the hospitals. At the same time, we take into account the population and that's our basis, ma'am.
All right, thank you so much. For my last question, it's regarding the construction of government hospitals. There are cases na kung saan hindi po kasi na-check ng DOH ang ginawang plano ng DPWH. And how do you actually go about it kung hindi nyo po na-aprobahan ang isang plano pero ginawa na po ng DPWH?
Madam Chair, if we can recognize Director Nene Gorgolon to respond.
Director Gorgolan is recognized.
Madam Chair, Honorable Santos, actually when we plan for a construction of a hospital, it has to be coordinated with our licensing requirements. So there should be a permit to construct so that alignment of its construction is in accordance with the purpose of that facility. So supposedly wala pong gagawin si DPWH kung hindi po siya na-check ng regional office po. Kasi it's the regional office who will be looking into that construction should have permit to construct. Thank you very much.
We just brought it up because there are incidents that I feel like we have to bring up to you in private siguro po. Maraming salamat.
May we request the USEC for Mindanao? USEC Okang Dumama. I can see that you are starstruck by the great look of the young legislator. USEC Dumama, may we request you to see Congresswoman Samantha Santos? Maybe during the hearing.
Yes, Congressman. We'll make sure we can coordinate with you, and somehow tomorrow, if there are some issues that you need to discuss with the regional director, Dr. Arditan, will be coming over by 9 o'clock po. Nasa 4th floor lang siya. If you're not available po, you can send your vocal person po. Thank you.
That's noted. Thank you po.
May we now call on the Honorable QT Del Mar. Apologies. Very quickly, with the indulgence of the Honorable QT Del Mar, may we recognize the Honorable Edsel Lagman for a quick interjection.
Thank you, Madam Chair. I would like to disabuse the minds of some officials in the executive department and even some legislators on the problem of devolution. The culprit here is not the Mandanas Garcia ruling, because this ruling is well reasoned and justified. It gives to the local government units incremental era coming from customs duties. The problem really, or the culprit, is the EO 138 issued by former President Duterte, which virtually sequestered the incremental revenues going to the LGUs by ordering the LGUs to fund local projects previously funded by the national government. That is now the problem. And I think even the president is not in favor of this EO 138. We have had several departments like the DSWD and DTI, and they have suspended this devolution with respect to their poverty-related projects. I was just wondering why the Department of Health is complying with the devolution ordered under EO 138, whereas the other departments are not. They are suspending the implementation of their devolution transition plan with the approval of the President. Thank you, Madam Chair.
Thank you very much, Kong Edsel. May we now recognize the Honorable QT Del Mar.
Thank you, Madam Chair. Maayong hapon to our OIC and the rest of our DOH family. This is in connection with my letter dated August 15, 2022, requesting for funding allocation of 12 million for the construction of the new Super Health Center in Barangay Guba. If I can please request that it be allocated instead to the completion of an existing Guba Community Hospital and be increased to 20 million.
Maybe the Honorable QD Del Mar can submit a proposal for errata.
Yes, and it's ready here. And my last parochial concern is I would like to request 145 million for the completion of our building that in Vicente Soto, which we started, which 3 years ago reached the 5th floor. Now with 145, we will be able to complete 6th, 7th, to possibly even the 8th floor. Vicente Soto Memorial Medical Center is the apex hospital, which caters to a lot of patients from Region 7 and even some patients from all the way in Mindanao and Negros. Thank you, sir.
Yes, Madam Chair, Honorable Congresswoman, we will be reviewing, although we are aligned with the directions and priorities, ma'am. We will just wait for the modification and we will be advising your office, Congresswoman.
Thank you very much. Daghang salamat. Maayong hapon.
Next to interpolate is the Honorable Kaimer Olaso, the Honorable Ana Bundok, Deputy Majority Leader Marlene Primicia Zagabas.
Thank you, Madam Chairman. Magandang hapon po sa ating lahat. Una po sa lahat, I just would like to say maraming salamat po sa DOH family sa lahat po ng sakripisyo para sa bayan. At maraming salamat din po sa MAIP. Maraming salamat sa lahat ng mga tulong at sa mga dadating pang tulong sa aming distrito. And I just have some concerns. Medyo parochial po yung concern namin, but medyo wala po dito mga ibang kasamahan kong kongresista ng Pangasinan. But we had discussed it nung nagdaan regarding yung concern po namin in the province. Specifically, doon po sa distrito namin, just for example, for the past how many years, 17th Congress, siguro makapal na po yung sulat ko. I even visited the former secretary. With your kind indulgence, Madam Chairman, for the past hearings, I opted na sa sideline lang din i-discuss. But this time, I opt na to discuss it here. Baka pag naka-discuss ko sa budget hearing, baka mas marinig po yung sinasabi ko. So, nakailang sulat na rin po ako since 17th Congress. Nandito po ako, 18th Congress, yung husband ko po nandito. At ngayon nga po, nandito na naman, nag-aas na naman po ako. Just like kong QT, mayroon po kasi kami doon, Eastern Pangasinan District Hospital, run by the LGU. Kanya lang po, magkatabi ang Giria, pang matatanda, at saka yun sa birthing. So I've been complaining about that. Every year naman sinasubmit ho ng region yung proposal. Nakailang regional director na po ako. And itong last na pasyal po sa amin ng regional director, I thank them with her staff, si Director si Jonko. Sabi po niya, Ma'am, kasi po ang Pangasinan, na-categorize kayo na I don't know kung anong category daw po yun. Kaya daw po ang Pangasinan, mukhang hindi na ho kami makaka-avail ng mga, that's parang ganun po ang pagkakaintindi ko. Ano po ba yung sinasabi nilang category? Hindi ko po naintindihan yan eh.
Who can respond?
Yes, Madam Chair. This is the National Allocation Framework. Honorable Congresswoman, I'll turn it over to Director Nene Gorgolon to explain further.
Director Gorgolon is recognized.
Yeah, this is one of the parameters of HPEP allocation for 2023, the National Allocation Framework, wherein yung mga provinces po na nasa Category 4 or Category 2, meaning they have high capacity and low gap, hindi na siya priority for 2023. Kaya po yung Pangasinan, based doon sa record, masyadong high capacity and low gap. Kaya yung mga BHS po, nawawala po doon sa priority. And we are now introducing the Super Health Center po. Thank you for that.
Madam, ang budget po ng buong Pilipinas, 22.9 billion. Ang probinsya po namin, 3.2 billion ang populasyon. Siguro naman po, hindi naman porke sabihin na natin mayaman ang Pangasinan kung sino yung level ng income ang sinasabi nyo. Pero hindi po lahat ng munisipyo namin mayaman. Hindi lahat ng barangay namin mayaman. Yun po bang kategory natin, nakalimit na lang tayo sa province, na pag mayaman na yung province, hindi nabibigyan yung mga barangays na nangangailangan?
Hindi naman po. Meron naman tayong provision na particularly for GIDA areas we can consider. So we will review the recommendation of the region so that we can look into that. Pero talagang we are just following the national allocation framework po. But we can consider GIDA areas po.
So ang ibig pong sabihin yan, kasi nakita ko po, nandito ho ito, Barangay Health Station, wala po ang Pangasinan, zero kami lahat. Equipping, repair, construction, zero po siya. Sa RHUs po, zero din po kami. Ay meron po, may 10 na super health centers. Sa LGU Hospital, zero din po kami. So meron kayo ditong 55 other HF na nakasulat, wala rin po kami. So ang meron lang talaga kami out of the 22.9 billion na pondo, ayun lang po, 10 super health station sa buong Pangasinan. Madam Secretary, we would like to appeal. Please, siguro naman, pwede po bang pakiconsider, tignan po natin, kailangan po ng aming probinsya, especially na-devolve po ang karamihan. Hindi naman, yung sinidiscuss natin dyan sa Mandanas, pinapakinggan ko kung ano yung mga na-devolve na programs ninyo. Sabi po ninyo, yung gamot natin na pang high blood, pang diabetes, hindi ho mararamdaman masyado yan. Ang kailangan po namin doon, nakikinig ako kanina, binigyan ng ganito na mga equipment, ang kanilang LGU, hospitals. Ma'am, nagmamakawa ho kami. Tulungan niyo ho ang mga hospitals namin dahil kailangan ho. Kahit konting fair share lang naman po, wag naman po sa super health center lang ng isang distrito, may 2, may 1, natapos na doon lang po ang tulong ng national. Maraming salamat po. And regarding po sa vaccine, paano pong availability ng mga vaccines natin like the HPV, pneumonia, flu vaccine? Palagi po bang available yan o nauubusan din po ba tayo?
Yes, Madam Chair and Honorable Congresswoman, first, we will be reviewing po ito pong recommendation at request nyo for our health facilities. And we will be working with your regional director. Titingnan po natin how we can modify based on existing funds that we have. The second, yun pong ating mga stocks ng mga bakuna po. Yun pong ating mga pneumonia flu vaccine. Limited din ang resources natin for these specific commodities. We download it dun po sa atin mga regional for their local government units. But there are only specific population na binibigyan po natin ng mga bakuna, especially senior citizens, tsaka dapat indigent. No? So ito po yung mga conditions natin kasi nga limited lang ang resources natin. So sometimes, dadating tayo dun sa point na nauubos din po siya. Hindi tayo makapagbigay for everybody. But we're trying to manage po ngayon kung paano po yung allocations natin para yung vulnerable po talaga na-cover natin with these vaccines.
Ma'am, nagpapasalamat po kami sa distrito because sometime May 31, I think, o June 1, nagkaroon po ng HPV vaccination na di po ba series po yun, may second na may third po yata, ganun depende po sa edad. Ma'am, tapos na po yung days. I was told na dapat within how many days dapat yung second dose niya maibigay. So we would like to appeal. I asked the regional director, nag-ask na rin daw po sa central office, pero wala pa raw po yata. So I just would like that to put in record.
Madam Chair and Honorable Congresswoman, for delivery na daw po yung ating bakuna per HPV. So just expect na lang po na magkakaroon po yung inyong area.
Thank you po, ma'am. Total, sabi naman po nila, kung hindi daw pa nabigay yata ng 30 days, it can be given within 90 days. So within pa naman po. So with that assurance po, again, maraming salamat po. Secretary, yun pong apila namin. Tulungan niyo po kami. Maraming salamat po. Thank you, Madam Chairman. Thank you, my dear colleagues.
Thank you very much, Kong Agabas. Next to interpellate is the Honorable Ted Haresco.
Thank you, Madam Chairwoman. Again, welcome to the DOH family. Lalong-lalo na po yung ating OIC. Napaka-photogenic nyo po palagi. And your constant update on during the war against COVID was very calming. Welcome din po kay Yusek David and the DOH family. Welcome po. Ang unang-una ko po gustong tarugin ay yung dengue po sa Aklan ay palagi po mataas. And I'm trying to meet with the head of RITM, but she is always busy. And tumataas by the year ang dengue po namin. At saka papaano po ma-contain o ma-reduce ang dengue deaths sa Aklan, Secretary. So that's one. And number two, meron pong 86 opinions ang COA sa department. And it came out with adverse opinion on the audit reports. So, pakisubmit na lang po sa akin on the list of the 4 questions. Number 1, DOH average an obligation rate of 91.2% from 2016 to 2021. This is very high compared to other departments. However, as of June 2022, the department has only obligated 34.8% of the allotment for the year. What explains these low obligations? That's one question. The second question is, in terms of disbursement, the agency's disbursement rate averaged 69%. But for the first half of the year, DOH has only disbursed 24.2% of its allotted funds. Please explain this. Number 3, by raw amounts, 156.35 billion of DOH current allotment has not been obligated. 99.5 billion of these are in maintenance and other operating expenditures. Can the department provide a detailed list of expenditures that it has done to obligate this? Number 4, according to NEP, the DOH is projected to receive an additional of 7.36 billion, representing a 4% increase. Can the department provide an itemization and the geographical breakdown of these additional funds to be allocated? And number 5, the total projected budget of DOH according to NEP will be over 191.2 billion. Of this amount, nearly 24 billion will be spent on capital outlays. Can you please provide the itemization and geographical breakdown of the department's planned expenditures on capital outlay? Again po, gusto ko po ulitin, as of December 31, 2021, the DOH failed to implement 86 of the Commission on Audit's 168 recommendation from the previous years. The USEC has also received an adverse opinion by COA due to the misstatements and the agency's failure to make the necessary correction. Pakisabit na lang po to this representation and to the chair. Maraming salamat po.
Thank you very much. The response of the DOH will be submitted. Can we now proceed to the next interpellator, the Honorable Joseph Villago, also a Vice Chair.
Thank you very much, Madam Chair. Magandang hapon po sa ating pong IC Secretary at sa buong pamilya po ng Department of Health. My first question is about the budget presentation. Sa slide 6, wherein nakita po natin dito na PhilHealth lang po talaga ang nag-increase ng budget and all attached agencies are nag-decrease. Ano? So may I ask, paano kayo makaka-apekto ang pag-decrease ng budget nito, especially sa mga hospitals like our hospital in the province of Nueva Ecija, which is the Paulino Garcia Hospital?
Oo. Kaya na, yung sinabi niya yan, kitang arrows.
Madam Chair. Madam Chair,
please proceed.
Yes, good afternoon, Honorable Congressman Villago. As to the decrease in the budget, especially for the operations of our hospital, we're now getting the Paulino Garcia here. So ang amin pong proposal for Paulino Garcia was around 901 million. And what was provided for in the NEP was just 309 million. So usually kapag nagbibigay po tayo ng mga ganitong proposals, part of the proposal or most of the budget na requirement po dito sa proposal would be for the operations of our hospitals. Specifically regarding the funds that are used for the services being provided, hiring of our healthcare workers within hospitals, and also, of course, continuity of these highly technical services that they provide. Halimbawa po, meron silang mga cancer or the other specialties that had been assigned to their centers. So, ang implikasyon po niyan, yun pong ating budget for MOE mostly would be affected by this. So, yun po, Honorable Congressman Villago.
Madam Chair, medyo nakakatakot ata pag gano'n na magkakaroon ng epekto sa services ng health, no? Especially halos lahat ng bayan ng buong Nueva Ecija ay umaasa sa Paulino Garcia Hospital, since karamihan hospital around around that national hospital, puro level 1 hospital, no? So practically level 1 halos emergency lang yung na-accommodate nila. Pag medyo critical lang konti, takbuhan na kagad namin sa Paulino Garcia Hospital. I hope na sana sa tulong na ng ating committee, madagdagan yung budget ng mga hospitals like Paulino Garcia Hospital. Next, Madam Chair. Sa slide 23, yung budget po sa procurement of commodities for diagnosis, treatment, and control of infectious disease, nag-decrease din mo ito, no? From 10.13 billion to 5.484 billion. So how will this affect the health of our Filipino people?
Yes, Madam Chair and Honorable Congressman Villago. First, just to get to provide response dun po sa Paulino Garcia. Kung atin pong nakita yung budget na we were not given the entire amount that we have requested, Our hospitals naman have their income, have their reimbursements from PhilHealth, have other forms of subsidies coming from the national government, the MAIP. So that is not going to affect any of the services and disrupt the services. Yun lang, syempre, pag may additional amount ka, they can further expand and also maybe do some form of innovation sa hospital. The second one, yun pong sa budget ng prevention and control of communicable diseases. Opo, we affirm na talagang bumaba po because purposively, tinanggalan po namin ng budget because we are not going to procure anymore PPEs and other commodities for the COVID-19 response like gene expert cartridges. Kasi sufficient po ang stocks natin until maybe the first or second quarter of next year. Kaya po siya bumaba. But this doesn't affect our priority programs for infectious diseases. Nandun pa rin ho ang budget for TB, HIV, rabies, at iba pa ho natin programa for infectious diseases.
Thank you very much, Madam Chair. The next one is for slide 25. It's just a manifestation that I join Representative Suarez na itong health promotion programs na nag-increase yung budget from 529 million naging 2.14 billion. I think tama si Representative Suarez na mukhang mas marami pang kailangan ang ating department rather than this program. No, it's just a manifestation, Madam Chair. And then the last question, the second to the last question, Madam Chair, is from slide 26. The budget for prevention and control of non-communicable diseases na nag-increase po from 1.38 billion in 2022 GA to 2.1 billion in 2023 net. There is a provision of mental health commodities to at least 213 access sites. May I know, Madam Chair, where are these access sites? What types of mental health commodities are to be provided, Madam Chair?
Yes, Madam Chair, if I may refer the question to Undersecretary Beverly Ho.
ASEC Beverly Ho is recognized.
Thank you, Chair. For the mental health access sites, sorry, sir. So we have more than 200 mental health access sites that provide our medicines. Our medicines are approximately 250 types of mental health medications covering around 10 diseases po.
What are the other projects, programs, and interventions of the DOH to cater to the needs of the Filipinos for their mental health, especially in rural areas like in my district?
Okay. Sir, the one that you are pertaining to, the budget for health promotion includes interventions for mental health. No, so the health promotive parts of mental health interventions are lodged under the health promotion program budget, while the medicines are lodged under the non-communicable disease budget. So, for example, the activities that are being done under the health promotion for mental health would include mental health in schools. At least now in our pilot implementation, 9 LGUs with last mile schools, meaning these are children grade 5 to 6 who are in GIDA areas for DepEd schools. Second would be mental health programs for health workers. So we have now implemented our nudges. So it's really helping health workers to cope with the stress of having to take care of patients during COVID. So we have now scaled up the program to 20 government hospitals. And part of the budget for next year is to scale this up to 100 government hospitals. No? Pero may mag-alaga din naman sa health workers natin. The other intervention that we have is for mental health and community. So creating networks within the local community in order to support mental health referral. So we also have, this is now in place in 33 of our province and citywide health systems which have received grants for this year. So next year, we hope to scale this up to more than 50 province and citywide health systems. That's why we need the grant under the health promotion line item. Finally, we have 8 call centers all over the country. The first one being the National Center for Mental Health Suicide Helpline. But we have been able to scale this up now in all our regions already. Thank you, sir.
Maraming salamat, Madam Chair. And my last question is actually not a question, but more of a request. No, I wrote a letter to the Department of Health for the realignment of the budget for the expansion, supposed to be the expansion of hospital ng San Jose, amounting to 10 million. Since the local government nag-loan po sila for next year for the expansion, which is more than around 50 million. So practically yung 10 million might affect the expansion. Kaya binalik po sa department yung budget. And my letter is to realign that 10 million budget from Hospital ng San Jose to be a super RSU in the municipality of Llanera. I hope na hindi sana mawala ito dahil sayang din naman it's a 2022 budget po yun, Madam Chair.
Yeah, can ASEC Beverly comment on that?
Madam Chair, if we may recognize Director Nene Gorgolon, ma'am.
Okay, Director Gorgolon is recognized.
Yeah, Madam Chair, Honorable Vilago, we have received your letter and we already coordinated with the region. So we will just follow up on the action, but it can be done, sir. Thank you very much.
Madam Chair, maraming salamat po sa buong family ng Department of Health. Magandang hapon po.
Thank you very much, Kong Vilago. Very quickly before we go to the next interpellator, ASEC Bev, you mentioned earlier that you have 250 different medicines for mental health. Did we hear you right? You mentioned 250 medicines.
It's 25. Sorry po. 25.
What was the 250?
Sorry, ma'am. The 250 was supposed to be the access sites. 250
access sites with 95 different mental health medications.
Sorry, ma'am, I got it wrong. 362 access sites, 25 medicines po.
Teka ha.
So it's not 20.
I'm sorry,
not 250. Sorry.
Yeah, I'm sorry, but you're saying that you have 362 access sites.
Yes, ma'am, for mental health.
Because in the secretary's presentation, it mentions 213 access sites. Pasensya na ha, we just want to be definite because it's very difficult to be releasing figures tapos hindi ngayon ma-support, kami yung hahanapan.
Yes, ma'am. This is the update that has been
where are we? 362 access sites
and 25 medicines. 25.
What was the 95 earlier?
Ma'am, I didn't say any 95 po.
So it's 25 different medications for 362 access sites.
Yes po.
So the 213 access sites given by the secretary is wrong. Kasi yan ang sinubmit nyo eh. Yan ang nasa budget proposal nyo. It says provision of mental health commodities in 213 access sites.
Ma'am, we will just submit the details na lang, but I think this is the updated one that we have.
So if we may be allowed to suggest, we have to be firm in the figures that you're submitting because that's very important. Kaya kami nagtaka dun sa 250 medicines and you can see that everybody was surprised because if you have 500 million pesos and you have 250 medicines, that translates to 2 million per medicine. Ang mabibili mo nun konting-konti, you will not be making an impact on the mental health of our patients. And while we do laud your, and maybe the secretary can look into this, it's really very good to look at the mental health profile of our health workers. But adding 100 sites in hospitals and considering the reduction of the load among COVID patients, because most are already outpatients, maybe you can balance, because the bulk of the out-of-pocket expenditures of mental health patients lies on the maintenance medications of our schizophrenic patients. Napakabigat kasi we have a lot of professionals na nagkaroon ng mental health problem. Yung gastusin nila sa kanilang maintenance, yan ang dapat tumbukin ng DOH. So the basic way that you can make a difference is by subsidizing their maintenance medications. Hindi yan padamihan ng sites or padamihan ng gamot. It's the number of patients that you are giving maintenance medications. Kasi without the we all know that most of the mental health patients, they have that on an annual basis. Parang lifetime na nila yan na maintenance. Maybe the secretary can review this. Yes, Secretary Rosette.
Yes, Madam Chair. Yes po, we take note of your recommendation. We'll try to review this and we understand that it's not the number of access sites, but how much we subsidize for each individual afflicted by mental health conditions. So we'll review.
And the common medications, please, especially for schizophrenic patients. Kasi yung kanilang gastusin buwan-buwan, pag hindi natin na-address yan at kukuha pa tayo ng mga bagong innovations, let's focus first on the basic problems that we have. And last comment, for the cancer commodities, this was actually asked by the Honorable Villago. Our observation here, and I believe the DOH family affirmed this during our virtual briefing, the cancer commodities are being sent to hospitals. Unfortunately, the reduction in out-of-pocket expenditure is not happening because PhilHealth is refunding this, or the hospital will charge the patient. Will it be possible to have proper accountability that these medicines be propositioned in centers for health development or regional offices para yung pasyente, pag kumuha siya doon, alam niyang libre. At yung hospital, hindi niya pwedeng maibenta ulit doon. Moving forward, may we now recognize the Honorable Jason Almonte for his interpellation.
Thank you, Madam Chair. To the DOH family, mayong hapon and good afternoon, everybody. First, it has been mentioned that there's certain parameters in distribution of the budget of the HREP. What particular average amount would be equitable to all the districts on how what's the acceptable amount for the whole district that's an average that acceptable to us?
Madam Chair, and good afternoon, Honorable Congressman. It is not really, it's not going to be equivalent amounts for each of the districts. It depends on the needs and it depends on the alignment to the health facility development plan. So I'll just turn it over to Director Nene on how we allocate specific investments coming from HREP for each of our districts. Madam Chair, if Director Nene can be recognized.
Director Gorgolon is recognized.
Yeah. Madam Chair, and good afternoon to all. Actually, we have this allocation parameter that we are trying to see. So it's not really the amount as our OIC Secretary is mentioning. We have this availment guidelines in particular. So we are conveying this to all the regions that we have to complete all the existing incomplete project. Second is allocation for improvement of Apex Hospital and Specialty Center. We also have to consider the COVID response. So this is one parameter. But at the same time, given the, again, Mandana's ruling, we have to consider the national allocation framework. So there's no specific amount that is appropriated for congressional district, but it's based on the need based on this alignment of as to Philippine Health Development Plan, alignment to the Mandana's ruling, and alignment to our availment guidelines of the Health Facilities Enhancement Program po. Thank you very much.
My it according to need, according to capacity on local governments and everybody. So need it would it mean the capacity of the entire province of each LGU?
So the capacity of each LGU based on the national allocation framework. So we have category for its provinces and municipalities and cities po.
So the poverty incident also would be in a great consideration.
Yes, sir.
In the area.
Yes, sir.
My district belongs to the province who have the highest poverty incident in the region. And upon review, 10 million, only 10 million has been allocated to the district, wherein the district is the capital of the province, and the province is maintaining like 6 hospitals. So we need all the help. So
Sir, we will just review on your province because as part of the, as we have this categorization, your province is low capacity and high gap. So we will review your allocation po. Salamat po.
So, Director, Madam Chair, thank you for the opportunity. So at least my representation has been heard that we really need your help. And the province and the district needs your help. And I hope to review the guidelines. I hope the first thing, because I think on your program, on your what you call this qualifications, my province and my district should be #1 in consideration. So I hope the next time around, mapakinggan yung kailangan namin on the district and the whole entire province. Madam Chair, that's all.
Yes, sir. Thank you very much.
The Honorable Fridge Biron. We now proceed to our co-chair, the Honorable Lucille Nava.
Good afternoon, OIC Secretary and the DOH family. And my question is for PhilHealth. I would just like to ask regarding the PhilHealth coverage for the OPD hemodialysis sessions. Okay, you have mentioned that you are already extending the coverage from 90 sessions to 156 sessions. And I would just like to clarify, isn't it that there was like a PhilHealth circular before, like on 2020 or 2021, where you already increased the sessions to 144 from 90? Is that right? So basically, you would only be increasing the number of sessions from 144 to 156 per year. Is that right?
Madam Chairperson, Honorable Representative Nava, for this year, we increased the hemodialysis sessions to 144. But PhilHealth is developing a package that will increase the same for 156 sessions per year. Honorable. We are developing the package. Hopefully, we can implement the same, the 156 sessions per year next year. But for this year,
it's still 144.
Yes.
So am I right where you're basing this on the fact that these patients would undergo hemodialysis 3 times a week for a year, right?
That's correct. Madam Chairperson.
And it's still the total amount for the whole of their hemodialysis sessions for the whole year is 374,000 per patient. Is that right?
Yes, Madam Chairperson.
Okay. So what was the reason for the slight increase again for the 156 sessions.
Madam Chairperson, Honorable Representative, now it's just a matter of computation. Our policy sector has another way of determining the needed, the ideal number of hemodialysis session needed for each patient, and they have determined that what's needed is actually 156 hemodialysis sessions for a given year, and it is still being developed because there is a budgetary implication for this, Madam Chairperson, Honorable Representative Dava.
Yes, yes, all right. So, because my concern here is, basing on the 144 sessions, not all of these patients undergo 3 times a week for the whole year of dialysis. Some of them undergo lower than that, isn't it? Once per week or twice per week. So with the amount of 274,000 for a year for each patient, I would presume that you're allocating like 2,600 per session per patient. Is that right? Okay. So are you aware that not all indigent patients are accommodated in government hospitals for hemodialysis? And what they do is they go to private hospitals, they have the PhilHealth coverage. However, may out-of-pocket pa rin because they have to pay for the PF of the doctor, they have to pay for the dialyzer, for the erythropoietin, for the IV access to the fistula and IV access to the jugular. And aside from that, parang na-defeat natin yung purpose na wala talagang dapat babayaran ang mga patients natin because they could not be accommodated in government hospitals. So my request is, hindi po ba natin pwedeng i-revisit yung case rate on the dialysis per session, to which na kung pwede lamang, because as I've said, not all of them undergo 3 times a week dialysis for the whole year. So they will not finish the 374,000. Some of them will not finish the 374,000 per year. So, and the excess budget for that will not be already carried over the next year. Is that right? So, pwede po bang i-revisit natin kung baka pwede naman yung sa mga patients na to na will not be that frequent na nag-hemodialysis, i-cover na lang yung other expenses, like i-karga na lang natin yung para sa erythropoietin, para sa dialyzers and all, so that if this indigent patients go to private hospitals for dialysis, they will not have this big expense eventually.
Madam Chairperson, Honorable Representative Nava, yes, we will consider the proposal of the Honorable Representative. To reiterate, we are developing a package for year 2023. We might implement it at 156 sessions for next year. And yes, we will consider the proposal of our Honorable Representative Nava. Thank you very much.
Okay, so when was the last time that you have revisited the actual rates for the hemodialysis? Because I would presume that parang 2016 ganun na yung per session eh, more or less until now.
Thank you very much, Honorable Representative Nava. At present, we are studying the costing of the hemodialysis sessions. Again, the reason is that we are planning to increase the sessions to 156 sessions for next year. And we are again considering all these factors. They have been brought to us by other groups. And again, we are in the study of increasing and improving the costing for the hemodialysis sessions. We are considering all these factors. Honorable
Thank you so much for that, because I would like to suggest sana na if ever naman i-increase nyo na yung amount per session covering all those things that I have said, because if ito total mo yung from the access site to the fistula, the erythropoietin, and every 8 session they change dialyzers, mostly mga 3,000 yon per patient. So, kung pwede pala i-incorporate na lang doon sa ano nyo para wala nang babayaran yung mga indigent patients who go to private hospitals for dialysis. Okay lang doon yung indigent na pumupunta sa government hospitals that were accommodated because all these extra expenses will be covered by malasakit. However, in private hospitals, so talagang pumupunta naman sila of course to us or to other na pwedeng mag-fund ng kanilang mga excess na expenses for dialysis. So, ang suggestion ko when you do this re-evaluation of the case rates of your ACRs, please try to include sana for these patients, hemodialysis patients, yung actual expenses. And if hindi nyo magagawa, I would also like to request DOH, if ever you could please increase naman yung facilities ninyo sa dialysis on this government hospital so that we could accommodate all the indigents. Because as I've noticed, napupuno po ang ating government hospitals, kaya yun yung ang reason kung bakit pumupunta na lang sila sa private hospitals. Because they would need this really life-saving to sa kanila. So I hope that you could consider this, Secretary, and also to PhilHealth. And I will be monitoring and asking eventually if what would be the progress of this, okay, in order to help these patients. Na I don't know if you already have the census of how many patients are undergoing hemodialysis in the whole Philippines. And I know you're capacitating also the local the DOH hospitals, the local hospitals or LG hospitals regarding kung pwede silang maglagay na lang ng dialysis centers nila in their own hospitals. Secretary, are you also having funds, giving funds to local hospitals for establishment of their own dialysis centers?
Yes, Madam Chair and Honorable Congresswoman Nava. Yes, actually, this is part of the directions or directives of the President. We have discussed this with him last week and he's very supportive. So ngayon po, kung ano po yung funds natin for these equipments and facilities, kasama po iyan. Ang isa lang po kasi talagang medyo limitation natin. Even though we have our hemodialysis units already, but local governments cannot provide that appropriate space. You know, ma'am, we need a space.
Yes, I'm aware of that.
Opo. We need also the component for healthcare workers, yun po mga ganon. So, yun po ang hindi natin agad nagagawa as the counterpart. But in terms of buying equipments, providing these hemodialysis units, we are part of that. That is part of our direction, Honorable Congresswoman.
Okay, it's good to hear. So actually, that's our plan also in our local hospital, in our provincial hospital. And I think, as I've said, I'll just be monitoring regarding that. Thank you so much for the answer. And lastly, I would just like to thank DOH for the support to my Dr. Catalino Gallego Nava Provincial Hospital in Guimaras for helping us in all our necessary infra. But, well, I would just like to say na lang dito rather than sa proper USEC in charge, we would be very happy sana kung madagdagan yung aming budget for the HFEP para sa expansion namin ng Dr. Catalino Gallego Nava Provincial Hospital. And I have a very good positive response from USEC David. Thank you so much and I hope in the future baka madagdagan po para ma-upgrade naman namin po ang aming local provincial hospital. So thank you so much, Secretary. Thank you so much, sir. Good afternoon.
Thank you, Congresswoman Lucille Nava. Next to interpellate is our Honorable Deputy Speaker, Raymond Democrito Mendoza.
Thank you, Madam Chair. Just very quickly, just like to manifest, when I was during the pandemic, I'd like to thank you, each and everyone, especially the DOH family, where the OFWs were, at the time, very interesting times. And from the rank of somewhere, I think, I don't remember the ranking anymore, but it's Baba 10. And then through your intercession, it was made the rank number 1 because we need OFWs at the time to work, most especially during pandemic. So thank you. Next, if I remember it right, yung mga nurses, I understand from the chair, we now have they have 2 years to stay here and serve the country, or at that time there was a quota of, if I remember it right, 6,500 per year. Is it still in force o wala na? Tinanggal na yung quota sa nurses? Very quickly, ma'am.
Yes, Madam Chair, and good afternoon, Honorable Congressman. Just recently, the Department of Labor and Employment already lifted the cap dun po sa sending our healthcare workers, specifically nurses, to
That's good news. So wala ng quota. And because there's shortage now. And lastly, I'm just gonna touch because I'm labor, yung unfilled positions. Although kanina it was being asked, I just like it's 14,000, if I believe 14,000 here, and you actually increase 14,000 to 41. When I had a meeting with the DBM, she actually also said that there are 175,000 unfilled positions. Of course, we have to, let's say, revisit the number and make sure that those are matched. But for 14,000, I hope, ma'am, that at 14,000, there must be a firm commitment. At least 6,000 to 7,000 to fill these positions. How can you now best serve if these positions are not filled? And usually, if it's not filled, it's usually filled by labor-only contracting or contractuals, not regular employees. Sayang naman nandyan. So I believe that di baka sana mag-match, hindi naman 14,000, pero at least may 10,000. The DSWD has a firm commitment to Secretary Tulfo na 700 daw. They'll try to commit, but that's 700. Dito lang sa DOH is medyo dami. Even also from Dole. So your thoughts on that, ma'am?
Madam Chair and Honorable Congressman, yes, we commit to hiring. Actually, that's part of the goal of the department, that we will have more of these plantilled positions, so that more the accountability will be there instead of having JOs. But right now, there is really this slow uptake of some of the professions. Mababa po talaga yung uptake. Doon po kahit mag-post kami, hindi po din ganun kadami mag-apply. Especially in other areas of the country. So right now we are planning po on how we can be able to manage rational, where we can merge some of the items to produce higher level items para po makapag-apply din yung ibang mga professions sa amin. So we will be focusing on this, sir, and definitely we commit that we will be trying to fill up some of the positions. It might not be feasible that we fill it up lahat po nitong 14,000 in maybe
This is 40. I'm sorry, ma'am. There's a number here, 21,000 or 14,000, somewhere there. Can you just revalidate? Thank you.
Yes, Madam Chair and Honorable Congressman, we have 21,000 unfilled plantilla. This is about 21% out of the 100%. So ito po yung unfilled namin na positions for our DOH hospitals, our centers for health development, our treatment and rehabilitation centers, and attached agencies.
Madam Chair, if I may be allowed to interject. During the meetings we had with DBM, what was given to us as a reason was the matching. Marami raw yung unfilled position because many of the hospitals, yung what they call the authorized position, is not already answerable to the needs of either the hospital or the CHDs. Ibig sabihin, kunyari itong hospital, meron kang mga position na naka-align dyan, pero ang kailangan nila iba. So I believe the solution here is to align. We are insisting on certain authorized positions na napag-iwanan na ng panahon. So if the Honorable Deputy Speaker can actually look into this together, this will be a very good advocacy for the labor. Kasi ang nangyayari, ito yung mga authorized position, para bang nag-obsolete na siya. So they can't fill it up because they need other positions and they want those positions. Yun, yung scrap and build. And the Deputy Speaker here was very much entrenched into labor can actually look into this. Kasi dapat kasi scrap yung ibang position, mag-create ng mga bagong position. But ang nangyayari, paulit-ulit lang na we are still insisting on some positions that have already earned obsolescence. And that is the situation. Like example, FDA, ang dami nilang kailangang positions. Pero wala dun eh, kailangan i-create yun. The other hospitals, they need a lot of specialists. Even the census, the CHDs. So siguro ito ang kailangan para ma-fill up mo. Andun kasi yung ito ang andyan dyan na authorized, ito naman ang kailangan. Can the Secretary of Health confirm this?
Yes, Madam Chair and Honorable Congressman, I confirm about regarding this issue right now. And actually, not just the technical side of that, but also looking at the specific laws that have been passed and the creation of new offices, wherein years have passed already. And specific lang po example, ang amin pong finance service unit, Madam Chair, yun pong budget namin noong 2010, so different from our budget now. But still, our cadre in our finance service, ganun pa rin kakunti, kaya hirap na hirap po kami. So I agree with you and I confirm and hopefully we can be assisted also by the House of Representatives, Honorable Congressman. Thank you po.
Ma'am, thank you very much for that. So it's a commitment na talagang yung 21. It doesn't have to be 21. The UCP is not only private workers but also public workers. In fact, I have a bill that the Republic of the Philippines, in compliance with CA 151, Public Sector Unionism, to give most of the workers more right. Kasi as of now, hanggang ano na kayo CNA, ngayon CBA, the first country in Asia to sign that. So that bill actually passed in the last Congress, hindi lang na counterpart sa Senado. But what I'm trying to say, sayang if you look at the contractuals of Congress, not in Congress, in government, by the way, government is number one violator lang. Hindi to directed sa iyo, ma'am. In fact, I thank you for the response. It's about 700 of labor contracting, contractual. Now, I've heard nurses alone in the national of the DOH. Is it correct that it's ranging now 30,000 or 32,000 per month? Is that correct?
Yes, that's correct.
Yes, that's good news because as chair dati of OFW, they don't leave because of necessity. By choice na. So, anuin mo yung mga Emirates, Qatar, at saka mga big airlines na, akala mo turista, hindi. Nagkakakot yan ng mga trabahante. Diba? So, with that low-lying fruits, I agree with Kong Garin. Thank you, ma'am, for pointing it out. And of course, Kong Marikina. Yung wife ni Kimbo, Congressman Kimbo dati. Patay na ako dyan. So, nandiyan chairwoman natin. I hope, yes, of course, Congresswoman Stella, our expert, na bigyan pansin because this is actually low-hanging fruits. Sorry lang kung kulit, but this has been a problem of all the departments. I was once an assistant secretary of DNR. I had once at one time a secretary na 22 years, a pangalan Olive, ang may category that does not exist in the books, permanent casual, because hindi siya makapasa sa CSE. Although I have a bill for that, it's another story. But my point is, I've seen yung problema talaga. So, Madam Chair, I end my questioning and I hope and I pray that there is a strong commitment from DOH. Thank you. Thank you, Madam Chair.
Thank you very much, Deputy Speaker Raymond Mendoza. The next to interpolate is, of course, the look-alike of my husband, yung hinahanap niyo pa kanina. Deputy Majority Leader Richard Gomez.
Thank you, Madam Chairman. A while ago, when I first came in, there were a lot of people here, so I decided to go straight to the USECs and the directors. No? So a lot of my parochial concerns have been answered already through USEC Dumama, Director Bacarisas, and the private secretary of the good secretary. But just to reiterate, about 2 weeks ago when the regional directors were here, I brought up our concern regarding the waste treatment housing for the autoclave for infectious waste. Earlier, during my first term as mayor, we requested an autoclave from the Department of Health and binigyan kami ng specs on the kind of housing that we need to build. So hindi dumating on my second term as mayor, dumating na daw yung autoclave pero ibang autoclave na yung dumating. So DOH requested us to put up another housing for the autoclave. So I'm hoping that by this time may choices na, dalawa na yung housing ng autoclave namin. I hope that that concern can be taken up. And one of our, of course, the request of most of the congressmen are the super health centers, of which I've been communicating with Yusek Dumama. Madam Chairman, my concerns are very small. No? I'd like to thank you for this time. I attended 3 committees already, but thank you. I'd like to tell the good secretary that in spite of the thousands of concerns that you have in your department, trust that we are here to support your department and your programs, no? And we do not want you to fail. We want you to succeed. So we're just here trying to see on how your department is coming along, and the Congress, people in Congress, are here to wholeheartedly support your beautiful programs because we want a healthy citizenry. Thank you so much, Madam Secretary. Thank you, Madam Chairman.
Thank you very much, Congressman Gomez. Next to interpellate is the Honorable Ompong Ordanes. Next, for the majority, the Honorable Eric Martinez. Eric Martinez Gomez.
Thank you, Madam Chair. Kita nyo naman, magkasunod pa talaga kami, ha? Gomez, then Gomez 2. Madam Secretary, magandang hapon po. I'll go straight to the point. Our district, the 2nd District of Valenzuela City, is home to the Valenzuela Medical Center, located in Barangay Carwatan. Super health centers could wait for us. No needs, kahit zero kami ngayong darating na taon. Health centers could wait for us, kahit zero ang pondo namin sa susunod na taon. But what couldn't wait is Valenzuela Medical Center. Ngayon pong taong ito, after 6 years, nabigyan ng preliminary pondo na 200+ million. Dahil na rin doon sa batas na increasing the bed capacity from 200 to a 500 bed capacity hospital. Valenzuela City is the northernmost city of the National Capital Region. It doesn't only cater to the 700,000 plus population of Valenzuela, but part of Malabon, part of Nabotas, part of Caloocan, and the southernmost Bulacan municipalities, Santa Maria, Marilao, and Meycauayan, including Meycauayan, especially Ubando. So, ang question ko po ay, may kasunod po bang programa pa yung ospital namin na pondo upang masatisfy yung 500 bed capacity hospital ng Valenzuela Medical Center? As a matter of history po, it's been 20 years since napondohan ngayong taong ito. So baka wag naman sana umabot ng susunod na 20 years para may pondo ulit. And it took me 6 years para mapondohan. So last term ko na po ngayon, hindi ko naabutin kung 6 years pa ulit kami mag-iintay. I just want an update, Secretary.
Yes, Madam Chair and Honorable Congressman. Yes, una-una po, the commitment is there because it's part of the DOH hospital na list natin sa Metro Manila. So nandyan po yung ating strategic focus for that. We have an additional 100 million for equipment for NEP 2023 for Valenzuela Medical Center, aside from the infrastructure component, Honorable Congressman.
So we have 100 million for 2023. How about the infrastructure, ma'am, for 2023?
Yun pong infrastructure is we are still assessing, Honorable Congressman, because what we have allotted for NEP 2023 for Valenzuela Medical Center is 100 million for equipment. So we will be providing you with further advice if based on the assessment currently being done, because we're trying to modify the list. We'll give it to you.
I'll yield to that, Madam Secretary. How about the 100 million? Is that enough? The hospital equipments of 100 million? Kasi I receive a letter from Valmed and they're requesting around 600 million for that new building once it is finished. Ano po ang naging decision why 100 million?
Madam Chair, can I refer the question to Director Nene Gorgolon?
Director Gorgolon is recognized.
Madam Chair, Your Honor, actually for 2022, you have an ongoing 180 million. So that's why the proposal for 2023 is more on the equipment. Because we still have to look into the accomplishment of this ongoing project before we can add additional funding po.
Again, ma'am, hindi ko narinig yung earlier part na sinabi niyo.
For 2022 GAA po, you have 180 million for Valenzuela ongoing project.
Ano po yun, yung infrastructure?
Infrastructure po.
Yung hospital equipment po yung tanong ko. 600 million yung request nila, 100 million lang yung nakalagay for 2023.
Yung hospital equipment po, before we can provide allocation for hospital equipment, we have to see to it na tapos na po yung housing. Kasi mamaya po, pagka nabigyan ng equipment, hindi naman magiging functional yung equipment kasi hindi pa tapos yung infrastructure. But we will coordinate with Valenzuela po. Thank you very much.
So malinaw po yun na once matapos natin yung building and 100 million for the equipment is not enough, merong supplementary budget for that.
Yes, sir. Actually, we advise also Valenzuela to apply for Mayowa po para magiging functional talaga yung building and with corresponding equipment po. Salamat po.
Opo. I just would like this on record and manifest na other services nyo po, ang pinakamahalaga talaga sa distrito ko yung Valenzuela Medical Center sa Karawatan. And that would be all my question, Madam Chair. And just would like to tell the entire DOH family, and this is coming from the heart, you fought a battle like no other. That pandemic, the last 2 years, you made those difficult decisions, unpopular to some. But you did it. You are truly our heroes, and we acknowledge you for that. Salamat, Madam Chair.
The next interpellate is the Honorable Ando Owaminal. From the majority, the Honorable Peter Miguel. From the majority.
Madam Chair, salamat po. Magandang hapon po sa lahat. At lalong-lalo na sa mga kasama natin sa trabahong pangkalusugan, DOH. First, I'd like to, there was a memorandum, department order, dated January 4, 2021, from the Office of the Secretary that is designating some hospitals to serve as specialty centers. And there were several centers identified, 16 of which mahalaga. Pero Madam Secretary, Madam Chair, mukhang may nakalimutan kayo. Dapat 17 po yan. Yung ENT, head and neck surgery po ay isang napakalawak na specialty. It deals from congenital to even maxillofacial, bronchoesophageology, TMJ, sinusitis, and there are several subspecialties under ENT. Sa totoo lang po, there were several advancement in different areas from otology, rhinology, bronchoesophageology, allergology, not to mention facial plastic. Marami po. At it entails a lot of instruments. from surgical instrument sa ear, you need microscope that costs millions. Pag pumasok naman po sa baga, you need bronchoscopy sa pathology, millions. Marami po. Not to mention, we are part also of treating sleep disorders, snoring, dizziness, voice, cancer surgeries. Ang dami po. And if you will base sa top of burden of diseases as well as specialty needs, walang tatalo po sa ENT. Kanya nga po, ito pinaglalaban namin ngayon. By the way, I'm a diplomate as well as fellow of Philippine Society of Otorhinolaryngology and Head and Neck Surgery with our chairman of the Committee on Health, Dr. Gato. Kaya sana masama po. Dahil if you look at the emergence of new specialty clinics in ENT, nagsasama-sama po yung mga ENT because mahirap bumili ng gamit. And that's why yung ENT services ay mahal po. Paglinis pa lang ng tenga, it costs thousands of pesos per year precisely because of the instrumentation and many more. So ibig sabihin po, if we have these specialty clinics in all regions or every region has at least one, we can minimize the burden of our public, of our patients in a treatment for their ENT diseases. So I hope Madam Secretary, mabigyan ito ng pagtingin, immediate concern for our specialty po.
Madam Chair, please proceed. Thank you, Madam Chair. Good afternoon po, Honorable Congressman. Yes po, actually we have discussed this with Congressman Gato the other week, and we have committed to him that this will be part of our further discussions. Ito pong unang 16 na subspecialties are just the initial. So it doesn't preclude us from adding some more or further discussing this to include some of the other societies as well. So we commit to further studying this, Honorable Congressman, and we will be updating your office and the office of Congressman Gato regarding this matter.
Salamat po. Sana maisama siya kaagad in implementation of our Universal Healthcare Act. Mapunta naman po ako doon sa SOC Sergeant area. In my district, that's where new SOC Sergeant Hospital is located. I think it's a misnomer because it's not actually catering for the entire region. SOC Sergeant, by the way, for those who doesn't know, it means South Cotabato, North Cotabato, Sultan Kudarat, Sarangani Province, as well as General Santos City. At with the new geopolitical changes, wherein it used to have 5 cities, including Cotabato City, but because of BARM, Bangsamoro Autonomous Region of Muslim Mindanao, yung Cotabato City po, na kung saan nandiyan yung regional hospital, is now part of BARM. So that leaves us, in effect, that we don't have our own regional hospital. At yun po, simply put, we need an immediate blueprint, probably plans to have SOC Sergeant area, a regional hospital at the very least, for its role also as an apex or an end referral hospital facility sooner. Madam Secretary, can we hear any plans, immediate plans for that?
Yes, Madam Chair and Honorable Congressman. We have an allocation of 50 million for the NEP 2023, 50 million for the NEP 2023 for infrastructure for SOC Sergeant General Hospital. Also, we have 4 super health centers for the 2nd District of South Cotabato, wherein we have allocated 40 million for infrastructure and 8 million for equipment, Honorable Congressman.
Thank you. So thank you so much to hear that. It's just that what I'm asking is, do we have a future plan wherein converting this hospital as a national center, probably, just like the likes of SPMC, Southern Philippines Medical Center, since it's located in a right geographic area. The Cotabato Regional Center, in fact, it's not serving most of in the region because it was far off up north, while the Stock Sergeant Hospital right now is in the middle of the region. So I think to have efficient as well as effective delivery of healthcare services, we might as well consider this to build in the near future a bigger hospital as well as a complete hospital.
Yes, Madam Chair and Honorable Congressman, that's part of the directions of the department that we will further capacitate Stock Sergeant General Hospital as this provides access to our citizens in that part of the country. So yes po, we commit to that, furthering on the improvements in the coming years.
Salamat po. And lastly, my advocacy is to go to the mountains and deliver direct services, medical services. I've observed that previously we had this dental bus. We have mental bus distributed to each LGUs, and it's working well. Right now, I'm thinking if we can have the same type, but it's containing a laboratory, so that you can go to the mountains and have some laboratory workups. And another thing is same kind of a vehicle that would also cater minor surgeries for preventive and control of diseases. We can catch early form of cancers if we really go to the outskirts, to the remote areas to deliver these simple services. Madam Secretary?
Yes, Madam Chair and Honorable Congressman, that's part also of our priorities at this starting next year. Meron na ho tayong nag-umpisa na tayo. We call it the mobile vans. These are vans for healthy lifestyle wherein it goes around the communities delivering public health programs, and there are also laboratory tests that can be done. So meron na ho tayo numpisahan sa Region 8 which was partnered with our development partner. Some of the local governments have produced their own. Sila na po yung bumili at naggawa nung sa kanila, kaya meron din po. But right now, meron ho kaming effort that some of our development partners have committed for this mobile van. So ito po yung ating inaantay lang ngayon through this process para magkaroon po yung iba't ibang local governments. But while we await for that, hindi kailangang van, sir, sa Quezon City po, nag-hire sila ng mga jeep. Yung jeep na pampasahero, tapos umiikot po yung mga healthcare workers nila to those areas where there is poor access para lang mas maka-avail ng services po ang mga constituents nila.
Thank you to hear that, Madam Secretary. Salamat din po, Madam Chair. Salamat po.
Thank you very much. Thank you very much, Con. The next interpellate is the Honorable Ferj Biron.
Thank you, Madam Chair, and good afternoon to Secretary Vergere and the DOH family. First of all, this representation wishes to congratulate the Department of Health for all the efforts you had exerted during the difficult times. Madam Secretary, I think one of the concerns that I have is the procurement system of the Department of Health. I think we should learn from the lesson that we had with respect to the budget that you had provided the PSDBM. So may I know how many bids and awards committees do you have in the Department of Health?
DOH, please respond.
Yes, Madam Chair, if we can recognize Yusek Carol Taino to respond to the question.
Yusek Taino, please proceed.
Yeah, good afternoon, Madam Chair. Good afternoon, Congress. With regards to the central office bids and awards, we have 6 po.
6 you said?
6.
All right.
6 po.
Yeah, my question is, would this be enough, 6 bids and awards committees to handle the entire procurement of the department so that you don't have to worry about transferring your funds from the DOH to PSDBM or even to PITC or PPPI, because all agencies of government transferring monies to these procurement agencies would face problems like what we are experiencing right now with the Department of Education, where 2.3 billion was transferred, and it ended up buying overpriced computers.
Yes, Kong. At this point in time, I think the 6 committees of the Central Bids and Awards Committee is enough to cater for the procurement of the Department of Health.
So is it a commitment to this committee that no monies from the Department of Health beginning fiscal year 2023 should not be transferred to any other procurement agency? Yes. Is that a commitment of the Department of Health?
Yes, sir. We have committed not to transfer anywhere except for those items that are required to be procured through PSDBM. Like, for example, the common use supplies and equipments, and then the ICT. It's part of the GAA po, sir.
All right. Even recently, I think COA it came out with a report that even PPEs that were purchased by PSDBM were found to have not been registered or has not gone through FDA approval. So are these commodities still to be procured by PITs, by PSDBM, or can you be more specific, Yusek? Ano pang mga item ang ibigay ninyo? As you have said earlier, kaya naman pala ng 6 COBA. Bakit pa natin nililipat ang pera? Kasi the moment ilipat mo, you lose control of those funds and nagkakaproblema na tuloy.
Yes, sir. Actually, I have already wrote the PSDBM and the GPPB for the delisting of these PPEs po. So it's not included anymore as part of the common use supplies. And we are not procuring any more PPEs through PSDBM.
How about commodities procured by PPPI, the procurement arm of PITC for pharmaceutical products? Are you going to continue the program?
I think that's also part of the revisions that we should not also use the PPPI for our procuring arm.
Yeah, can you make that commitment, or is it kasi the way you talk, Yusek, parang we should not, what is the stand of the Department of Health? Kasi mas secure ninyo yung pera ninyo na binibigay ng Kongreso kung kayo mismo nag-handle ng sarili ninyong procurement. Kasi you said 6 COBA would be more than sufficient to handle your procurement. So, in other words, hindi naman kailangan na ilipat mo yung pera sa ibang ahensya ng gobyerno if only, those medicines. And besides, you're spending money for administrative costs. I think nagbabayad kayo, no? Ilang porsyento yan?
4%.
4%. So just imagine, millions of funds are being spent for administrative fees. So na kung pwede naman sa inyo, walang gastusin, you can stretch your budget considering na kulang na nga yung budget na nabibigay sa inyo, magbabayad pa kayo ng administrative fees.
Yes, sir. Actually, starting 2022, we did not transfer funds to PPPI or PITC, PSDBM, for that matter, because of the COA audit observation also. And as I've said, the 6 COBACs existing in the DOH procurement is enough to cater with all this procurement.
All right, that's good to hear, Yusek, that DOH will now, start securing purchases from your own COBAC. And apart from this, 6 committees, bids and awards committees in the central office, you have according to former secretary, she's coaching me, yeah, there are regional BACs, that are more than capable of undertaking bids in the respective regions. So we should utilize them. Kasi nakakaproblema tayo doon sa mga BAC ng ibang ahensya ng gobyerno. You lose control over your funds. So, okay. Moving on, Madam Secretary. I came from the private sector and I have my own set of experience. Ang problema sa DOH, hindi lang yung procurement. Ang problema, Madam Secretary, yung collection dyan. Can you please review the collection process? Kasi maraming supplier, hindi lang sa gamot, hindi lang sa medical equipment, other commodities. It takes the second coming of Christ for them to, to collect. And, in difficult times like during pandemic, hirap lahat. So kindly look into this, and, streamline the processes para naman hindi kawawa yung mga ating mga suppliers dyan. And next question, to Secretary, do you have sufficient warehouses ngayon? Kasi nakakaproblema din ang DOH sa mga warehouse. During the time of Secretary Obial, kaproblema doon, the warehousing is even done, in the warehouses of suppliers, not only for months but even years. So do you have enough budget for warehousing of the commodities procured by the DOH?
Yes, good afternoon po, Honorable Congressman Biron. Yes, we have warehouses currently. We have 3 leased warehouses ngayon. Tapos meron po tayong isang malaki ngayon sa Tala Hospital. Tapos we also have our warehouses in our different regional hospitals. Meron din ho kaming extra budget right now for our 2023 budget for the construction of warehouses in some parts of the country which are strategically located.
Oh, that's good to hear, Madam Secretary. I think for my last question, pwede pa? One question pa, former Secretary. All right. Yeah. As I was monitoring earlier, our Vice Chairperson, Stella Kimbo, asked the Secretary on the cost incurred by the department with respect to the 20 million doses of COVID vaccines, which expired. I don't know, Madam Chair, if that question was already responded to or
Yes,
answered.
they confirmed that earlier.
Yeah, but how much was incurred? How much? Magkano ang nawalang pera sa atin with this expired vaccine?
DOH, please respond.
Yes, Madam Chair and Honorable Congressman, if we're talking about around 20 million doses of these vaccines that were expired, we've estimated to have this estimated cost across all vaccines to be at 500 pesos. So 20 million multiplied by 500 pesos would be around more than 9 billion pesos.
Madam Secretary, so these 9 billion that expired were solely procured by the Department of Health?
Yes, Madam Chair and Honorable Congressman, no. The breakdown of the procured vaccines would be that for the national government procured, there were no expiries. For donations, it was around 6.24% of those expired were from donations. For local government, 22.35% coming from local government among this 20 billion and 40% coming from the private sector's procurement. Now, we'd like to also clarify, Honorable Congressman, that for all of those which have expired, this almost 20 million doses, there was this commitment coming from the COVAX facility that it will be replaced in total.
So they will be replaced by the respective suppliers?
No, it's through the COVAX facility, Honorable Congressman.
All right, so COVAX. So do we expect 100% replacement for these expired vaccines?
Well, the offer is there that they are going to replace all that will expire, both nationally procured and those procured by LGU and the private. But we only have requested currently an amount which is half of what has expired, because based from our forecast and computations, that would just be the amount that we will need until the end of the year.
For these expired vaccines, Secretary, what is the shelf life? Because we would want to know, where do we attribute this problem? Is it the shortened shelf life that is no longer eligible for extension of the product's shelf life, late procurement or late rollout of the booster program? Paano tayo nagkakaproblema dito, Secretary?
There had been a lot of factors, Honorable Congressman. If you remember, during the first time that we have started our vaccine deployment program, most of those that had been used by the national government for our population had been through donations. But at the same time, while we were receiving donations, the national government and also the private sector and the local government started with agreements to procure on their own. But their deliveries were delayed. It came around third quarter of the year. So most of the employees of these private sector companies, also from the local government, had been vaccinated already through the donations. So when their deliveries arrived, most of their beneficiaries were given already. But we issued out policy that advising them that they can already donate to specific local governments in order for them to consume the amounts that they have. Tapos bigla na lang po dire-diretso tayo na January, pagdating January, biglang bagsak po ang uptake ng ating mga bakuna. And that has been the major driver kung bakit hindi na rin po masyado nagamit ang vaccines. Aside from the fact na yung timing po ng pag-procure was not aligned with the deliveries po na pagdating.
All right. Thank you, Madam Secretary. Thank you, Madam Chair. I will reserve the other questions in the second round. Thank you.
Thank you, Rep. Ron. Next to interpellate is Representative Ria Vergara.
Thank you, Madam Chair. Good afternoon, Secretary Procurement and the DOH family. I just have one question. It's about the migration of nurses to other countries. And I'm quite worried that with the better job opportunities given to them, that we're not able to keep them here. In fact, I have a friend who runs a nursing home in America, and now you don't even have to be a nurse to get a work permit. Just a TESDA certification of caregiving for 3 months is already enough to get a work visa that can be converted into a green card. And my question is, other than increasing salaries of nurses in the Philippines, is there anything else the DOH is doing to stem this migration of our nurses and healthcare workers? We have doctors who are applying as nurses abroad, and I'm worried what will happen to our healthcare sector with the migration of all these healthcare workers to other countries that provide better benefits and salaries. Thank you, Madam Secretary.
Yes, Madam Chair, Honorable Congresswoman. Yes, ma'am. We've started discussing this, not just with DOH, but with the other sectors as well. I have personally discussed this with the Department of Bureau of Migrant Workers, sila Sectuts Ople po. Also, we've discussed it initially with Chair Popoy de Vera of CHED. So what we plan to do would be for us to purposively produce on our own. We need to have that specific production whereby each of our universities can produce a certain number, and we can already match as to the needs of the existing here in the country and the needs abroad. So kailangan lamang po more incentives pa rin for our healthcare workers here. So aside from the salary standardization and the increases that are being proposed, maybe professional development is part of this, no? Kung saan meron po silang career track and we offer scholarships to them as well as equivalency. Kasi ngayon meron yatang issue about those anong tawag sa kanila? Supervisors ng nurses na hindi pinapayagan. It has to have masters for them to be able to get into ito pong pagtuturo, no? Yung pong mga ganon. So we are trying to manage and discuss po with our counterparts in the other sector so that we can provide the needed solution to this issue that we have in migration of nurses po. And the recommendations coming from all of you would always be welcome.
Thank you, Madam Secretary. And I was like, think you mentioned Secretary Ople. I think it would be also prudent if we could have bilateral negotiations with countries that love to recruit our nurses, maybe government to government, that they have to pay our country a certain premium. That way that the funding that they provide will pave the way for paying for the tuition for the next set of healthcare workers that will be trained in our country. That way, these students who will be going to private schools will not be burdened with tuition fees because it will be funded by these governments that love to recruit nurses and healthcare workers from our country. Just a suggestion, Madam Secretary. Thank you very much. That's just my question. Thank you, Madam Chair.
Thank you, Rep. Vergara. Next to interpellate is Representative Ando Waminal. Representative Christian Onabia. Representative Bambi Emano.
Thank you, Madam Chair. Maayong hapon sa tanan. And let me start. I'll try to make it as brief as possible, Madam Chair. First is I actually was present during the organizational meeting on the Committee on Health, and I was the one who asked for the House Bill 11721, which was for the timeline for the Northeastern Misamis General Hospital. And sadly, I was given a timeline, daming kulang, tapos wala pang pirma. And actually, not even an amount was reflected. Can I get hopefully, Madam Chair, the comment of the Secretary?
Madam Secretary.
Madam Chair, magandang hapon po, Congressman. If guidelines for, if I may again have the question, apologies po, Honorable Congressman.
Oh, it will not be taken from my time, Madam Chair.
No, it will not.
Yeah.
Please repeat.
During the organizational meeting of the Committee on Health, I requested for the timeline of the bill, House Bill 11721, the creation of the Northeastern Misamis General Hospital. I was given, daming kulang, wala pang pirma po. Sorry, 5 minutes is too short, but I'll try to make it as fast as possible.
Yes, Madam Chair and Honorable Congressman, we have 32 medical specialists, 182 medical officers, 1,285 nurses, 323 medical technologists, 168 rad techs, 129 respiratory therapists, 25 pharmacists, 34 science research specialists, and the others, around 3,000 would be public healthcare workers.
Thank you, Madam Chair. So what will happen to the nurses that will be displaced?
Yes, Madam Chair. And
the Department of Health created a career path for them, told them already, because it would be very unfair, Madam Chair, that we hire them, we call them frontliners, and when the program ends, then they now have to apply for a work abroad, Madam Chair.
Madam Chair and Honorable Congressman, actually they are of priority to the department and our implementing units sa hiring, because we also have invested resources to all of them, because while they had been hired, they are also being given training and mentoring coming from our facility. So they have always been our priority. But some of them, of course, in reality, they would also like to transfer jobs and seek other opportunities. But most of them are being absorbed by our implementing units.
Because from what I've learned, most of them, DOH is hopefully hoping that they will be accepted with the local government units. But the problem is with the Mandana's case, I don't think that funds will be downloaded next year and the local government units will be able to afford their salaries and wages because you had given them higher salaries and wages, Madam Chair. But I will keep track of this, Madam Chair, hopefully until next year, so that we will also be able to help the medical professional and the people who we owe a lot during the pandemic, like all of you in the Department of Health. Let me go to another topic, Madam Chair. Yeah, I was able to ask Dr. Gorgolon to receive a request of mine, which was for the St. Paul Hospital in the municipality of Taguluan. It's like this, Madam Chair. This is the city of Cagayan de Oro. This is where Northern Mindanao Medical Center is. This is Taguluan, and this will be the new hospital that you will be building. And with the things that are going, I don't think that you'll be able to finish it in the next 2 or 3 years. So we have to improve Taguluan Hospital. So we will be able to decongest Northern Mindanao Medical Center. May I now know what happened to the request I made for the equipments for the St. Paul Hospital, which is an LGU-owned hospital of the municipality of Taguluan?
Madam Chair, if we may recognize Director Nene Gorgolon, please.
Madam Chair, Honorable Umano, we refer your request to the regional office for vetting, because before we can have a final approval on that, we need to ensure that we have the specific requirement for that particular request.
Okay. And will I be able to get a reply, hopefully, Madam Chair, before the plenary, if these were approved, these were not approved?
Yes, Your Honor, we will. We will collaborate with Director Lacuna po. Thank you very
and
much.
Hopefully, if you can answer it by tomorrow, better. Pero isang upuan na lang po, ma'am.
Yes, sir, I will text him.
Okay.
Papunta naman po siya. Siguro he is listening po. Thank you very much.
Okay, wonderful. And
your time's up.
No, not yet, Madam Chair.
Yeah, you just heard the bell.
Last. Anyway, I'll try to go to the second round. If not, I'll be joining you during the plenary to continue with the questions, Madam Chair. But before ending, Madam Chair, I again would like to thank and congratulate DOH, especially Secretary Verhiere. During the dark, you were the light. When everybody shied away from the media, you were there every day to explain to all the Filipinos, Juan and Juanas, regarding COVID, how to protect ourselves from COVID. For that, I salute you, ma'am, and hopefully you will be able to, if given opportunity to lead the Department of Health. You've been leading them well, and I believe that you will be able to lead them in the next 6 years. Thank you very much, Madam Chair, and mayong hapon.
Will you have yourself listed for round 2, Rep. Emano? Thank you. Next to interpolate is Representative Angela Garcia. Via Zoom. Are you around, ma'am?
Yes, thank you, Madam Chair and Secretary Vergere, all of our colleagues, and of course, DOH officials. Thank you for accommodating even at this late hour. Firstly, thank you, DOH family, for all the support and help to the province of Bataan. We truly appreciate Secretary Vergere's very active support. I only have three queries, if possible, Madam Chair. The first is directed to PhilHealth. As district representative and on behalf of the mayors of the province of Bataan, we would like to request reconsideration with regards the pending RT-PCR claims by of our DOH accredited hospital, Bataan General Hospital, not reimbursed by PhilHealth because BGH is now asking the LGUs to pay a total of 23 million for the RT-PCRs processing that we had during the pandemic. So there are various reasons why PhilHealth has denied the claims, but this representation would like to request reconsideration because, you know, at that time I was also a mayor then, and it was of utmost importance to do the swab, to do the contact tracing on time within 24 hours. And we really had to do a lot of the RT-PCR swab collections for the tests to be processed. But right now, we are being billed 23 million because of maybe some documentary discrepancies, and we would like to request reconsideration.
Any Santos.
Madam Chairperson, Honorable Representative Garcia, we will immediately look into the matter and coordinate with the region under which Bataan is covered. Madam Chairperson, Honorable Representative Garcia. Thank you very much.
Thank you very much, Madam Chair. The second query that I have is we are very familiar that persons who are differently abled, the sector is usually under DSWD, and learners with disabilities is under DepEd. But of course, we understand that their medical and physical needs must be addressed by DOH. There is a Republic Act 11650 where LGUs are mandated to open inclusive learning resource centers for our learners with disabilities. I would like to request if there is a program from DOH to extend assistance, especially the multidisciplinary team, the therapists, the medical diagnosis, the laboratories, the tests, so that we all know that early diagnosis and early intervention is the key, so that our children who have disabilities with their learnings would be able to be productive citizens, especially when they are adults already. The LG of Dinulupihan, through the provincial government of Bataan, is building the ILRC for Dinulupihan. And of course, we will still need equipment. But I think more important is the access to quality medical diagnosis and intervention. Madam Chair.
Madam Chair.
Madam Secretary.
Yes, good evening po, Honorable Congresswoman. There is, pwede naman po, no, that is very much possible by through coordination lang po with the regional office so that it can be formalized with a specific facility that will be referred to. Now, for the specific tests or laboratories that will be done, some of this can be covered by PhilHealth naman po through our outpatient package. So we just need to coordinate with the regional office. We'll ask our regional director to directly coordinate with you, Congresswoman, so that this can be made possible para po sa access ng ating mga pasyente.
Secretary, Madam Chair, thank you very much. It's just really now the access. They'll have to go out of the province. They'll have to go to the region or to Manila, or the therapists are outside of the province as well. So hopefully we can have a coordination and collaborative effort na at least regularly, because this is a whole of country approach, DOH, DSWD, and DepEd, especially for our learners with disabilities, Madam Chair. Thank you very much, Secretary. Third, it's just again, a request of, we already had submitted a request for, of course, the Mariveles Mental Wellness and General Hospital for the much needed expansion, and the request for our district hospital in Mariveles, which is hosted by the Freeport area of Bataan, to be converted into a tertiary DOH-run hospital as per the Republic Act of the Freeport area of Bataan. We've already submitted the request, and we hope that priority and budget allocation would be given. Thank you very much again, Madam Chair and Secretary, and to everyone still in the Nograles Hall.
Salamat, Rep. Garcia. Next to interpolate ko before I call Rep. Taza. Just an announcement. The meeting with the DOH RDs will be held tomorrow, September 13, and the day after, September 14, beginning at 9 a.m. And the venue will be at the Commission on Appointments Room, the 4th floor of the South Wing Annex. All right, so the same building, 4th floor. All right. Next, to interpolate from the minority, the chair recognizes Representative Paul Dazo.
Madam Chair, I was told someone from the majority, and I will yield to the majority.
All right, okay. In that case, I can go ahead. So while I interpolate, I yield the chair to Rep. Garin.
Please proceed, Senior Vice Chair.
My first question is for PhilHealth. So your budget is at 100.2 billion. And earlier you were asked how many beneficiaries would this cover. Ang sabi niya you would submit, but actually the slides of the secretary had that information. So the slide indicates that 12.75 million indigent beneficiaries, 8.021 senior citizens, and 99,800 individuals will be covered through the point of service. So can you confirm that? So that's about 20.87 million individuals.
Madam Chairperson, Honorable Representative Kimbo, yes, we confirm that, Madam. Thank you very much.
And how much is the premium per family?
Madam Chairperson, Honorable Representative Kimbo, the total premium is 79 million pesos.
No, per family, magkano po ang premium?
Per family for the NHTS, that is 3,000 per year. For the senior citizens, that's 5,000. For the financially incapable, that's 3,000. And for the PWDs unemployed, that's 2,400 per year. Madam Chairperson, Honorable Representative Kimbo.
And so if I multiply 12.75 by 8,000, 8.021 by 5,000, and 99,800 by 3,000, that will give me the 100.2 billion. Kasi kung isa straight, ang pagkakaalam ko kasi 4,800 lang yung premium per family. So if I multiply the 20.87 million by 4,800, that gives me exactly 100.2 billion.
Madam Chairperson, the total premium subsidy for indirect contributors is 79 billion pesos, while 21.1 billion pesos is requested to be covered under the share of the PCSO and PAGCOR. Madam Chairperson, Honorable Representative Kimbo.
Yes, the question is regardless of fund source, magkano yung computation ng premiums ng 20.87 individuals? So can you just submit that to me? Kasi mukhang nagkakalituan na lang tayo. Pasubmit na lang po. My next question is, ito pong 12.75 indigent beneficiaries, this is based on the NHTS? Tama po?
That's correct, Madam Chairperson.
But the last time I checked, based on the August 2022 NHTS, there are only 5.59 indigent households. So paano po nangyari na naging 12.75 million ang sinisingil niyo sa government?
Madam Chairperson, Honorable Stella Kimbo, may I request that we be given 1 minute, Madam Chairperson, to call on Vice President Lem Untalan to explain this figure, Madam Chairperson, please?
Yes, Chair, can you please recognize Mr. Lem Untalan?
Madam Chairperson, Honorable Representative Kimbo, Mr. Untalan is in the other room.
No, I'm going to ask about why they're overcharging us. So, okay, I'll proceed to my next question. How much income did you make last year, 2021? For PhilHealth, magkano ang total income at magkano ang total expenses?
Madam, if I may, 180 billion.
That's the income?
Opo. And expenses is
Total income is 180 billion and total expenses?
Madam Chairperson, Honorable Representative Kimbo, may we request that we recognize Senior Vice President Greg Loda to answer the question. Madam Chairperson, please.
So, magkano po ang total expenses, SVP Greg?
Thank you, Madam Chair and Honorable Congresswoman Kimbo, for our income for 2021 or as of June, ma'am?
2021.
For 2021, we have 171.2 billion, benefit expense of 140.2 billion. So we have a gross margin of 31 billion. Our operational expenses is 7.8 billion. So at the end of the day, our operating income is 23.2 billion. And we have an interest and other income, ma'am, 9.7 billion. So at the end of the day, a net income of 32.8 billion.
Okay, so that's good news kasi tuwing tinatanong natin kung ano ang actuarial life ng PhilHealth, lagi ninyong sinasabi sa amin na mamamatay na ang PhilHealth. So, kanina tinanong din anong actuarial life, hindi makasagot si Mr. President. Ang sabi niya, kung itutuloy nyo ang subsidy, ay aabot naman siguro ng 2027. So nakaka-nervyos po yung mga pronouncements na yun. Baka iniisip ng ating mga kababayan na nalulugi na ang PhilHealth. So sa aking pagtingin kasi dapat going concern. Pag tinatanong kayo kung ano ang life ng PhilHealth, dapat indefinite, hindi po ba? Kasi going concern po. Kasi tama po ba na tuwing mag-i-introduce kayo ng benefit payments, that is subject to actuarial validation. Tama po?
That's correct, Madam Chairperson, Honorable Stella Kimbo.
So in other words, in theory at least, wala kayong gagawin na mapinsala sa fund. Tama po?
That's correct, Madam Chairperson, Honorable Representative Kim.
Kasi sa ngayon, sa kinikita ninyo, the only way na mamamatay ang pondo is kung mamimigay kayo ng benefits way more than what you have. Tama po?
That's correct, Madam Chairperson.
At hindi ninyo hahayaan na mangyari yon. Tama po?
We will not, Madam Chairperson.
So in other words, ang madaling salita, ano po ang actuarial life ng PhilHealth?
Madam Chairperson, when I was asked the same question, I answered that PhilHealth will last forever, Madam Chairperson.
Salamat po sa reassurance. At sana po, beginning today, wag na po kayong magsabi ng taning sa buhay ng PhilHealth kasi talagang kinakabahan po ang lahat po ng miyembro na nagko-contribute. Wala pa po ba si Lem? Kasi ang tanong ko lang is simple. Sinisingil ninyo ang gobyerno for 12.75 indigent families. At base ito sa NHTS. Pero pag titignan natin ang NHTS, 5.59 lamang ang indigent families. So parang lumalabas, kayo po ba ay nag-overcharge sa gobyerno? Kasi napakalaki po ng hinihingi ninyo, 100.2. So gusto ko lang malaman, I just want an assurance na you are not overcharging the government. So paano po nangyari na naging 12.75? From 5.59, paano naging 12.75?
Madam Chair, the NHTS, ang ano po niyan household.
Tama po. So how many families per household?
So
Hindi ba 1.11?
Opo.
Tama po, 1.11?
Yes po.
So pag i-multiply mo yung 5.59 by 1.11, 6.2 lang yon. Paano nakarating yung 6.2 sa 12.75?
Yes po. Ito po yung ano dun sa household survey po, may about three families po siguro average doon. And some of the families have children na 21 years old and above.
Correct. So ang sinasabi niyo, kasi ako po, meron akong 4 na anak. Ang isa doon, 23 years old. So sa pamilya namin, sinisingil niyo yung gobyerno ng 2 premiums. Isa para sa
household,
sa nanay, sa tatay, 3 anak na below 21. Tapos may singil pa kayo ng another premium for the only child that happens to be more than 21 years old. So for my family, kung ako ay nasama sa indigent, you are charging the government 2 premiums for my family. Only because I happen to have a child who is more than 21 years old.
Yes.
So that is the policy. But is that even commonsensical? Why are you charging my family 2 premiums, right? So nagkataon na meron akong isang anak na 21 at isa pang anak na 22. You are charging the government 3 premiums for my family. That doesn't even sound right. So ang tanong na simple is, hindi ba natin naisip that you are overcharging the government? Sinasabi ninyo na ang coverage is 12.75 indigent families when in fact, on the basis of a commonsensical definition of what a family is, you are overcharging us.
Madam Chair, could I clarify that? According to the National Health Insurance Act po, National Health Insurance Program, dinefine po kasi doon ang dependents is below 21. So,
yeah, I'm just saying that you're making it sound so complicated. Why don't you just recompute, diba? Recompute the premium. Kasi bottom line, sinasabi ninyo na yung 4,800 na sinisingil ninyo sa kada pamilya na indigent ay kulang. Why don't you just compute an actuarially fair premium so that all of us are all on the same page? Kesa naman, sinisingil mo ang pamilya ko ng 3 beses when in fact isang pamilya lang kami, hindi po ba?
Okay.
We face a common illness risk because we live in the same house. So you need to treat us as just a single family unit. It doesn't make sense why you need to charge this family 3 premiums. So kaya hindi tayo nagkakaintindihan. Bakit hindi nyo nalang simplehan ang pag-compute ng actuarially fair premium? Nang sa ganon, nagkakaintindihan tayo kung ano ba talaga ang sapat na subsidy na ibigay sa inyo. So in the end, we always end up in a situation of distrust. You always come to us and tell us, malapit nang mamatay ang PhilHealth because Congress refuses to give us the budget subsidy that we want. And then on our end, we say, well,
why will we give you that much amount when you cannot even come to us with reasonable computations? So tingin ko once and for all, since meron naman tayong bagong management at siguro naman magtatagal tayo, why don't you just make that resolution to once and for all, tuldukan na itong, ang tagal-tagal na itong problema na to. Mga bata pa tayo, Lem at Waway. Problema na ito. And this was 2 decades ago. Bakit hindi ninyo ayusin once and for all? Yun lang, para magkaintindihan tayo kung ano ang proper na singilan. Because ako, unang tingin pa lang dito, you are overcharging government. Unfortunately, kahit ako pong sponsor ninyo, I will tell you, I'll be honest with you, na hindi maliwanag ang computation ng singil ninyo sa national government. Ditong subsidy na pagkalaki-laki, 100.2 billion. At lagi ninyong ginagawang dahilan, year in, year out, para nyo kaming hina-hijack, emotionally hijack. Lagi nyo sinasabi, mamamatay kami dahil sa Kongreso. So yun lang po.
Mr. Chair, we'll look on that. We'll
Salamat.
revisit our existing policy pa. Thank you very much.
At this point, we recognize Senior Deputy Minority Leader Paul Daza.
Thank you, Madam Chair. Good afternoon to everyone. I apologize if I asked questions that were asked earlier. Nakasabay-sabay po ang plenary session and other meetings. But first of all, welcome. It's been a long day, so we'll try to wrap it up. But Madam Chair, this representation shares the same sentiment about PhilHealth. But since you have done a comprehensive job in asking the right questions, I will move to my next series of concerns. In 2020, you had substantial unused appropriations. In 2021, you had 6.5 billion unused appropriations. Is that correct?
Madam Chair, may we recognize Director Weng Laura to respond to the question, Madam Chair.
Yes, Madam Chair. Yes po, meron po kaming unobligated balance last 2021.
So is that correct? Unused appropriation 6.5 billion for 2021. I think 2020 or 2021.
For 2021, sir, actually, sir, our total unobligated allotment for year 2021 is 15.2 billion. Then for the unreleased APRO, we have 1.1 billion.
Okay, sige. So there's billions of funds that's unused, that's been appropriated to DOH. Now for the 2021 continuing appropriations, that's 4.8 billion. May I ask how much is remaining of that continuing 4.8 for this year?
For year 2021, we have remaining 398 million, 2.86 billion as of July 31 for the regular funds. And for the COVID funds, it's around 398 million, sir.
Okay, thank you. What would be the top three of the regular fund, 2.86 billion?
Director Laura?
Ma'am, can I have 1 minute to gather my documents?
Rep. Daza, do you want to proceed to your next question while she looks for the answer?
Well, I'd like to know for the record what the top three is of the remaining 2.86 billion. And Madam Chair, if we can request them to submit to the committee and myself a breakdown, a complete list of the 2021 continuing appropriations?
Yes, sir. We will be submitting to you the updated remaining funds, CONAP funds for as of July 31, 2022, sir. Thank you.
Madam Chair, I'm sorry, I didn't get the name, Madam Chair. The Director, Laura. Thank you, Director. Of the 2022 MAIP allocation, well, 2021 continuing and 2022 new appropriations, regular appropriations 2020 MAIP, how much is remaining for this year?
Madam Chair, may we recognize Undersecretary Charid Grande, please.
Good afternoon, Madam Chair, and good evening. Good evening, Congressman Dasa. For CONAP 2021, our outstanding, Madam Chair, is 314 million, Madam Chair. And for 2022 GAA, we have outstanding 8.4 billion, Madam Chair.
Thank you, Madam Chair. Part of the problem with MAIP is a very good program. Thank you, USEC. And I know it's very hard to implement nationwide. And I'm not sure if it was asked earlier. Could you share to the committee what positive steps in terms of streamlining the process and making it easier to avail of the MAIP program?
Madam Chair, we recognize the concerns of our stakeholders. In 2020, our guideline in the operating our MAIP program is anchored on the 2022 GAA. And so for 2023, in order to make a comprehensive availment of my program, we introduced some provisions in the special provision. And we have been working with the different staff of the different legislative offices, as well as the feedbacks from our management reviews with our different CHDs, as well as our regional directors. That way, we will be able to address specifically the concerns pertaining to the memorandum of agreements. Further, in coming up with the memorandum of agreements, we have also provided templates so that the RDs in our respective CHDs will no longer have problem. They will just have the template. But still, given the concerns that we heard during our management reviews, we will try to improve the implementation of the program. Of course, with the help of the body in coming up with a legal basis. Thank you, Madam Chair.
Madam Chair, to improve the utilization of MAIP and to be able to assist more patients, may I ask how many in the universe of facilities that you could do a mall with, how many would that be nationwide?
Madam Chair, we considering that this will be the first time in 2023 that we are proposing some provisions. We have already tasked our regional directors. This is still ongoing coordination with our RDs in order for them to identify what will be the coverage for facilities where the CHD will be entering into MOA. So, for instance, they will have to identify province or cities where we do not have DOH hospitals, or there are problems in terms of providing hospital beds. So with that, Madam Chair, we commit, Madam Chair, that after our study, we will be submitting.
Madam Chair, my question was how many facilities could you do a mall with, ballpark, nationwide?
Again, Madam Chair, I cannot provide, but what I can give you is our existing number of facilities, private facilities that we have MOA.
Okay, how many is that?
We have 213 memorandum of agreements, Madam Chair.
See, Madam Chair, that's the problem. If we're going to rely on a MOA to be able to do that, I've been asking for MOAs for the last 2 years in my area. I know they're trying to do their best, but it's not going to work. I think the better model, Madam Chair, if you could help the many members nationwide so we can use the MIAP. In the DSWD IX, there's no MOA requirement. It's voluntary. If a funeral home or a clinic or a hospital will accept a guarantee letter from DSWD, they'll issue the guarantee letter without a MOA. If you're going to require a MOA, it's very, very hard to do that because there's so many requirements for the MOA. If DSWD can do it, then we can do it in DOH. We want to help you find ways to improve the process.
Madam Secretary.
Yes, Madam Chair, and magandang gabi po, Congressman Daza. Yes, we understand the noble intent of our honorable congressman, and to have our MAIP be like the process similar to that of AIX. Okay naman po yun, kaya lang if you try to compare, the monies of AIX would just be around 2 billion coming from the SWD. We're talking about almost 22 billion for DOH, and it's going to be a tedious for us to monitor and also ensure that the funds will be used rationally and within rules if we are not going to require a memorandum of agreement. That's why this was the legal instrument that we have identified.
Madam Chair, I beg to differ. First of all, the IX is not 2 billion. The last time I checked, it was over 20 billion. May I ask the good secretary, what was your total MAIP for 2022?
Madam Secretary.
Yes, Madam Chair, it's 21 billion, Honorable Congress.
Yeah, and you have 8 billion left to spend for the next 4 months. So we need to do a better job to utilize those funds. So what I'm suggesting, good secretary, is if IX can do a guarantee letter, which you do also, they found the legal basis. There's no reason DOH can do the same thing. I'm having so many complaints against the House, against DOH. We have funds downloaded that can't be used because of this problem. My last question is, and I will pursue this, the plenary, is we need to improve this, Madam Chair. Can you explain about super health centers and how many you have in Region 8 and Northern Samar?
Madam Chair, if we can refer the question to Director Nene.
Director Nene.
Madam Chair, Honorable Daza, can you give me 1 minute? I will just check on the record. Salamat po.
Thank you. That's my last question.
While we're waiting, I believe Director Laura still owes you a response.
Regarding po sa unobligated CONAP, as of July 31, top 3 is, number 1 is the MAIP funds. We still have 1.2 as of July 31. Then we have HFEP for 568 million. And Philippine COVID-19 Emergency Response. This is a project po for COVID, 268 million. Thank you po, Madam Chair.
Sure. Madam Chair, and winding up, that's the very reason why you need to improve MAIP. You still have 1.2 billion from 2021 appropriations. Alam po ninyo kung ilang patients ang pwede natin tulungan with 1.2 billion. So you haven't done a good job. So please find solutions to this instead of rationalizing the underutilization.
Director Nene.
Yeah. Your Honor, for Region 8, a total of 29 super health centers, 15 for this year, and 14 proposed for 2023. Particularly for Northern Samar, we have 1 super health center po. Thank you very much.
Rep. Daza, can you please wind up?
Yeah, thank you, Madam Chair. I think we need to improve in the allocation for Northern Samar, Madam Chair, and I'll take that up, I guess, in the with the regional directors. Thank you.
Thank you, Rep. Daza. Next interpellate is Rep. Roy Loyola. Via Zoom, Rep. Loyola, are you around?
Yes, Madam Chair.
We can hear you. Please proceed.
Yeah. Magandang hapon po, Madam Chair, at sa pamilya ng ating ng Department of Health. Binabati ko po si Secretary Maria Berhere and the rest of the new set of officers ng Department of Health. Ako po ay wala namang katanungan. Ang akin lang ipakiusap ay yung aking lalawigan ng Cavite. Cavite po is the biggest province in terms of population. Dito po nanirahan ang maraming taga Metro Manila at napakarami pong informal settlers ang narelocate sa lalawigan ng Cavite. But until now ay wala pong malaking hospital ang Department of Health o National Government. Bagamat meron sila na yung Southern Tagalog Regional Hospital Branch with the 100 bed capacity, still it's not enough. Baka pwede po Madam Chair ng Department of Health ay gumawa na isang malaking hospital sa lalawigan ng Cavite. Kausap ko lang po kanina si Governor John B. Remulla at sinabi niya meron siyang 10 hektarya na pwede niya ipagkaloob sa Department of Health para tayuan po na isang malaking hospital. Sa ngayon po, ang population ng lalawigan ng Cavite ay more than 4.2 million na at patuloy pong dadami, tataas pa ang bilang ng mamamayan kasi ito na po yung pinakamalapit na lalawigan sa Metro Manila. Ito po ay isang pakiusap lamang, sana po mapasama sa pipeline ng plano ng Department of Health sa mga susunod na taon. Maraming po salamat, Madam Chair. Maraming po salamat, Secretary Berhere. Sana po mapagbigyan nyo ang kahilingan po ng aking mga kalalawigan, ng aming Governor, John B. Remulla, at lahat po ng congressmen sa lalawigan po ng Cavite. Magandang hapon po at maraming po salamat.
Salamat, Rep. Loyola. Madam Secretary.
Yes, Madam Chair and Honorable Congressman Loyola. Maraming salamat po. Good evening. Yes, part also of the direction and priorities of government. During the time of the pandemic, this was an issue because patients coming from Region 4, specifically Cavite and Laguna, were flocking the National Capital Region hospitals like PGH, ayun po malalaking hospital, Jose Reyes. So, nung nakipag-usap po tayo sa, if you remember, governors and officials from Region 4A so that our referral network will be established and managed. So, kung meron na pong lupang inaalok, I think this will be more easy for us and we can facilitate this. So, we will advise you, Honorable Congressman, regarding this matter, but definitely this is of priority for us.
Maraming po salamat, Madam Chair. Maraming po salamat, Secretary. At ipararating ko po ito sa aking mga kasamang congressmen at lalong-lalo na po sa aming buting Gobernador John B. Remulla. Muli, maraming po salamat.
Salamat, Rep. Loyola. Next to interpellate is Representative Ana York Bondok. Oh, so, all right. Balikan na lang natin si Rep. Bondok. At this point, we will proceed to the second round. Meron pa tayong another 50 na magtatanong sa round 2. The chair rules that for the second round, each member will have 2.5 minutes for questions. So, the first to interpellate second round is from the minority, Representative Eileen Brosas. You are recognized.
Thank you, Madam Chair. Madam Chair, 2 minutes talaga. Ito si Bambi. Madam Chair, ang tanong ko po ay tungkol dun sa epidemiology and surveillance program. Napansin po natin na lumobo ang MOOE budget ng Central Office mula 204.355 million patungong 684.969 million o 235.19% increase. Bakit po?
Madam Secretary.
Yes, Madam Chair, that the MOE have substantially increased because of the workers that we have hired during the time of this pandemic. we have established our COVID-19 surveillance and quick action unit where we have different cadres, almost 300 po yung hinire namin just for that specific unit in DOH. Also, we have hired encoders and disease surveillance officers across the different regions of the country. And that was also part of our MOOE, Madam Chair.
Thank you, Madam Chair. Madam Chair, bakit bumaba naman ng 89.79% to 98.78% ang budget ng regional CHDs para sa programang ito? Yung mga CHDs po sa Central Visayas at Caraga, 534,000 na lang ang budget para dito sa buong taon. Ito po sa gitna ng pandemya, sa panahong dumadami, no, yung mga cases natin ng iba pang mga diseases katulad ng TB, dengue, iba pa. Ngayon, kailangan po nating palakasin yung prevention and control ng communicable diseases at epidemiology and surveillance program, lalo sa mga regional CHDs. At kung nilipat nyo po yung pondo doon sa yun po yung question namin.
Yes, Madam Chair and Honorable Congresswoman Brosas, hindi po namin nilipat. Actually, we had a proposal equivalent also to that proposal for our central office na tumaas din yun sa kanila kasi mas kailangan po ng regions namin at ng local governments ngayon ang functional surveillance units. So it was also not approved from DBM. So the final NEP was cut when in fact we needed around 2.3 billion for us to establish this functional epidemiology and surveillance units hanggang sa lowermost level po nung ating mga facilities, Madam Chair and Congresswoman Rosas.
Yes, Madam Chair. Ang gusto po natin i-point out dito, malaki yung magiging epekto talaga sa incidence ng surveillance, distribution, and control of diseases, halimbawa ng leptospirosis, malaria, iba pa. Kung paano yun kung walang budget ito? Diba? Yun nga yung mas kailangan nila, yung mga CHDs, yung down to the regions. At hindi po doon sa office, hindi po nakabulto doon sa Office of the Secretary, yung pondo or nag-increase ka dito sa central office mismo tapos wala kang budget para sa baba. So meron pala. So ang proposal, ang original proposal nyo ay meron. Iwala lang hindi na reflect dito sa hindi pinayagan ng DBM, right? Yun. So, Madam Chair, let me run down lang yung mga kailangan po na request sana para kasi 2 minutes lang daw meron ako. So, can we request from the DOH the following data? Kung kaya lang po, i-column 1 nyo po yung mga name ng mga DOH hospital, column 2, budget proposal from the hospitals, para ilinaw natin kung alin yung sinumite ng mga ospital talaga sa DOH, tapos alin po yung column 3, DOH proposed hospital budget, tapos yung DOH2 DBM yan diba? Tapos yung column 4, difference between column 2 and 3, tapos hospital budget, column 5, hospital budget as provided in the NEP 2023. Tapos yung difference, column 6 po, difference ng column 3 and 5. At yung column 7, difference between column 2 and 5 para po makuha natin yung Yung next ko pong request ay the following documents.
Baka para lang ma-complete ang picture, dapat idagdag na rin dyan yung other sources of funds ng hospitals. Kasi sa ngayon, may mga nagtataka, bakit lumiit ang MOOE ng mga DOH-retained hospitals? Akala tuloy na ating mga kababayan ay hindi na kayang magsilbi ng hospitals na yun. But in fact, meron silang other sources of income. Meron silang PhilHealth income, meron silang MAIP, meron silang others, meron pa silang possibly interest income. So, to the extent na kaya nyo rin ilagay yan, idagdag na rin natin para kompleto yung picture. Hindi naman ibig sabihin na kapag bumaba ang MOE budget ng isang DOH-retained hospital, ay magsasara na ang hospital na yon. Tuloy-tuloy lang yon dahil meron siyang other sources of funds.
Yes, pwede naman po. Pero particular dito, pwede i-add sa as column 7. Pero ito pong particular na mga data na ito, sana po meron sa PS, sa MOOE, tsaka sa capital outlay. So tatlo din siya na tatlong document bale, no? And para sa capital outlay comparison, pwede po bang i-include na yung direktang nakabudget sa mga ospital at mga nasa HPEP din? Tapos, yung second po, documents naman ng GOCC, corporate operating budget of the 4 GOCC hospitals. Budget comparison po din ang gusto sana namin. Yung column 1, name ng GOCC hospital, column 2, budget proposal from the hospitals. Tapos yung budget 3, yung column 3, DOH proposed hospital budget na isinimutin ninyo sa DBM. Tapos yung column 4, difference between column 2 and 3. And yung column 5, hospital budget as provided in the NEP 2023. Tapos yung column 6, difference between column 3 and 5. And column 7, difference between column 2 and 5. And lastly po, request para sa data ng saan ko po ito matatanong? Ayan. Data ng breakdown of all health workers in the public sector. Their position corresponding to SG level. Magkano po yung nakalaang budget para sa kanilang sahod at benepisyo. Tapos kasi titingnan po namin kung sapat yung nasa NEP eh. Kung hindi, pwede pong magdagdag kayo ng isang column para sa inyong budget proposal. Thank you, Madam Chair.
Para lang walang kalituan, baka gusto mo na lang i-share ang template mo sa kanila. Alright, okay, salamat. Next to interpellate is from the majority, Representative Marivic Copilar, joining us via Zoom. Representative Marivic Copilar, are you with us? Wala po siya. Next is Vice Chair Jose Aquino.
Thank you, Madam Chair. Secretary, nakalimutan ko lang kanina, importante kaya bumalik ako. I have this Caragay State University, no, located in Barangay Ampayon, Butuan City. My hospital, Butuan Medical Center, is like 5 kilometers away, neighbor. Ang katabi sila ng barangay, no? Say level 2, no? Na medical. Ang problem ko, magpapasa na ako ng bill na mag-create ng College of Medicine sa Caraga State University. And I think ang isang kailangan is dapat may level 3 na hospital. Gusto ko sana talagang wala kaming College of Medicine sa Caraga region.
Madam Secretary.
Yes, Madam Chair and Honorable Congressman, can I refer to Yusek Ken Ronquillo regarding the requirements for a medical school?
Yusek Kenneth.
Thank you, Chair, sir. Putting up the medical school is under CHED. That's CHED Memo 18 Series 2016. The requirements are all there. So hindi po kailangan na mag-put up ng law kasi kasama na rin po ito sa Doktor para sa Bayan. So we will just have to go through the requirements by CHED. However, yung isang concern po ninyo doon is that putting up the base hospital, kasi yung requirement po under CHED is a level 3 hospital. But we can explore hospitals within your area kasi pwede naman kung mag-consortia yung mga hospitals na yun to put up the requirement. So but we will have to work within CHED Memo 18 Series 2016.
Salamat, Rep. Aquino. Next interpellate from the majority, we have Representative Bambi Amano for a second round.
Thank you, Madam Chair. And maayo ng gabi. And would like to follow up first, Mr. Chair, is because I was really in a hurry earlier. Does the good secretary allow the transmission of documents even without the signature of his personnel from the region, Madam Chair?
Secretary?
It depends on the document, but Normally, sir, and officially, we would not allow if there are no signatures coming from our officials.
Yeah, because it would be very easy to deny it, Madam Chair, by the regional office. Hopefully that the documents that will be given tomorrow hopefully will have the signature of the person concerned. And second, Madam Chair, is would like to follow up on the line of Kong Daza, which was about MAEP. May I know if the second district of Misamis, I am actually a returning congressman. Don't know if I still have funds from MAEP, and if there are, how much for second district of Misamis Oriental?
Madam Chair,
Madam Secretary.
USEC Charade granted for
USEC Charade, please.
Madam Chair, we just really need the requests for the hospitals where we will be downloading the fund.
Yeah,
Madam Chair.
The question, Madam Chair, is do I still have funds, or the people of second district do still have funds?
The people, especially the MAIP funds, is available to all, Madam Chair.
Okay.
What year are you referring to, Rep. Emano?
This year, 2022, Madam Chair.
We provide, Madam Chair, assistance to indigent patients, Madam Chair, and financially incapacitated.
No.
So we will just coordinate with your office, Honorable Congressman Emano, for the specific hospital where you wish to.
Yeah, Madam Chair, maybe the regional director will be given authority that we will be able to discuss it tomorrow.
Yes, Madam Chair, we actually gave that instruction 2 weeks ago. So we will just follow up, Madam Chair.
Second to the last, Madam Chair, I also overheard Dr. Gorgolon regarding the distribution of the super health center. And one of those he mentioned was it will depend upon the poverty incidence. And I'm wondering, Madam Chair, because recent data, I think the most recent was 2019 are they basing the poverty incidence in DSWD, Madam Chair? Is it with the DSWD where you base data for poverty incidence?
Madam Chair, if I may refer the question to Director Nene Gorgolon. Director Nene.
Director Nene.
Madam Chair, Honorable Congressman Emano, parameters of the national allocation framework includes presence of geographically isolated and disadvantaged area, poverty incidence, resources of the local government, projected demand until 2040, current supply of health facilities and medical equipment, and gap in healthcare provider network. So these are all the considerations in the national allocation framework.
Like Kong Almonte, I beg to disagree, Madam Chair, because I hope that the regional director and I will be able to discuss it again also tomorrow, because I am not actually satisfied with how it was distributed in Region 10 and other provinces, because I saw the NEP. And I don't want to believe, I really don't want, Dr. Gorgolon, really. But when I looked at it, parang hindi naman from the requirements that you mentioned earlier. Parang palakasan eh. I hope I'm wrong. Pero parang palakasan. So tomorrow I hope that I'll be able to discuss it. And last. Yes, Madam Chair, last. Before third round, I also heard that you have a scholarship program, Madam Chair, for those who want to become doctors. How do we avail? How does one apply?
Madam Secretary.
Yes, Madam Chair, if I may call on you, Sir Kenneth Ronquillo for the scholarship program.
Thank you, Madam Chair. Sir, the application for medical scholarship program is under the CHED now because of the Doctor para sa Bayan. So they'll have to apply sa CHED na po.
So DOH has nothing to do with it anymore. So
wala na, sir.
So example, Kong Almonte wants to become a scholar. He's my constituent. I'll just forward him to CHED. No more recommendation from the regional director, from the national office.
No, sir. It's CHED na po.
So what's the allocation per year? What's the allocation per year? Like how many scholars does CHED accept?
Sir, ang CHED ang nag-program po ngayon, but previously under the Department of Health, if we look at numbers now, we have around 1,359 from first year to fifth year medical students. But starting
when it was still under DOH. Now
yes, sir.
You don't know already.
Yes, sir.
Is that possible, Madam Chair, that DOH doesn't know how many scholars for medical students?
Sir, because now it's under the budget and care of the Commission on Higher Education.
Okay. I'll try to bring that up with the Department of with the Higher Ed also. Thank you, Madam Chair. And
Salamat. Does that mean, do you still have questions for the third round?
sige, Madam Chair. Good evening. You said to Mama, you should help us, sige, okay na, Madam Chair. Thank you, Sec Bergere and DOH family. Hope that I'll have a fruitful meeting with your Dr. Gorgolon and that I'll have a fruitful meeting with your regional director tomorrow. Thank you, Madam Chair. Thank you for being so patient.
Salamat, Rep. Emano. Next to interpellate from the majority, Rep. Ana York Bondo. You have 5 minutes.
Thank you so much, Madam Chair, for this opportunity. And magandang gabi po to our OIC and hopefully soon to be permanent secretary at DOH family. I wanted to bring up po, before I go into local district concerns, please tell us more, just very briefly po yung sa Institute of Virology kung ano po yung plano nyo, especially since this was mentioned po in the SONA.
Yes, Madam Chair. And good evening po, Honorable Congresswoman. Yun pong Virology Institute of the Philippines, this is going to be managed and this was recommended really by the Department of Science and Technology. So they're the ones which are going to oversee this. But in a nutshell, the Virology Institute of the Philippines is for us to be able to do researches and to be able to locally manufacture vaccines. So yun po yung in a nutshell for this Virology Institute of the Philippines.
And thank you very much po, Madam Chair, for this explanation and Secretary. Ma'am, can you expound more on the local manufacturing of vaccines? And isa po yun that has caught my attention because sa Southeast Asia po, we are one of the few countries without the capability po to manufacture vaccines. In fact, Thailand is already manufacturing Astra po, no? And Indonesia is also ahead of us. So our inability or a lack of facilities, I'm sure hindi naman po ito lack of knowledge ng mga tao since we have qualified Filipinos working in vaccine facilities all over the world. But siguro po lack of government direction and nahirapan po tayo ng pandemic. So we were at the mercy of more developed countries and countries with manufacturing ability. So can you give us some plans po kung ano po yung maging manufacturing po ng vaccines? And are you going to be working closely po with the DOST in this issue?
Yes, Madam Chairperson and Honorable Congresswoman Bondok. Actually, just for the information of our officials, we had a specific biologics unit, manufacturing unit in our ITM. And in the previous years, we used to manufacture our own vaccines. Nagkataon lang po, nagsara yung unit natin sa our ITM noon, hindi po siya na-sustain. Pero ngayon, ito pong biological manufacturing unit ng RITM will be working closely with the Department of Science and Technology. So ang DOH po together with the DOST will be working closely on this. Also, meron ho tayong plans for us to have that mag-capacitate po natin yung units natin sa RITM para makapag-research more on the viral organisms causing diseases among men or individuals so that we can eventually go into manufacturing our own vaccines. Anong pong pandemya, we were planning to do fill and finish. kung saan pinapadala po ng mga big manufacturers, dito natin gagawin. At least we can start already. So that is still part of the horizon kung pwedeng yun ang umpisahan. But definitely local manufacturing so that we can also be as competitive as with the other neighboring countries po. And we can have our own.
The reason that I asked this question, I would like to invite po, though it's not in my district, sa Clark po, we could have export processing zones po dito for the vaccines. And there is also a big facility doon. So the reason I brought this up is to bring up the possibility po of having the vaccine manufacturing facility located po either in my district or in Clark, Pampanga. Kaya ko po bringing up po ito. And again, I'm very much interested. Kung hindi po, forever na lang tayong hihintay po sa ibang tao to give us vaccines. So, syempre, sila po ang gumagawa. So, unahin po nila yung sarili nila. So, thanks for this question. Very good answer po, Madam Chair. I'm very heartened by this. Kasi po, kung uulitin lang po natin yung CDC, and I hope that is not our purpose here, the Philippines has done actually better po than the CDC. Kasi 1 million ang namatay sa kanila. Sa atin po is definitely much, much less than that. So, in terms of knowledge and sharing po, hindi naman po nahuli ang mga Pilipino. So, I'd like to go po to local concerns. Madam Chair, you mentioned po yung GIDA at saka po nabanggit na po ni Congressman Emano yung super health centers. Again, I was informed that you have to apply to become a super health center. Kailangan po ba kami mag-apply or do you just name a super health center po? And what is the role po of the GIDA dito?
Madam Chair and Honorable Bondok, Congresswoman Bondok, there is this Minalin Super Health Center, which is part of the allocation for your 4th district. And also, it has been given 12 million allocation for 2023. About the GIDA areas, definitely the GIDA areas will be part of the priorities of government for us to provide facilities and access to services, ma'am.
Thank you for mentioning that. Kaya ko po natanong yon, Madam Chair and Honorable Secretary, is that the LGU pala ang nag-apply po to become a super health center. And after that, wala na pong super health center sa amin. And we have an area po in Masantol, Pampanga, which is isolated po from the town, that's 7 barangays, inundated by climate change at binabaha po every day. And I was informed that I have to apply po to become a super health center. So i-apply ko po lahat ng bayan ko. Is this an application process or does it become automatically awarded? Because napansin ko po sa tanong po ni former Congressman Emano that he was disappointed with the naming of the super health center. So paano po ba?
Yes, Madam Chair and Honorable Congresswoman, it goes through the same process as what with the other HREP projects. That this is going to be discussed with the regional directors. They go to your place, they validate, and then once validated and agreed on, it is submitted to the central office. So we will ask our director to go to your office, ma'am, so that both of you can discuss and see if it's aligned also with the overall plan of the Pampanga area.
Yes, thank you very much, Madam Chair. And actually, nagpunta na po si Regional Director. Iklinaro ko lang po kasi when I heard the earlier interpellation. And yes, we have areas that are perpetually flooded, difficult to get to. And we would like to apply them po to be super health centers and hopefully that they would meet the requirements. And lastly po, I would like to thank our Honorable Secretary and Madam Chair for our 11 specialty centers po that were assigned to the Jose Bilingad Memorial Medical Center. Salamat po doon. Kaso po, the hospital is already extremely crowded po. Kumbaga kulang na po yung lote. Number 2, it's supposed to be a 1,000-bed hospital. Kaya lang po, we can only put 650 to 700 beds kasi wala na po talaga. Vertical na po ang expansion. In cases where there is no longer any lot, and lalo na po, we know that San Fernando is already a developed city at napakamahal na po rin ang presyo ng loting bumili. Would you be open po na for
donations po of lots or satellite areas kasi po pag talagang punong-puno na po talaga, wala na po tayong magagawa.
Yes, Madam Chair and Honorable Congresswoman, satellite or extension hospitals, ginagawa naman po iyon. So that is no problem as long as we comply with the technical standards according to that. As to the available lots, we need to explore that possibility, ma'am. But but thank you very much. If you can also help us so that we can also expand further our J. Bilingad Hospital.
Opo. Thank you very much for that, Madam Chair and Madam Secretary. We will definitely be working. In fact, may letter na po ako which I will be submitting po sa inyo today. We are going to be donating po a lot and a building. So ako lang po ata ang congressman na nagbibigay sa araw na to. At lahat po, I'm sure, may pangangailangan. As the only one who's donating to this day, sana po aprubahan nyo na po kaagad so that we may have a satellite hospital. Kasi po, wala na talagang lote yung amin pong regional hospital. So, we'll be submitting that letter. And thank you on that note po. Congratulations po. We really do need to manufacture vaccines. We will be applying po for super health centers po, lalo na sa mga GIDA areas namin na talaga pong baha at kailangan po ng tulong. And then, again, for the manufacturers of vaccines, I will approach you po for possibly putting up a manufacturing facility po outside of Metro Manila, hopefully in our district or in Clark. And lastly po, let's expand po yung ating pong regional hospital na sayang po ay approved for 1,000 beds, wala na talagang pwesto. Tutulungan po namin kayo to have a new area. So maraming salamat po, Madam Chair, and more power po sa DOH.
Salamat, Representative Dr. Ana Yorpondo. Next interpellate from the majority, we have Representative Dr. Peter Miguel. Puro mga doktor.
Madam Chair, salamat po.
2.5 minutes, sir.
Madam Chair, just would like to know any updates sa monkeypox. Is it trivial at this time or something to be alarmed with of? Monkeypox po.
Yes, Madam Chair and Honorable Congressman, up until now, we still have 4 cases. Yun pong mga cases po natin, 3 cases, the source of the infection are coming from abroad. This last case, we cannot be certain and we do not like to pronounce that this is a local case because the history is quite vague. And we cannot get the accurate history coming from the patient. So ito pa lang pong meron, but what I can tell you would be that our surveillance is up. We had been continuously testing those who are having suspected lesions. And out of all of those being tested, wala pa naman pong nag-positive pa yet since the last time that we have detected the 4th case. Meron na rin ho tayong discussions with vaccine manufacturers. There had been 2 of these manufacturers that we have discussed with. And meron lang po, yung first kasi, yung isang klase ng bakuna, meron siyang parang contraindication to those with parang mga comorbidity, no, like clotting and all. So it's something that has to be given to those without these comorbidities, even though they are close contacts of the patient. The second one, wala pong ganong klaseng adverse event. Kaya lang po, ang commitment sa atin, baka first quarter pa or first month of by next year. So tapos, quite expensive din. Maybe because of competition and the shortage of supplies. And the last time that we were discussing with them, ang presyo na ngayon ng isang bakuna was $210 each. So it's quite costly already. So at this point in time, we are continuously coordinating with manufacturers, but still trying to weigh, no, if we really need vaccines, if we will need it, how much of these doses because of the cost of the vaccines, Honorable Congressman?
Can we say categorically that it's controlled at this time?
Madam Chair. Honorable Congressman, we cannot say that at this point because we're not testing everybody actually. For our surveillance points, we are just getting those people who are having suspected lesions. But for those who had been in close contact or those who had been exposed and they do not know, we don't know that. That's why we need our surveillance to be dynamic and mobilized and active so that we can immediately detect and prevent further transmission of the disease.
Of the cases so far, Madam Chair, may we know the mode of transmission? Because I'm worried about the skin to skin. The literature would say it's being transmitted through body contact. Is it really that's what's happening?
Yes, Madam Chair and Honorable Congressman. Yes, monkeypox is transmitted via close physical contact. It can also be transmitted via intimate contact. And out of all of those who had been detected with monkeypox in the country, the transmission has been close physical contact.
Kindly wind up.
Thank you so much, Madam Chair. I have no more questions. Salamat po.
Salamat. Next to may tanong lang po si Representative Edsel Lagman on your number of COVID cases as reported to the public. This is based on positive RT-PCR result. Tama po?
Yes, Madam Chair.
So, and antigen positives are not included in the count, which means severely understated, something like that.
Yes, Madam Chair. We concur with that assumption. But when we do our projections, Madam Chair, it is part of our assumptions that only about 40% of these cases are reported through RT-PCR and the rest are from antigen and isolating without having been tested. And that's 60% of what we don't see right now and report.
Or what you can say is what you report would be the severe COVID cases, in which case they need RT-PCR.
Not really, Madam Chair, because for those who had been tested and we had been reporting around only less than 10% are severe and critical, and the rest would be mild asymptomatic and moderate cases.
All right. Rep. Lagman, would that be all? Thank you. Next to interpellate from the minority, we have Representative Paul Daza. 2.5 minutes, sir.
Thank you, Madam Chair. Under the Universal Healthcare Law, Secretary, we have a provision on no copay. We passed a very good bill, the Malasakit bill, where the intention was to have a one-stop shop for all the payment, for all the subsidy mechanisms. And at the end of the day, what we want to do is to minimize, mitigate, and hopefully make zero the out-of-pocket of poor patients. Diba? Yan yung goal natin. That's why we have PhilHealth, we have all these different funds. So, how is DOH now monitoring the concept of no balance billing, the out-of-pocket of patients? PhilHealth used to do a no balance billing survey with the Malasakit office, which is very good. I'm happy. We have good people there. So how do you do the statistics? How are we doing in mitigating the out-of-pocket, yung gastos po ng mga poor patients?
Attorney Santos.
Madam Chairperson, Honorable Representative, may we request, Madam Chairperson, that we recognize our SVP for HFPS, Dr. Clem Bautista, to answer that question, Madam Chair. But right now, she is in the other room, Madam Chair, and we are calling her to join us in this meeting, Madam Chairperson. If you give us just 30 seconds, Madam Chair, please.
But President Santos, isn't that a fairly broad question that as head of agency, he can answer?
Right now, Madam Chairperson, we are implementing the no co-payment, no balance billing policy, particularly in the government hospitals, as mentioned a while ago by OIC CO Bacareza. We implement the 90% no co-pay, no balance billing in government hospitals. Madam Chairperson, please.
Rep. Raja, do you wish to wait for Dr. Clem Bautista?
Yes, I do. This is a very, very big public policy healthcare issue. It's because in the NEP, Madam Chair, in the 2023 NEP, there are performance indicators. And on the outcome, it's not in here. So I wanted to hear from the officials, PhilHealth, DOH, how we're monitoring the no balance billing compliance, how we're helping poor patients na para mabawasan po yung out-of-pocket nila. Kasi ang dami po nating pera, kaya nating gawin.
COO Waway or Dr. Clem?
Good evening, Chairman, Chairwoman Constella, and Honorable Congressman Daza. As to monitoring and control of the out-of-pocket expense, what we are doing is to improve the benefit package of PhilHealth. We want to, with the premium and the subsidy from the PCSO and PAGCOR funds, we ought to increase our benefit packages so that we could cover more of the expenses of the of those who will be admitted to the hospitals, and also coverage for outpatient services for PhilHealth. Thank you.
Thank you for that. Let me rephrase my question. Do we have any statistics on patients, what the compliance is on the Universal Healthcare Law, which says no copay, which PhilHealth issued 5-6 years ago, the no balance billing memorandum? How do you monitor that? What statistics do we have?
COO Waway.
Thank you, Madam Chair.
Rep. Daza, while you were away, a similar question was asked, and COO Waway promised to submit the data on the compliance with the no balance billing policy. But please explain.
Yeah, we have the data na Madam Chair and Kong Paul. In 2021, 42% ang no balance billing. It went down from 58% in 2020. This might be caused by the COVID. So we monitor that. We have our survey being done in government hospitals, ward room accommodation.
Madam Chair, we need to do a better job. Okay. Please provide me the statistics. That's something we will raise later on. Last one, so I don't need to do a third round. The NDP program is under the National Health Workforce Support System, 16.9 billion for 2023. It's the number 5 po dito. So is this the NDP program? Yung number 5 sa ano ninyo?
Can you please spell out the acronym?
It's called the National Health Workforce Support System, 16.95 for 2023 NEP. My question was NDP, and how that's going to be affected by the Supreme Court case, Mandana's ruling, and the Joint Memorandum Circular. I apologize if that was asked earlier. I came late. I was in the plenary.
No, that's the first time, Madam Secretary.
Yes, Madam Chair and Honorable Congressman. With the Mandanas Garcia ruling, since we are doing this devolution transition, wherein we are having this national allocation framework, the same way with our health facilities, where we are providing more focus and priority among those areas with low capacity but with higher need. Specifically, those areas with low poverty, with high poverty incidence, and the other conditions that has been stated, like resources of local government, presence of geographically isolated and disadvantaged areas, and gaps in health facilities in their areas, Honorable Congressman.
So dito po, pasok yun. Yung what I mentioned, the nurses are still in the National Health Workforce Support System, or it's charged to another budget, to another PAP?
Yes, Mr. Honorable Congressman, it is still part of the National Health Workforce Support and part of this budget, sir.
Kindly wind up, Rep. Paul.
So, because of the joint memorandum circular with the devolution and all of that, just a quick answer. What do you foresee as a reduction in the hiring of the nurses, of the NDP nurses for 2023?
I think the change, if ever there will be very minimal because we are still going to focus on high areas of priority like those with low capacity. And therefore, we are still going to deploy, especially in those areas that will need it, like the geographically isolated and disadvantaged areas. So considering that there will be this national allocation, we don't think that there would be major changes as to the number of those to be deployed.
Okay, thank you very much for that, Secretary.
Salamat, Rep. Paul. Next, we have Representative Janet Garin.
Okay. Thank you. Thank you very much, Madam Chair. Let me just go back to the question earlier by the Honorable Edsel Lagmano. I'm just following this up through because of him. Earlier, he asked about the catchment population needing reproductive health services. And what was given to us was a 3 to 5% of the population. May we know the basis for this?
Yusek Bev.
So that will transcend to around 3 million Filipinos, or roughly 4 million Filipinos, right?
Sorry, ma'am. The answer kanina of 3% was for pregnant women, but for 18 to 49, the numbers that we have now are around 28 million.
So balik tayo. For the record, how many Filipinos are in need of reproductive health services?
If we will consider all women of reproductive age.
No. I'm really sorry, but hindi kasi pwedeng if we will consider ito yung mga pregnant. If we talk about the reproductive healthcare program of our country, by virtue of the reproductive health law, we are talking about the recipients of RH. No ifs and no buts.
It's 28,157,813 po.
So it's right. It's more than 28 million, and that's acceptable because we were actually looking at 25 to 30 million. So for the record, the catchment population for the implementation of reproductive health is 28 million plus. So that's acceptable.
That's not acceptable. For a woman, it's 3 million.
Yes, the budget is 287 pesos if your population is 3 million. So if you have a recipient, or what do you call a beneficiary of 28 million plus, the budget will transcend to how much?
Almost just 30 pesos, ma'am.
30 pesos annually. So mas mahal pa yung kinain natin ngayong araw na to. So you see, if kung binawasan at kinaltasan natin ang infectious disease, control and prevention of infectious diseases, and we transferred it to health promotion, we could probably consider transferring a significant portion to reproductive health services. If the DOH family will bear with us. Yes, I yield to my boss, Congressman. Okay, so let me. Okay. I hope the DOH family will segue into what the people needs, because we have wants, but people are expecting services. Kasi we have to streamline the funds. So if you can look into the provision of reproductive health services, especially so that the recent pandemic, medyo marami ang nangailangan. And with hard economic times, procurement of reproductive health RH commodities will be an additional burden on the Filipino families. Can we get the commitment of the Honorable Secretary regarding this? And can we have the assigned EXECO member to handle reproductive health care?
Yes, Madam Chair. We commit that we will again review the allocations for our public health programs and try to prioritize based on the needs of our individual beneficiary,
Yes.
Madam Chair.
And this include condoms, especially for those who are involved in the industry.
Yes, Madam Chair.
Kasama ba yun doon sa pondo na yun? So kung ibabawas pa sila, wala nang maiiwan sa RH, sa health centers.
Yung condoms po, may separate budget under the HIV alongside the communicable disease.
That's for the HIV program.
Opo.
Yeah,
So
but
it's-
we have condoms for the WIPs and separate condoms for the RH.
Yes po.
So yung WIPs, magkano yung kanilang funding for condoms?
Ma'am, magkasama lang po. Kasama dun sa communicable disease line item.
So how much is that?
Can I just get the date?
Sorry. Yeah, I think it should be separated because for the WIPs, they don't fall under the category of infectious diseases. That will be too discriminatory for our women. WIPs are the women in prostitution. Hindi pwedeng yung kanilang commodity will be lodged under the HIV control program. Kasi that's, yes.
Yes, ma'am. Madam Chair, I think what Yusek Bev was discussing was our integration or the procurement process. We make it as a part of the HIV, kung condom, HIV, WIP, at saka for RH
Okay, but
purposes.
I'm actually asking for the specific budget, not the manner of procurement. Magkano yung budget ng condoms for HIV? Magkano yung budget ng condoms for WIPs? Magkano naman ang sa commodities ng family planning?
So, ma'am, hindi po naka-separate ngayon yung for WIP sa amin. So, meron kaming total.
So where is it lodged? Sa communicable disease.
Yes, ma'am.
Yeah, I believe that's if the Honorable Secretary can please correct that. We don't want being masyadong masakit. Masyadong masakit sa ating mga kababaihan na napilitan sa industriyang yon. At parang it will add on to the stigma that they're getting. Okay. And moving forward, can the Honorable Secretary or ASEC DevCo update us with regards to RH commodities? Kasi medyo, I'm not referring only to those to the singles, especially yung mga mag-asawa. Okay. The next issue is we actually saw the updates, and Yusek Lilibeth David is very much aware of this. Hearing from the congressman earlier, ang dami kasi nagtatanong, ilan na ba yung health facilities? Bumalik kasi, nakita ko sa figures niya. If you remember, the benchmark when you say number of RHUs or number of hospitals, devolved hospitals, number of DOH hospitals na nabigyan ng HFEP, before the benchmark was not the number of facilities. Kasi ang mangyayari nga, like RHUs, kung sasabihin mo yung number, parang ang dami, pero yung iba pala puro repair. May ibang RHUs na yearly nakakatanggap sila. So when we talk about accomplishment, it should not be the number of facilities given funds. It should be, let's say, the number of RHUs completely functional. Ano yung target? Ilan yung na-accomplish? Para alam natin magkano pang kailangan na pera. And we can also move forward. Kunyari, ang number of functional RHUs established for 2022 is 100. Then 2023, naging 101 lang siya. Malamang yung pera na ubos sa repair. And we don't want this. We want the value for money. So, punta tayo sa functionality, not the number of facilities that accepted repair or construction. Moving forward, yung atin namang database. Because earlier, we were discussing that approximately more than 500 million of budget from HFEP was allocated for the repair of regional offices and the central office. I do agree na kailangan naman talaga yung mga opisina. But can the DOH create a separate database para yun? And then how many years do you expect to have that finished? Tsaka separate din yung benchmark doon. Ganun din kung pwede yung warehouses. So how many warehouses do you need for the whole country for health commodities? Ilan yung tapos na? Ilan yung mapupondohan for 2023? Kailan ito matatapos lahat? And please add there, pag newly constructed, kailan ka pwedeng mag-request ng repair? Kasi pag newly constructed, hindi pwedeng pagka next year, pondo tayo ng pondo. Just to align and to streamline resources. My next concern, Madam Chair, Your Honors, is the PPP, the public-private partnerships. We have been hearing from our colleagues the issues on dialysis, diba sabi na ganun. What's the stand of the Department of Health on PPP with regards to health services?
Madam Secretary.
Yes, Madam Chair. We are very much open to the public-private partnership among or for our health services. Actually, right now, there are specific hospitals in the country engaged through PPP for their services. Like other hospitals have their dialysis units through PPP. Some have their ICU services through PPP.
May dilemma kasi with that is it will make health services expensive. If you look at the context, nagiging PPP siya, pero yung manpower, yung infra, kuryente, tubig, gobyerno ang nagpro-provide. Magkano lang ang binibigay sa government hospital? Minsan 100 pesos per session. And the burden is passed on to the patients. Why don't we instead put this under HFEP? Kasi pag nag-PPP ka doon, ang kawawa, yung taong bayan pa rin. The PhilHealth reimbursement goes there. Hindi kasi siya malaki. Siguro for big ticket items like a heart transplant facility, baka pwede doon. Or let's say a laboratory na talagang medyo extensive, then baka pwede mag-PPP. But for basic services, maybe the department can look into this. Kasi sa laki ng HFEP, dapat hindi siya naka-PPP. Because the income, instead of going to the government hospital, goes to the private provider, hindi naiikot. Yung PhilHealth, instead na maiikot ng hospital, napupunta dito sa negosyante. Then yung manpower at yung capital mostly na ginagamit ng negosyante, gobyerno naman. Maybe you can review this. Because the LGUs, especially the LGUs, o pagpalagay na natin, if DOH will be doing this, then the HFEP budget for the DOH hospitals can instead be given to the devolved institutions para hindi PPP ang services sa devolved institutions, especially dialysis. Okay. Last two items. Yes, Madam Chair. Last two items, Madam Chair, is ang naririnig kasi namin palagi with the previous secretary, pagkausapin ng price ceiling, palaging tinutulak sa Malacanang or sa Office of the President. So with monkeypox, with COVID, with other infectious diseases, with other calamities happening, will the DOH be implementing price ceiling? Especially for, let's say, if you have leptospirosis, yung doxycycline, kayo na ba mag-implement? Ngayong may monkeypox, the antivirals, kayo ba? Testing ng monkeypox, kayo ba? The new modalities for treatment for COVID, magkakaroon ba tayo ng price ceiling?
Do you still have another question?
Last comment lang. Yun lang the last question and then I just have one comment.
Right, Madam Secretary.
Yes, Madam Chair. Actually, we do implement price ceilings, price caps, especially now that we have a public health emergency. We did price caps for testing, kits, and for the other commodities. But definitely for us to be able to bring down prices and regulate it, we're going to explore the possibility of working with the other sectors also for this price ceiling, Madam.
What other sectors, Honorable Secretary?
ETI and the other sectors, Madam Chair.
Yeah, kasi nagiging late kasi when the price ceiling on testing came, matagal na siya naging 8.5. While other countries, the price ceiling was around $20. So that's yun lang kung pwede, yung mga, mahal kasi masyado yung ating anti-COVID medications compared to other countries. Not a question, Madam Chair, but just a comment. Can the department possibly look into, I'm hearing allegations that the procurement of equipments in Baguio General Hospital is somewhat high compared to the others. Can you look into this? And if the circumstance warrants, then I'm very much willing to initiate an investigation. Thank you very much.
And that was your last question. Madam Secretary.
Yes, Madam Chair, we thank Congresswoman Garin for all the recommendations, and we commit to providing action specifically on this last item. We will instruct our USEC Nestor Santiago to investigate or to assess and evaluate this specific item, Madam Chair.
Swerte ni Rep. Garin, nakatulog ang timekeeper. Next, interpellate Rep. Lagman.
Madam Chair, I would just like to reiterate my pending requests for the Department of Health to submit under a separate classification the appropriations for family planning, RH services and facilities, and commodities. And it should not be embedded anymore in the traditional family health, immunization, nutrition, and responsible parenting. And please submit to us a more adequate appropriation. You would recall that in 2013, the year when the RH law was first implemented, the appropriation was no less than 4 billion pesos. You can check your records on that. Now, I have just one curious question, Madam Chair, if I may.
Yes, please.
In a group of 100 patients, or for every 100 patients, how many would go to the hospital for basic care services or treatment? Do you have any data on that?
Madam Secretary, utilization rate for any, no?
For every 100 patients, how many would go to the hospital for basic care?
Is this, so there are two measures, Rep. Lagman, whether in a hospital, or any facility. So this is for curative. Okay, so if you have the NDHS number for seeking care when needed in the last 30 days or in the last year, I believe yun yung dalawang measures, NDHS.
Yes, Madam Chair, based from the National Demographic Health Survey recent, 4 out of 100 would require inpatient services, and 96% or 96 out of the 100 would require outpatient services.
No. My question is, how many out of 100 would require basic care services? Whether they are confined or outside of the hospital.
I believe, Rep. Lagman, the answer is for hospital care, it's for every 100 individuals. And for
for basic services?
For hospital treatment.
No, for basic healthcare services.
So, meaning in a health center, for example.
Let me just explain my question. Now, can I just explain my question? I am asking that because I would like to find the ratio of how many would go to a hospital or health facility for basic care services and how many would go there for special treatment or specialty hospital treatment.
Madam Secretary.
Yes, Madam Chair. So, based from the recent National Demographic and Health Survey, we say that 4 out of the 100 would require the inpatient service, and that may be part of the special service or highly technical service.
4 out
Yes.
of 100.
And if we say that, we therefore assume that the other 96 of the 100 would sometime or another require these basic services that we say, like we define basic services as not just consulting for an illness, but also getting family planning, getting immunized, and the other programs.
Just to distinguish those going there for non-specialty diseases like heart, kidney, lung, etc. So 4 would go to specialty and 96 would go to basic care. Consequently, there is no need to prioritize the construction and development of specialty hospitals identical to the health, to the heart center, to the lung center, and the kidney center. Because what should be prioritized should be the basic healthcare services for our people. And because they are the ones more numerous. Is that correct?
Secretary?
Yes, Madam Chair. Honorable Congressman Lagman, we agree with you that primary care is really essential for our individuals, and it's the backbone of our universal health care. But this NDHS survey has been done of late or recently. So we still have our patients who have already chronic conditions as of this time. So we balance off by having also these highly specialized services. But agree with you that we should focus also more on our primary care services.
It's hard to balance 96 versus 4. Thank you.
Salamat, Rep. Lagman. Hihirit na lang ako ng promise 2 short questions. For PhilHealth, what is your current reserve fund balance? Maybe as of June 30, because I believe you do this every 6 months. Magkano po ang balance ng reserves ninyo? Latest figure po?
Madam Chairperson, maybe we request that we recognize
4 versus 96.
Attorney Santos?
Madam Chairperson, as of June 30, 2022, the reserve fund is 188.4 billion, Madam Chairperson.
188.4 billion. And what is the minimum requirement as provided by the law?
2 years.
Madam Chairperson, the minimum requirement provided by law is that we have good funds or enough funds to pay our obligations for 2 years.
For 2 years. And the minimum required is 6 months. Tama ba?
6 months. Yes, sir.
Tama? 6 months of minimum, you have 2 years. So again, I reiterate my point earlier that it is in the pink of health. Buhay na buhay ang PhilHealth. Salamat. And last question, sa mental health, ano yung total budget? I believe it's 1 billion. Napag-usapan natin kanina, drugs lang. But entire program, the budget is 1 billion. Ilan po ang manpower ng DOH sa ngayon for the mental health program?
Yusek Beverly Ho will answer, Madam Chair.
Yusek Bev.
Ma'am, we currently have around 14 people for mental health, specifically managing the program. And then if you would consider the entire health promotion team, which manages the 7 priority areas, including mental health. So you can add perhaps another 7 to 8 people who's supporting social behavior change communication, healthy schools na mental health, and healthy communities na mental health.
So 14 plus 7,
yes,
about
around
21 for the entire country.
For central office, because we now have bigger teams in regional offices, even for health promotion and program.
Yeah, kindly submit to me for the entire country, including those deployed at the regional offices.
Thank you.
So, all right. Record-breaking po ang DOH. Sumabot tayo ng 7:42. We started at 9:40. So, marami tayong napag-usapan ngayong araw. Obviously, maraming interesado sa problema ng kalusugan. Pasensya na po sa napakaraming pagtatanong sa inyo. But we are here just to make sure that you have the resources that you need and the resources that you can adequately absorb. So with that, of course, I thank all of you. Kayo po ay naging frontliners in the last 2.5 years. So on behalf of all my colleagues, we thank you for all that you did for the country. At sana po pagtulong-tulungan natin ang budget ng DOH family. And with that, Do I hear a motion to terminate the budget hearing?
Madam Chair, I move that we terminate the consideration of the proposed budget of the Department of Health. Second
Second the motion, Madam Chair.
Okay, duly seconded by Rep. Nika Ko. The motion is carried. Do I hear a motion?
Move to adjourn, Madam Chair.
Second the motion.
Duly seconded by Rep. Nika Ko. The budget briefing is adjourned. And we'll resume on Tuesday, September 13, 2022 at 9 a.m. Tuesday? Tomorrow.